shirt together, we're polishing up our act. And if you've ever been held down before, I know you refuse to be held down anymore. Well, don't you let nothing, nothing stand in your way. I want y'all to listen, listen to every word I say, every word I say. Ain't no stopping us now. We're on the move. Ain't no stopping us now. We got the groove. Ain't no stopping us now.
Good morning, everyone, and welcome to the 4th Annual Wisconsin Black Maternal and Child Health Summit. My name is Lisa Payton, founder, CEO, and president of the Foundation for Black Women's Wellness, where we work every day to empower a generation of well Black women and to elevate Black women's health as a public health priority. I'm so excited to be here today with the mighty members of the Black Maternal and Child Health Alliance of Dane County and our distinguished co-chair emeritus, Dr. Tiffany Green. We are so proud to greet you this morning for the 4th consecutive year and to host today's event on the heels of Black Maternal Health Week, as we welcome hundreds of you from across Wisconsin and over 15 states across the United States of America. In fact, you all, we are so thrilled that over 600 people registered for this year's event as we continue, to watch this forum grow into one of the leading spaces in our state and our nation to inspire change, accountability, and action for transforming Black maternal and child health. We gather here today in the tradition of our ancestors and the great Black matriarchs and midwives and civil rights leaders and social justice activists who paved the way before us, and to commit, like they did, to building our collective power to secure reproductive justice. In putting together this year's summit, we intentionally framed our theme and our content in the context of reproductive justice, a movement founded by Black women, for all women, as an act of self-determination to declare our power and our autonomy to govern our own bodies, to direct our own lives in the ways we see fit, and to build a thriving future we and our families and our babies and our communities deserve. You all know the basic tenets of reproductive justice are very clear, defined as the right to have a child, the right to not have a child, and the right to parent the children we do choose to have in safe and healthy environments. And as simple and fundamental as that is, we know that those basic tenets are not yet secure for Black women and birthing people as we continue to face threats to our ability to secure the care we deserve, to survive a pregnancy or a birth, to celebrate our baby's first birthday, or to make our own choices about our sexual and reproductive health. But we also know that the power and the promise to change these injustices rest in our own hands, in the hands of everyone here today. That power and promise will be exemplified here today, and I'm so excited by the incredible speakers and panelists we've assembled from across the country who represent a diversity of voices, perspectives, and solutions as birth workers, advocates, physicians, nonprofit leaders and founders, social entrepreneurs, artists, activists, and even filmmakers. Filmmakers are in the house today, all working together toward one goal, and that is to secure our lives and our freedom. What a privilege it is to offer up this space as an extension of the work of the Foundation for Black Women's Wellness and the Black Maternal and Child Health Alliance, as we continue to drive greater accountability, deeper investments that are translating into more Black mothers and birthing people receiving the quality, respectful care, community resources they need to experience healthy births healthy babies, healthy lives, and healthy communities. And to do that work in partnership with so many others, particularly with the Dane County Health Council, who is our sponsor and our partner and our biggest ally in this work, who we partner with now for 6 years intentionally to create and implement solutions that work. Solutions like the Saving Our Babies initiative and Connect RX Wisconsin, which we co-designed together, that are transforming perinatal care in our county for Black mothers and modeling how it can be done for our state and other areas. We're mobilizing and centering Black doulas and community health workers as central and vital to effective care and showing how to integrate them in the care continuum and paying them equitably as providers and demonstrating the power of partnership and collaboration along the way. We're so proud of this work. Together, we're turning the tide. We are turning the tide. And in the wise words of McFadden and Whitehead, whose timeless R&B hit, we know you recognized at the top of the hour, there ain't no stopping us now. We're on the move. So friends, let's keep building. And now I'd like to introduce Dr. Tiffany Green, co-chair of the Black Maternal and Child Health Alliance of Dane County, to offer words of welcome to you. And Dr. Green, I'm going to give you the honor of introducing yourself because your bio is so illustrious, I could never do it justice, but we are so proud to stand with you, work with you, to watch you break down barriers and to fight the good fight for all Black women and birthing people across Wisconsin and the United States. Welcome, Dr. Green.
Thank you, Lisa. I have to say, y'all, I feel a little bit emotional today. We've been doing this. This is what, our 4th year, and it's always such an amazing feeling to be in a room with Black women that are about that life. I don't know about y'all, but I'm just feeling so emotional seeing y'all here today. Welcome, welcome. My name is Tiffany Green. I'm an economist. I'm a population health scientist and a full spectrum reproductive health equity scholar. I am associate professor of obstetrics and gynecology and population health at UW-Madison. And my work really focuses on understanding the causes and consequences of racial inequities in birth outcomes. I want to understand why we have the worst reproductive health outcomes, and I want to know better how we can fix it. And more than that, as many of you know, I'm a mama of 2 little boys that I adore and keep me on my toes. So I want to make sure I mention that. We're here today to celebrate an amazing, amazing event. I am here. I am the past chair emeritus of the Black Maternal and Child Health Alliance. If you're in the Alliance and you're in the house now, please raise your hand, give us a little wave so people know who you are. I see a couple of people. I see you, Adrian. It has been such an honor and privilege and joy to lead these amazing women. I see you, Miss Carla. and we continue to keep doing amazing work individually and as a collective. Even though I'm emeritus, as Lisa will tell you, I still show up as I show up here. And we try to always make clear that we are not doing work about us without us, right? And just reflecting on the theme today, what does it mean to build our collective power to secure reproductive justice? Lisa broke it down already about what reproductive justice is, the human right to maintain our bodily autonomy, to get pregnant, not get pregnant, and stay pregnant, and to be able to parent our children safely. And let's be very clear so that there is no misunderstanding. This work is grounded in the experiences of Black women. There is no reproductive justice without Black women, and it centers the most vulnerable among us. One of the things I was reflecting on is that as Black women, we often live in 2 worlds. We're always either working in systems to create transformative change, and then other times we're trying to burn it all down to create something new. And it's challenging living in those worlds because we're trying to protect and save our babies, but we have to also rest and protect ourselves. And we do not always do a good job at that. So I want you to take the time today, Black women especially. I'm talking to y'all. I'm talking to me. We need to rest. We need to rest. Take out your braids, take out your hair. sit down and rest. And the way that we do that, I was looking at this race with my two boys the other day. Do you know that the 4x100 relay with Tamari David and TT Terry and Gabby Thomas and Shakari Richardson? And I'm watching them fly across the track and how they work together. One starts slowing down, the other picks up the baton. Next one slows down, we pick up the baton. That's the work that we have to do. Sometimes we are in these hard sprints, but when we get tired, one of our sisters is there to pick up the baton. So on behalf of the BMCHA, I invite you to take that breath, see this space as a place of rest, a place of renewal, and rest and healing so we can prioritize our babies, our families, our community, and most importantly, ourselves. All right, drop something in the chat if you want to make you can adhere to that promise today. All right. And now I want to thank our generous sponsor and partner in this work, of course, the Dane County Health Council, who is with us today, Renee Moe, the CEO of United Way of Dane County, and who is also one of the first members of the Dane County Health Council, is going to share some remarks with us to commemorate this occasion. Renee?
Thank you, Dr. Green. Thank you, Lisa. I'm also so inspired and feeling a little emotional today. It's amazing to see how far we've come together and to see all of you on the screen who've gotten us here. So just heartfelt gratitude from the Dane County Health Council. And we're really honored to be sponsors and partnering with the Foundation for Black Women's Wellness and the Black Maternal Child Health Alliance. So I'm so excited to welcome you all to the 4th annual summit. And as we come together under the theme of building our collective power to secure reproductive justice, it's so important to recognize this work cannot stand and should never be done alone. The Dane County Health Council is a self-organized group. We're comprised of healthcare providers, governmental entities, and nonprofit organizations. We work together to eliminate gaps and barriers to optimal health and to reduce health disparities and health outcomes. That's a really clear charge for our council. I actually had the great privilege of facilitating our focus area as way back as 2016. And when we first started this journey together, we decided on a common goal of eliminating inequities in low birth weight and infant mortality for babies born to Black birthing people in Dane County as part of the community health needs assessment. It's a requirement for our healthcare systems to do that, and we're so lucky to have such innovative and forward-thinking leaders in our healthcare systems to really embrace this work and know that we need to do that collectively. We knew we needed to hear from the community and make sure that Black women were centered in this work. And we hear over and over again, nothing about us without us. And we're so happy and honored to follow so many great leaders in our community. Since 2018, the Dane County Health Council has been engaged and actively working alongside the Foundation for Black Women's Wellness to implement and sustain Saving Our Babies and Connect RX Wisconsin. At our regularly scheduled meetings, it is a frequent reminder and really the lens by which we do all of our work, nothing about us without us, as Dr. Green said, as I mentioned. And I just wanted to give a quick shout out to a few of you. I know there's so many on these screens who are deeply entrenched, but Lisa Payton, your work is so inspirational. Dr. Green, Annette Miller, Uchena Jones, Sheree, I see you, Felicia, I see you, Ariel, all of you leading in your own ways. And again, all of us at the Health Council are honored to follow and really listen and tune in and make the changes in our systems that we can all thrive together. We know it's our collective responsibility to protect and secure the lives of Black mothers and their babies, and we must stand united in our efforts to dismantle systems of oppression and create a future where every person has access to the care and resources they need to thrive. We're so proud of that work we've accomplished over the last 6 years, and we prioritize Black maternal and child health, and we know there is so much more to be done. Today, you're going to hear amazing stories of the work that's being done, and a lot of the work that we know is common sense that we just haven't integrated into some of these systems that exist. So we know that preliminary data from our Saving Our Babies and Connect RX initiatives shows that and verifies what we know, that doulas are so critical to Black birthing families as it relates to their birthing outcomes. Additionally, how when social determinants of health needs are met, we know that also leads to healthier outcomes. And at United Way, we've been working on education and housing and health and belonging for over our 100-year history. And we've been naming racial disparities in the work for 4 decades. But to be actually working side by side and to follow great leaders to dismantle some of those systems and create new ways while disrupting those internal systems is really powerful work. It's some of the most inspirational, important work that I've been a part of in my 25 years. And I'm just so honored to represent that collective. The urgency of the work cannot be understated, and we must continue to push forward to ensure the well-being of Black mothers, birthing people, and their babies. So on this day, I would like to take the time to acknowledge and uplift the tireless work and leadership of Black women in driving solutions and advocating for change in the reproductive justice movement. This space is filled with doulas, birth workers, and advocates from all backgrounds who come together with a shared goal of creating a more just and equitable world for all of us. Let us be inspired by the power of our collective voices and our shared commitment to justice and equity. And special thanks to the incredible, tireless work of the Foundation for Black Women's Wellness and the Black Maternal Health Child Alliance. Together, we can build that future for Black families in which will lift all of our communities. Thank you for this important work. Thanks for all you do. And let us continue to push forward with determination, compassion, and hope. This is an important day, a day of rest, a day for inspiration, and we're honored to be a part of it.
Thank you so much, Renee, for your continued support of this life-saving work. Next, I'd like to invite Queen Ariel Robbins, who is the Program Director for the Dane County Health Council. She's going to share some remarks about the work that's being done as a result of the cross-sector partnerships and leadership of Black women in this work. Ariel?
Thank you, Dr. Green. Good morning and welcome, everyone. This year marks 6 years, I'll just say it again, 6 years since the Dane County Health Council joined forces with our partners, the Foundation for Black Women's Wellness, and our unprecedented multi-sector collaborative partnership to address the long-standing Black maternal and child health inequities that have plagued our community for decades. This month, we are celebrating the 2-year anniversary of the launch of ConnectRx Wisconsin, our community clinic partnership that is infusing community health workers and community-based doulas as formal maternal care team members, providing life-saving care and support to our Black families across Dane County. This milestone signifies our collaborative's continued commitment to reproductive justice by trusting Black leaders, investing in Black birth workers, and continuing to shape and evolve maternal care delivery in our community. Key strategies of our work revolve around centering Black families, diversifying maternal care teams, and rebuilding trust between clinic and community. This approach helps ensure that we continue to listen to Black women's needs and desires regarding their healthcare and birthing needs, and that we advocate for and protect Black women inside and outside of the delivery room. Thank you to our many partners in this work. I want to extend a special thank you to the Foundation for Black Women's Wellness for providing Black-centered leadership and using your unique expertise, as these have been instrumental in supporting systems and gaining greater insight into the root causes of these inequities through the publication of the Saving Our Babies report. And also for using your platform to continue to provide education and space for the Black reproductive justice movement to flourish and thrive. The Saving Our Babies initiative is demonstrating what is possible when you work across sectors and trust the community most impacted to co-create solutions that meet the needs of the families that we serve. Collaboration, investment, and trust will continue to be paramount as we forge our path forward to continue to elevate the message that excellent care must be the standard for our Black birthing community members. If this is your first time attending the summit, get ready for what's sure to be an inspiring, uplifting, moving experience. And if you've attended before, you already know. Enjoy, and thank you.
Thank you so much, Ariel. You look stunningly beautiful this morning. By the way, I had to put that out in front of the audience. Thank you for bringing your glow, and it is an honor to work with you every single day and with the Dane County Health Council. Thank you, Dr. Green, and thank you so much, Renee Moe, the United Way, a tremendous partner and forerunner in this work, and the Dane County Health Council for being amongst the most powerful partners we could have in this collective work. Next, I'd like to invite to the virtual stage the wonderful Sheila Stubbs, our beloved Wisconsin State Representative for District 77, to share a few brief remarks and highlights of the work that she and colleagues are doing in our legislature to protect the lives of Black mothers and babies in our community and across our state. Good morning.
Good morning, founder, CEO, and president, my friend and our friend, Lisa Payton. God bless you and your family. first give an honor to God, who is the center of my life. I want to congratulate you, founder, CEO, and President Lisa Payton, and the board of directors, the Black Maternal and Child Health Alliance of Dane County. Congratulations on your 4th annual Wisconsin Black Maternal and Child Health Summit. I personally salute you and all the women and organizations across this country, across this county, across this state that continue to amplify the voices of Black women and promote Black health. Good morning, everyone. I am your friend, Wisconsin State Representative Sheila Stubbs. I serve as the 77th Assembly District Representative, which is comprised of the south and west parts of Madison, the village of Shorewood Hills, and 3 of our higher education institutions, which include Wisconsin flagship University of Wisconsin-Madison, the University of Wisconsin Hospitals and Clinics, Edgewood College, and Madison College Goodman South Campus. I am the first African-American from Dane County to ever be elected to the Wisconsin State Assembly from Dane County. I broke, I shattered, and I shifted 170 years of history. And because I'm here, you are here. I am a pastor. I'm a proud member of Delta Sigma Theta Sorority Incorporated, Madison Alumni Chapter. I'm a mother, I'm a grandmother, but I'm a Black woman, and I'm a proud and well Black woman. So today we gather to discuss Black maternal and child health because Wisconsin is a state of profound racial disparities, especially surrounding pregnancy and childbirth. We seek to address these disparities by transforming our healthcare systems into spaces where the care of Black mothers and children is a priority. In Wisconsin, the state that I love, the state that I live in, Black mothers are 5 times more likely to die from childbirth or pregnancy than white counterparts. Shameful, unacceptable. The Center for Disease Control and Prevention, CDC, tells us that 80% of pregnancy-related deaths are preventable, which makes it even more urgent that we fight for concerns of Black mothers to be heard and to be addressed. Wisconsin also has some of the highest racial disparities for infant mortality and morbidity. Black infants are 3 times more likely to die before they reach the age of 1. Unacceptable. Because this is an injustice and it is preventable. I myself know what it means to be a Black mother in this state. And I worried about not just my own health, but as a mother, I worried about the health of my child and the health of other mothers and children and Black mothers and children across the state and how we are at risk. This is why I worked with the Foundation of Black Women Wellness, the Wisconsin Alliance for Women's Health, the Harambe Village Doulas, Black Mothers, Barone Calabash, the Wisconsin Doulas of Color Collective, to introduce a package of bills, a Wisconsin Birth Equity Act called BAE in 2021. And I will be introducing these bills again and more bills as you continue to do the work and find that there are other bills that we need to amplify across the state. I am passionate about passing a robust set of policies that will protect the lives of countless Black mothers and babies by addressing specific areas of improvement in our healthcare system and eliminating the harmful and widespread racial disparities and inequities that put our lives as Black mothers and Black babies at risk. I want to applaud the work of the community partners in our state who work daily to improve Black maternal and infant health and uproot the pervasive racial bias in our healthcare system. Your infinite ingenuity, unwavering strength, and deep love for Black mothers and children is driving force behind this movement. So on today at this summit, we gather together a powerful group of advocates, activists, change mothers, those that are in this cause. We are Black mothers, birth workers, community members, leaders in the movement for Black maternal, infant wellness, and reproductive justice in Wisconsin. United is our purpose. We hold a collective power to confront the daunting racial disparities in our state and pave the way to a safer, healthier life for all Black Wisconsinites, starting with pregnancy and birth. And as I close, in the words of someone that I dearly loved, Dr. Maya Angelou, and I quote, "Each time a woman stands up for herself, without knowing it possibly, without claiming it, she stands up for all women." God bless you. God bless the state of Wisconsin, and God bless these United States of America. Thank you.
Oh my goodness. Thank you, Representative Stubbs. Y'all, Representative Stubbs can be trusted to come in and light the place on fire, take us to church, evangelize about all the things that are so important in our state. I'm so fired up. I'm losing my place in my notes. Sheila Stubbs, you are a champion. You are a bright light. Wisconsin is grateful to have you. We are blessed to have you as a partner. Thank you for always pushing the door down, making a way. And I don't know if you feel what I feel. Yes, Queen, in the chat. We have powerful advocacy in our state. And we want to thank you, Representative Stubbs, for leading the way. Oh, so grateful for you and your relentless leadership. And now please pause with me for a very special message from Wisconsin Governor Tony Evers.
Hey there, folks. Governor Tony Evers here. Thank you for the invitation to join you today and welcome to the 4th Annual Black Maternal and Child Health Summit. It's no secret that here in the state of Wisconsin, we have alarming disparities in health outcomes in maternal and infant health, especially for Black women and babies. For example, we know that in Wisconsin, Black mothers are significantly more likely than their white peers to die from complications of pregnancy and childbirth, and Black infants are 3 times more likely to die than white infants. Folks, this is shameful and unacceptable. It underscores the urgent need to improve maternal health outcomes statewide. In addition to fighting for Badger Care expansion, which we know would help thousands of Wisconsinites get connected to critical healthcare coverage, I've also included our Healthy Moms, Healthy Babies initiatives in all 3 state budgets I've introduced. This initiative would award grants for maternal and infant mortality prevention, expand Medicaid postpartum coverage to 1 year, ensure greater access to newborn screenings, and address other contributing factors to maternal and infant health in the state of Wisconsin. Unfortunately, Republican lawmakers have removed these provisions year after year after year. In fact, this session, there was a bipartisan bill to expand postpartum coverage to 1 year. It passed 1 house, but not the other, and Republicans couldn't get it done. That's why this summit and the work being done by organizations like the Foundation for Black Women's Wellness and the Black Maternal and Child Health Alliance are so important. And this year's theme, Building Our Collective Power to Secure Reproductive Justice, is more relevant now than ever. Every Wisconsinite deserves to be able to access the health care they need when they need it, and that includes reproductive health care. And I'm glad to say we have some good news in this arena. Last summer, the FDA approved the first daily oral contraceptive pill for use without the prescription, the O-pill. Last month, I directed the Wisconsin Department of Health Services to issue a standing order that will make sure folks on Badger Care can access the O-pill without an appointment and at no out-of-pocket costs. This is a big deal, folks. Healthcare shouldn't be a privilege afforded only to the healthy and wealthy, and this is an exciting milestone in our work to protect and expand reproductive freedom in Wisconsin. You have my word. We're going to keep building on this work to defend and protect reproductive freedom, support moms and babies, and to do everything we can to address health disparities and build healthier families and communities. So with that, thank you for all your hard work and for putting on this incredible event again this year. Take care.
Wow. Thank you, Governor Evers, for your steadfast leadership, support, your advancements in Black maternal and child health, reproductive justice. You've been a true partner. I want to say that on the record, that our governor has been a true partner, a true advocate for Black women's health, for Black maternal and child health. And we've been proud as the Foundation for Black Women's Wellness to support and work with our governor's office on his proposals and budgets for maternal and infant health in Wisconsin. And we will continue to do that important work. So now join me again in welcoming back to the stage Dr. Tiffany Green, our resident expert, to share more on why we are in this fight to secure reproductive justice in Wisconsin as we prepare for our upcoming morning national panel. Welcome back, Dr. Green.
Sorry, my PhD is not in technology, y'all. I'm here. All right. I'm here to really talk a little bit about the data. And a lot of times data can seem really disheartening, but I'm really happy to say that despite the challenges that we're facing, I think there are a lot of reasons to have hope about reproductive health in the upcoming years. I always start with grounding ourselves in reproductive justice because reproductive justice is grounded in Black women's demands. This is a picture of the full page ad that Black women ran, demanding that our government give us healthcare free of discrimination, have our needs taken within the context of our country. We've already talked about reproductive justice in general, but I want to talk first about the fact that there are a lot of barriers to our ability to get and stay pregnant or not be pregnant and raise our children in safety. One of the things that we find is that Black people have more difficulty conceiving and staying pregnant. And I want to keep in mind that this is a challenge that many people in this room may have faced. And I don't see you as just as data. This is people's real lives. And I want to honor that and not get lost in data, right? We know that we are 2 times as likely to report having trouble getting pregnant, higher rates of pregnancy loss, including miscarriage, and disparities in access to being able to have assisted reproductive technology. We also know that Black people experience more pregnancy-related health challenges, which many of us in this room know all too well in our professional lives. More likely to have higher rates of chronic disease. And again, this is not about individual behavior. It is about the society in which we live. Higher rates of pregnancy complications and higher rates of postpartum morbidity and mortality. This is one that's always hard for me to think about, but this is a chart showing that our babies are disproportionately represented in deaths. Our babies are about 15% of all babies born in the US every year, but about 28% of all deaths. And there's no other group for which more babies are overrepresented in deaths relative to births. And for me, again, these babies are not just numbers. These are people that are gone too soon that deserve to reach their first birthdays, as we've been hearing about before. We talk a lot about this in Wisconsin, and one of the reasons that I came back to Wisconsin, that I continue to remain here, is the fact that we haven't done a good job on moving the needle on infant mortality, that our babies simply are less likely than other groups to see their first birthdays. And unfortunately, 2020, the most recent data we have, we can see that Wisconsin has one of the highest Black infant mortality rates in the country. The only state that's higher now, where that rate is higher, is in Kansas, right? So we have a lot of work to do to move the needle on these outcomes. One of the important things that I like to think about, or I don't like to think about, but we talk a lot about maternal mortality, and that is a horrendous but rare outcome. And I want to say that because I know from my own work talking to people, and I know from what I hear on the ground that a lot of Black women and other birthing people are terrified of dying during pregnancy. And what I want to tell you is that yes, people die, but it is a very, very rare outcome. But this is the canary in the coal mine, understanding these serious conditions that happen during labor and delivery and postpartum. And in Wisconsin, Black birthing people have higher rates of severe pregnancy-related morbidity relative to all other groups in our state. And so I say that to say that this, again, is something we need, is rare, but we need to keep our eye on, because we need to make sure that we are getting the care that we deserve in hospitals so that we can thrive after labor and delivery. One of the things I talked about last year was COVID. So we saw increases in COVID-related deaths. Again, this is a rare outcome, but we saw increases in pregnancy-related mortality, very likely due to COVID, right? And what I can say is that what we know about COVID is that getting COVID is associated with more preterm birth, stillbirth, and mortality. I know a lot of the doctors and doulas can probably speak to that. We saw increased deaths in Wisconsin in particular among unvaccinated pregnant people. So when we talk about preventable deaths, one of those things is, are people having the protections they need? And we saw pregnant people dying and birthing people dying of COVID during 2021. And these vax rates are lowest among Black pregnant people. So what I will say is that it's really important to understand that these things are correlated with our ability to survive and thrive in pregnancy. We also saw that Black children were more likely to have lost a caregiver during COVID. But the good news is that we are not at the height of the pandemic. We're seeing far, far, far fewer hospitalizations, far fewer deaths in Wisconsin. And while we don't do as much tracking, we're seeing huge decreases in morbidity and mortality. We saw that vaccination likely prevented a lot of preterm births. And while there might be emerging long-term effects, I think that's very good news. So I want to make sure that we're not just talking about the downsides, but we're also talking about positive things. We also predicted last year, because of Dobbs, the Dobbs v. Jackson women's health decision that took away the right to abortion, that there were going to be, demographers, researchers were predicting that there were going to be jumps in pregnancy-related deaths. And these are not rates, these are numbers, right? But what I think is a positive thing, and I don't know if it's positive or it's just telling you the truth, is that we don't know, is complicated. And let me tell you why it's complicated. We know that prior to Dobbs, we know that not having access to abortion care is associated with poor outcomes, particularly among Black people. But we actually saw, contrary to our expectations, we saw actually more abortion care post-Dobbs. Now, it certainly was not in Wisconsin, where we had almost no care after the 19th century law kicked in, but we know that abortion funds, we know that doulas, or I think there are some doulas in this room, were putting in the work to make sure that people had access to this important form of healthcare. We don't know what it did to pregnancy-related mortality or whether it affected Black people differentially, but I'm happy to say that I and other people are trying to find out. As I said before, abortions decreased drastically after the ban. We also think that unintended births in Wisconsin increased. So when people did not have access to abortion care, they're having the births that they did not intend. And that is a part of reproductive justice. We don't know how it affected Black people in particular. But another thing that Governor Evers just brought up is the positive thing is that post-Dobbs, we now have over-the-counter birth control free for Badger Care recipients in 2024. And I think that is understanding the impacts of that is going to be very, very important. And given that because of structural racism, Black people are more likely to be on Medicaid or Badger Care, I can see very reasonable to think that that is going to disproportionately impact us if they so choose. And so we're working on a big post-Dobbs study in the United States. So I'm partnering with some other folks at other institutions in the United States, including the Sister Song Collective, to understand, to field a study called the Reproductive Health Equity an access study where we're trying to understand the impacts of post-ops policy, and we're centering Black people. We're centering disabled people. We're centering LGBTQIA people to understand the impacts of DOPS. So I won't have answers for you today. I won't have answers for you next year. But if Lisa, you have me back in 2 years, we'll know a lot more about how DOPS affected Black people in Wisconsin and affected Black people in the United States more broadly. And the goal is to really support reproductive autonomy and justice and personal decision-making. So stay tuned for that. We also have Medicaid disparities. We know that, as the governor just mentioned, that these expansions are linked to declines in Black pregnancy-related mortality. But unfortunately, Black people are more likely to live in states that are refusing to expand. Our legislature, Rep Stubb, there's not as much that you can do, but the legislature that we have is refusing to expand Medicaid up to 1 year. And the federal government has signaled that they are not likely to approve the proposed expansion up to 90 days instead of 60 days. And we know that a lot of the conditions that arise, that lead to maternal morbidity and mortality are coming past that 60 days. So that is, I think, an unfortunate issue, but I think staying the course and really advocating for our representatives to expand access to care, expand access to postpartum care in particular, is important. I also want to talk about some updates with birth cost recovery. Wisconsin is one of the only states that allows counties to pursue the recovery of Medicaid burden costs from non-custodial fathers. This is something that the Saving Our Babies report highlights as one of the things that community members identified as impeding parental bonding, impeding the ability of fathers to take care of their families. This also shows up in the Birth Equity Act, which Representative Stubbs just talks about. How can we address birth cost recovery? Here is one of the interviews that we did with participants talking about their experiences of birth cost recovery. We are focusing on Black families and their experiences of this policy in Wisconsin. And this participant is saying, well, if men didn't have this birthing fee right off top, that would make it a better relationship bonding for the mother, the father, and the child. Men would be able to do more, provide more, and it'd be just a healthy family overall. And so what we know is that Dane County suspended new birth cost recovery collections in 2020. I and my team did some work to try to understand what the impacts of this policy change was, and we found out that yes, it made that we had more child support received from the father to the birthing parent, and this was particularly true among Black dads. So this policy change, at least from our preliminary results, is showing that this had a disproportionately positive effect for Black families in particular. And of course, the great news is that Milwaukee County is not taking fathers to court for birth costs anymore. And Dane County is also forgiving back costs. So our team is really working hard to try to understand the effects of these policies and partner with organizations, particularly those serving Black people, to understand. We're also talking to Black families in Wisconsin to try to understand how this policy is affecting you, because it's not just data with big administrative data sets. The data is coming from our communities, and it was very important to me that our community's voice be heard for that. So if this applies to you, please do reach out to us. The link should be in the chat to participate, and we will, of course, compensate you for your time so that you can tell your story. I also want to give a special shout out to Carla Gaines and Dr. Beth McManus, who have led my community advisory board to advise us on our work on this policy, and also to keep us accountable to community. And I also want to emphasize here that where you work, where you live, where you sleep, where you get care also is so important. The Black Maternal Omnibus has also been reintroduced, and this is really a multifaceted policy trying to address the social determinants of health, medical care, and more. My understanding is that it does not look like it's going to pass this year, but again, we should keep our eye on that and the work of Lauren Underwood, who has been doing really powerful work to try to uplift Black mothers and birthing people and babies. And finally, I want to talk about something that is very relevant to Wisconsinites right now. I think there is a very big push towards, surprise, giving people money seems to help their outcomes, right? And so now there's projects going on in California, but now we have a project in that's going to be in Milwaukee, giving pregnant Black folks money to support positive birth outcomes. And so that link should be in the chat. If you are pregnant and you live in Milwaukee, particularly in certain areas, please go ahead and fill that out. You may be chosen to be in this lottery. And I think this is incredibly positive that we are really pushing to show people that giving folks money is what helps to improve birth outcomes. So just a little summary. We see very persistent reproductive health disparities. Those things are not going to change overnight. I think that the impacts of COVID and Dobbs are uncertain, but there's a lot of positive things happening, particularly for Black maternal health and Black reproductive health. And most important, we have the power. Don't forget that. Black women have always gotten things done, and we're going to continue to have the collective power to forge ahead for birth justice and reproductive justice. Thank you so much.
Thank you so much, Dr. Green. We never regret having you come on each year to give us the right framing, the broad perspective on the challenges and the opportunities. As Dr. Green noted, we are not just talking about what doesn't work, we are highlighting what does work, because we need solutions in our state and in all the states that you represent. We're so proud of your activist scholarship and leadership, Dr. Green. And of course, in 2 years, you will be back. The invitation is already extended to report on the outcomes of the research and the work that you are doing. I also want to highlight that as Dr. Green and team prepare to launch a guaranteed basic income program in Milwaukee, stay tuned for the extension of a guaranteed income project in Madison that was piloted by our mayor's office last year. There will be more information about how the city and the Foundation for Black Women's Wellness join forces to continue a guaranteed income project in Madison targeting Black mothers and birthing people. More to come on that this fall. There's so many powerful things today to talk about, to be proud of Black women's leadership, of our history and our tradition of leadership. We heard about the Momnibus package, which we encourage everyone to explore, the work of Representative Lauren Underwood, of Alma Adams, of Vice President Kamala Harris, so many Black women who have been leading the fight, the Black Mamas Matters Alliance, which is the reason that we have Black Maternal Health Week in the United States. This is work to be very proud of, and that is the energy and the positioning we're taking today, that we are drivers of change, of solutions, of things that work. And we are so happy to segue from Dr. Green to our first national expert panel of change makers and doers and innovators as we discuss the state of Black maternal and child health in the United States, where we are, and how we win the fight for reproductive justice. And with me this morning to co-moderate this panel is Adrienne Jones, a proud member of the Black Maternal and Child Health Alliance, a founding board member of the Foundation for Black Women's Wellness, and Director of Community Health Improvement at UW Health, one of our partners and Dane County Health Council members. Adrienne is here to introduce our speakers. Good morning, Adrienne.
Good morning, Lisa, and good morning, all the attendees that are in the virtual space. So good to see all of you here. We are fortunate to have with us 3 national experts and birth justice advocates to deepen our discussion and understanding of where we stand today and how we must act to secure the lives of Black mothers and babies. We know that in the United States, Black women and birthing people are 2 to 3 more times likely to die from pregnancy-related causes than our white counterparts, and that the lives of Black babies continue to be at risk We know that the conditions have intensified in the aftermath of COVID-19 and in the face of growing challenges to our reproductive freedom. But most importantly, we know that the leadership of Black women, like our guest today, is greater than the challenges that we will win this fight. This morning, our powerful panelists are Dr. Tara Major Kincaid, Kanika Harris, and Dr. Diamond Williams. Dr. Terry Kincaid, Major Kincaid, is a native of Baton Rouge, Louisiana. She is a double board certified neonatologist and pediatrician with well over 23 years of experience as a clinician in neonatology, pediatrics, health equity, perinatal health disparities, and neonatal perinatal palliative care. She recently launched a full-time career in the field of pediatric palliative care and hospice medicine, and currently serves as the associate professor of pediatrics in UT Health Houston, McGovern Medical School, Memorial Hermann Children's Hospital, and the medical director for pediatric palliative care. Dr. Kanika Harris currently serves as the Senior Director of Maternal Health for the Black Women's Health Imperative. She is a behavioral health scientist with a special focus in health equity, maternal health, and women's health. And she serves as a maternal health equity advisor for the state of Maryland and a public health expert for Lactation Commission in Washington, D.C. Our very own Dr. Diamond Williams is an inaugural Associate Dean for the Health Equity, Diversity, and Inclusion at the University of Wisconsin-Madison School of Nursing, and a member of the Black Maternal Health Alliance of Dane County. And as a trusted advisor to the White House, Dr. Williams is deeply committed to the development and promotion of strategic, cultural, relevant programs and policies that offer equitable opportunities to those often forgotten about or marginalized. I will kick us off with our first question. So to our illustrious, amazing panelists, tell us about yourselves and your current work in the Black maternal child health and reproductive justice space. And anyone can come off mute and kick us off.
Let's start with Dr. Major Kincaid. Good morning.
Good morning. Can you guys hear me okay?
Yes.
Can I just say I'm so excited? We haven't even started yet. And I just feel like, I mean, you guys are the high point of my day. I'm going to have to like get it together to be able to go to work tonight. I'll probably wake up all the babies. So
we are super excited to have you.
I'm super happy to be here. And my introduction to this space came with my sister. She was a preemie, born in 1968, born in a segregated hospital. I too was born in a segregated hospital in Louisiana. My mom had really high blood pressure as a young mother and had an experience with adverse birth outcomes. So that was my first introduction. But what really connected me to the space was being exposed to the statistic in medical school that a Black woman with a college degree was 2 times more likely to have an adverse birth outcome, even if she had insurance, even if she got prenatal care. And I was like, what? And so that was in 1994. And that is what led me to go on to get my master's in public health. And I began to do some work with the March of Dimes, which was my first introduction to the power of community stakeholders and advocacy and no work about us without us. And it really transformed my understanding of how powerful the work is we do outside of the walls of the hospital. So super excited to be here. People often think I'm an obstetrician, but I'm not. I take care of babies, and people say, well, what are you doing in this space? But you know, babies don't get here by themselves. They get here from birthing people, from moms, and I get to interact with them, families who come from communities who are impacted by structural racism. So super excited to be here and learn about some strategies. And I'm already encouraged to continue the work. I might just move to Wisconsin. I mean, actually.
Yes, come on.
Thanks for having me.
Thank you. Dr. Kanika Harris.
Absolutely. Good morning. I am so excited to be with these esteemed panelists and be in your presence. I'm super honored. Thank you for the invite. My story into this space is kind of multifaceted. So when I got my PhD at Michigan, I studied and was accepted into the program by Arlene Geronimus, who coined weathering and did all of her research on weathering. So I was in there taking a class. Timing and fertility specifically was the name of the class. And I also had to do training with her throughout my doctoral program. And I was just like, no, this isn't real, what you're saying. If we eat right and we do the right things, we'll be able to deal with these issues. And I was like, teenage pregnancy is a bad thing. And I just really didn't believe or buy into her concept of weathering. Lo and behold, here I am, um, pregnant with twins, getting ready to work on defending my dissertation, and I end up with a placental abruption and almost lose my life. And I lost my twins, and this was in 2010. And so when that happened, I was already trained as a doula. I had trained as a doula in Michigan in 2006, had been working with communities in Detroit for a really long time. And so I really thought if you had all the right things in place, I was eating right, I was exercising, I was doing all these things. I had a doula, I had a midwife that would protect me. Like I understand the statistics, but those people probably weren't eating right and doing the right things. And so having that happen to me just propelled me into a different space, a different viewpoint, vantage point of research, of activism, um, and just an expert in my own lived experience about how to move forward in the work. Um, and then how weathering also just can't be our only story, that how do we heal and move through things as well. But it was just ironic that I had ended up with that in that situation while I was being trained by Arlene Geronimus. So that's kind of my introduction into the space. It's very layered. I had been a doula and continue to do that work as well. I did go on to have 3 beautiful, healthy children, and I am still here. So I also don't want to end with that as well, but thank you.
Thank you. And I just want to say thank you for sharing your story. And we honor you in this space, and we also honor your twin babies.
Thank you.
So,
Thank
Dr. Diamond Williams.
Yes, thank you. Good morning, beautiful people. I don't think anybody is as honored to be on this panel as I am to be amongst all of you beautiful, amazing women. So shout out to you all for allowing me to share this space with you. It is just deeply appreciated, and much gratitude to the Foundation and the Alliance for the opportunity to just be here and serve today. So again, I'm Dr. Diamond D. Williams, Associate Dean for Health Equity, Diversity, and Inclusion here in Dane County at UW-Madison School of Nursing. And I think for me, my journey into the realm of Black maternal and child health and reproductive justice honestly really began as a passion for just addressing health disparities and fostering, these equitable opportunities that I saw at Howard University as an undergrad in Washington, D.C. So I started, to be very frank, Dr. Terry, like you, I thought I was going to be a neonatologist. That is what I was going to Howard for. And then that simply changed into this love and passion for public health. So I started interning with Planned Parenthood at Metropolitan Washington, D.C. and Northeast Washington, D.C. So if you all know about that space, you know that it too is subject to Black infant mortality, just fatalities, mortalities, everything you can think of in terms of health disparities. And though I fell in love with the concept of public health and wanting to contribute as a leader in that space, I knew that whatever I was going to do, I was going to make sure that Black maternal and child health was a part of my journey. And I think about my mom, who is my friend now, my best friend. When you're younger, they're not your little friends. But I think about her. She was a teenage mom, right? Getting pregnant with me at 15, having me at 16. And I just think about all of the things that she could have faced during that time, in terms of having me, right? Or having me and be healthy, or, having a life herself. So I think those are the things that really help me just kind of dig more deeper and be involved as much and as deeply as possible into the space of Black maternal and child health. So I will stop there, but just super passionate about this work. And I know that for me, there is still so much growing, that we will do together in this space as we work towards addressing these health disparities.
Thank you all so much for those introductory answers to our first question. And like many have said today, I'm sitting in this chair today feeling so moved, almost to tears. My heart is full. My spirit is full just to be in the presence of the energy that we are generating in this space today. There is so much hope. There's power after pain. We're hearing about losses. We're hearing about our mothers being born in segregated hospitals. That was my mother, my grandmother, my great-grandmother. We're hearing about how those experiences drove us to be change makers and inform this work today that we do. There is nothing more powerful than that, and you all epitomize that. And though Dr. Diamond, I'm from the other HU, we are sisters today from Howard and Hampton, and the powerful Black women scholars from those institutions who taught us about structural racism and gave us framing and grounding in our power to go forth into the world and to be the change makers that are showing up in these spaces today. So I just want to honor all of you, and not particularly, but especially Dr. Terry, who we got to at the last minute and said, can you come be with us today? We know you're busy, but we really need you. And you were too busy, but you said, for this, I will. So just want to thank you and Kanika and Dr. Diamond for already opening the day with so much beauty, power, and purpose. So with that, we're hosting today's event on the heels of Black Maternal Health Week, which we know is an observance that was founded by Black women leaders and birth justice advocates in 2018. Not that long ago, but look at how it has taken off, right? To illuminate Black maternal child health as a public health crisis that deserves investment. These efforts have supercharged national attention and action to this movement that we've been leading as Black women for over a century. It's not new work, but it's been supercharged and there's a momentum. What does this mean to you, and why is this movement so critical right now, Dr. Major Kincaid?
Yes, I was pondering that yesterday, just how significant it is that we're having this summit at such a time like this. And, I shared that I'm from Louisiana, but I practice in Texas. And those are very restrictive environments to practice in the maternal health space. I'll say that. And it's really, really hard. And so the reason this is so significant for me is that there's power in numbers, one, but there's power in our stories. There is power in our stories, and we amplify change just by sharing our stories. I love that Representative Stubblefield shared the quote from Maya, because even though we see all this data about the inequities, and even though we see all this data about the pain, Dr. Green shared the wins. And I know without a doubt that outcomes have been improved because of the work of Black birth workers, because of the work of community health workers, because of the work of doulas, because of the work of midwives, because Black Mamas Matter said, you know what, hold my mule. And that for me is so encouraging, especially when you're dealing with a lot of the embedded racism that is involved in the rural South, and laws that are embedded with inequity under the guise of equity. And so there is power in our stories. And if one of us shares our story, if one of us shows up with our face in those places, we are going to inspire change. So that's why it's so important to me that we're having this now with respect to this momentum. This is a week, yes, but it's a movement, it's a moment. It's not just this week. So I'm super excited to be here.
Thank you so much, Dr. Kanika.
Yeah, so I've been a part of Black Mamas Matter Alliance for a while, and then also was there for the first Black Maternal Health Week in 2018, the first Black Mamas Alliance conference. And so to see the movement grow from inception to where it is now is amazing. I think what's so amazing about the week is for many Black organizations that work in the maternal health space, it's our opportunity to go to the Hill and pound the pavement. So all of us had our tennis shoes on, we're in DC, we're on the Hill, we're talking, we're getting our voices heard, and we're really trying to move the momnibus, right? We haven't had much movement. We don't know what's going to happen in November. So it was really our opportunity to meet with senators like LaFonza Butler, Black female senator, and just tell her, like, how are we going to strategize to move this forward? So to see that type of momentum, to see that type of effort of all these Black organizations getting together, us just infiltrating every office on the Hill during Black Maternal Health Week, it's our time. And so I think that's what that states, is that it's our time. And because the movement is so great now, I love seeing all kinds of organizations scramble to represent and recognize Black Maternal Health Week, like getting the word out and just making sure more of us know about what's happening to us, that it's injustice, and that we need solutions.
Thank you so much, Dr. Diamond.
Yeah, so for me, and I echo what these lovely ladies have just said, but for me, Black Maternal Health Week really serves as this powerful platform, right, that spotlights the longstanding struggles and triumphs that we all have seen, Black women face in maternal health. And we are grateful that folks are recognizing this as a week, but honestly, like Dr. Terry said, it's not just a week, right? Like, this is Black birthing people reality that we see every single day, too often, too many times, all over the globe. But we're gonna be positive. I really see this as this, like, beacon of hope, right? And activism that really amplifies the voices of Black women who have been at the forefront of this movement for generations, right? And will continue to be, honestly. And for me, this moment is so critical because of a lot of reasons, but really it brings this overdue attention to the systemic inequities, that continue to endanger Black mothers and birthing people and babies, right? And babies. And I just believe that overall it's, this call for this systemic change that really ensures that we as Black women, other Black women in our lives, really receive the care and the attention and the support that we deserve, right? Before, during, and even after pregnancy. So that is what it means to me and why it's so critical right now.
Thank you. Thank you.
Yes, thank you. And I just want to lift the three of you up as very powerful change agents in this work. And so it's an honor to continue to hear your stories. The theme of this year's summit is building our collective power to secure reproductive justice. One of the basic tenets of the RJ movement, as established by Black women in 1994, is the right to have a child and to parent our children in safe and healthy environments. If you can speak to how the basic right for Black women and birthing folks to safely carry and birth a child has been threatened in the United States, and what we must do to secure this basic right. Dr. Kincaid.
Keep unmuting because I'm over here like,
It's okay.
Yeah, it's really interesting to be working in the maternal child health care space now post the Dobbs decision. I actually came out of private practice to go back. I felt like God was calling me to go back to academia to do pediatric palliative care and to work in this space. And then right after I came back to this job as a state employee in Texas, like this happened. I'm like, what is happening here? What are we doing now? So the reason why this is such an important issue is this whole discussion has been reduced to abortion care, but abortion care is only one aspect of reproductive health care and healthcare choices. And Black women, BIPOC populations, marginalized populations, we already were experiencing disparities and inequities with respect to access. We already didn't have enough providers that looked like us to take care of us. We already had to traverse maternity healthcare deserts. And so with this restrictive ruling in many of the states, we have caused more oppression to those who are already oppressed. And now we have geographic barriers and financial barriers that have to be traversed in a very short amount of time. And so for me, in a very real sense, my job is to help my families with shared decision-making. And you guys, every day I meet someone where we are talking about shared decision-making and they actually are not fully able to share in a decision that has been made about their body, about their future children, and about how they're going to care for their family. Somebody else has made that. And so now I'm coming on the other side, helping to navigate that. And it's a very, very tough spot to be in. It's a very tough spot to be in to address the gaps with the limited time people have to make decisions now when we already didn't have resources. And now in this limited time to make decisions, you don't have the financial resources maybe to get to a geographic location where you have broader reproductive choices. But for me, it's this concept of I am attempting to have collaborative decision-making with someone who actually does not have control over their body anymore. And it's a very real discussion that we need to have, that reproductive health choice is beyond abortion care. It's about the entirety of care to have autonomy over our bodies and our families and how we choose to raise our children.
Sorry, I like had to take take a beat before talking. That was incredibly powerful, and I appreciate you highlighting the importance of collective or shared decision making, especially as we think about what it looks like to fully embody reproductive justice and how we practice care and provide care. Dr. Harris.
Yes, we were all hit, of course, last year with the Dobbs ruling, and it felt pretty devastating, but we immediately went into action, right? So I feel like we've been coming up with some solutions. We've come up with over-the-counter contraception and other resources to help while we solve this issue, but we have to also remember, abortion is maternal health care. Abortion is reproductive health care. Abortion does save lives. And so that is what we need to keep in the forefront. And so me working in this space, realizing, as Dr. Terry is saying, like more of our rights and our ability and our autonomy are being stripped from us in this space. So the way I've been working in the space is really working on HBCU campuses, helping them thrive and ensure and educate them around their reproductive rights and also what's happening, but also recognizing that so many of us are having babies in college. One of our, while I did talk about weathering, and weathering has made many headlines in this maternal health landscape right now, there's also so much more research that Black researchers have also put out, like Cleopatra Caldwell and Leif Mullings, on our ability to cultivate social support and social resources. That's like one of our biggest strengths as Black women that we have access to. The research shows that social support is one of the highest indicators of health. And so really being able to rebuild that village for us, rebuild structure, information, resources, and support for young Black women, and teaching them how to do that as our anchor as we're working on the other side, trying to reverse some of those policies and doing some of those things. So that's my most immediate way that I've been able to respond to this crisis, and making sure that young Black women have the information to thrive, that they can spread this information to their families and communities and peers as well. And also learn how we bridge social support and resources for ourselves as our anchor and our army to fight what's going on in our everyday lives.
All right, this this one is still giving me the need to pause, and I appreciate you referencing the need for honestly comprehensive reproductive health care and the true understanding of reproductive rights. The Black Mamas Matter Alliance just reshared the Reproductive Bill of Rights. So I encourage folks to check that out. And you highlighted the importance of and the necessity of social support and connecting to resources. So I also want to give a huge shout out to our community health workers and doulas and all of those involved in the ConnectRx program, which in Wisconsin, specifically in Dane County, is really doing exactly that. Dr. Diamond?
Yeah, like many of you all here today, it makes me sick to my stomach. It makes me sick to my stomach that the right to safely carry and birth a child remains under threat for Black women. Yet, it is foundational to reproductive justice, but it remains under threat. And a lot of the things that we've, talked about already, structural racism, inadequate healthcare access, implicit bias within healthcare systems, within academic institutions, everywhere, really just continue to disproportionately affect us. And the high rates of maternal mortality and morbidity among Black women is just through the roof. And I think that, to start securing this basic right, we again must address systemic inequities, right? We have to advocate for comprehensive healthcare policies. We have to center and elevate the real life experiences of Black women in healthcare delivery. And we have to continue, and Adrienne, you just mentioned this, but we have to continue to investing in our community-based initiatives that really prioritize maternal health and well-being. And I will also say, we need more co-conspirators in this work, right? Like, we need people that look like us and people that don't, right? Like, this is not just a Black thing, right? This is not just Black women fighting for Black maternal health or reproductive justice. This is everybody in this all together because it impacts us all.
Oh, absolutely. Thank you for saying that, Dr. Diamond. I like calling you Dr. Diamond. We have many, many friends. We have many allies on this call. We have representatives of various organizations, local, state, nationally, and we want to acknowledge your presence here. We want to acknowledge the resources that you've been dropping in the chat since you've been here. We want to acknowledge those of you that we work with every single day, 365 days a year, to support this work, to amplify this work, and to support Black women in this work. We see you, we honor you. You're vital to this movement, and this movement has been powered as well by your support. For Black women in this call, I just want to chime in and endorse our community health workers, our doulas. We saw some shout outs going. Thank you, Adrienne, for shouting them out. They are the difference makers, you all, in the trenches in this community and across this country. I'm so excited, Dr. Kanika, that you're a doula as well as a national leader of policy and advocacy. We're in the house today, and it's inspired me. I think I just may become get my doula training going on. I've said that a couple of times, but I think the time is now. What a novel idea and an important idea, Dr. Harris, to do campus outreach. It was on an HBCU campus in my junior year of undergrad that I found myself in love and pregnant at 20 years old, just barely 20, from a very, very religious family where it wasn't easy to talk about pregnancy or other things. I knew I was going to get married, so that came quickly, but finding care was difficult as a student, as a scholar, to find in my town. And it was Planned Parenthood of Hampton, Virginia, where I went to get my pregnancy test, my first pap smear, and all the care that I needed to initiate taking care of a pregnancy, in my decision to keep my baby and to become a mom, while still finishing out my undergraduate education. So to all the young women who on this call who hear that uncommon story, you've got to start young, understanding what this movement is about and what comprehensive reproductive care means. Whatever your choices are, you have options and you deserve access to those things. It's a basic human right. And I proudly went on to have 5 healthy children. And life is good. And here we are in this work to ensure that all Black mothers have the same opportunity to make the choices that are right for them. Dr. Major Kincaid, as a physician, an advocate, an author who's been in this movement for decades, and we realize the royalty that you are in this movement in your royal blue today, who've witnessed firsthand, really the beauty and the devastation. You've witnessed the beauty in working with babies, the beauty and the devastation of Black birth outcomes. What concerns you most if you had to crystallize one thing about the current state of Black maternal and child health, and what in your mind is the most critical action that we have to take right now?
So I thought about this question. It's really hard to crystallize one thing. First, let me shout out my HBCU, since y'all keep shouting out y'all HBCUs. Let me just shout out any Prairie View A&M Panthers out there. Hey, y'all, hey, just had to get that out there. So a couple of things concern me, but if I had to name just 2 things, one is there's been a lot of attention to maternal mortality and not as much attention to those left behind. And in my work as a palliative care provider, I'm increasingly aware of the gaps for those who are left behind. So working in the NICU and doing palliative care, unfortunately, I meet somebody every week who is saying goodbye to their child in the NICU, a very wanted pregnancy. I also, unfortunately, have babies whose moms died in delivery, and I'm still there supporting the dad, the sibling, the grandparents, the aunts, the cousins, those left behind. And I really, really do applaud the work of Charles Johnson and the opportunity to see in the Aftershock movie, the Birth and Justice movie, the Birthing While Black documentary, the voices of those left behind. And so what I really, while we work to make sure that this is a conversation that one day none of us ever have to have, those who are left behind, we need to make sure we have adequate mental health resources for them. We have safe spaces to amplify their stories so they can talk about what happened to them, continue to talk about what really happened to them and what could have been prevented, because we know 80% of these cases can be prevented. And so that's one thing that really bothers me, those who are left behind, who are always surprised when I sit down and want to look them into their eyes and learn their story so that I can take a piece of that and carry it with me. The other thing that I think is really critical is to invest money in increasing the diversity in the pipeline. Yes, we cannot do this work by ourselves. We need our co-conspirators. We need our allies who are creating spaces and not co-opting the space. But you guys, let me say something. When I walk into the room, the energy often changes. I met with a family this week who's been here a couple of months who disclosed something to me. They didn't feel safe disclosing with anybody else. And I know when I walk into the room and I'm looking into the eyes of somebody who says, I see you, I got you, you're not crazy. Transparency happens, and we really, really can work to improve outcomes. And so we need to invest monies. We need to press on our government agencies. We need to make sure we have grants. We need to make sure we have funding for our doulas, for our community health workers, for our midwives, for our researchers, for our PAs, for our nursing, for our medical. We need everybody. We need everybody. We need funding for everybody to improve that diversity pipeline. And lastly, I'll just say, I love that Lisa put in the chat I had a supportive family, but I didn't have resources. And I was recently on a panel at Delta Days, at Delta Days with one of the leaders for Planned Parenthood, and she talked about this initiative to start Planned Parenthood chapters on HBCU campuses. And I thought, wow, that was something I had never thought about. And she talked about getting together and making sure we have resources and transparent resources and manuals to talk about comprehensive reproductive health care for beginning, middle, and end, for your preconception health, for your during, and for the after, but in a way that people can get it and we can stop the silence around this very real conversation on our entire reproductive health and starting it there. I could say one of the most fun activities I got to participate in with March of Dimes was a HBC. They had a bus that went to all the HBCUs in Texas, and we talked to about preconception health. And a lot of times we talked to just the football players. And so it was just really, really fun to be able to normalize that conversation. So those things, remember those who are left behind, make sure we have funding for additional training, and to make sure we have tangible, transparent, available resources for comprehensive reproductive health care.
Oh, I'm so glad we're recording today's, and I'm looking to see that I see the recording button going on. Team, I'm trusting that the record is rolling so we can come back and grab these solutions that we are being offered by our expert panel today. One thing to call out, we know, as you know, Dr. Major Kincaid, that studies have shown that the presence of Black doctors and providers and birth workers makes a life-saving difference in the perinatal journey and the birth outcomes of Black folks. We know that maternal deaths decrease, that dangerous births decrease when the provider is Black for Black patients. And that's something that we can't, tiptoe around. That's factual. And so all of us, whoever we are, recognizing what that means about the need to uproot racism or bias and discrimination and care, to train our workforces to know and understand how to be effective providers for all patients, and to do the simultaneous work of diversifying our healthcare workforce is crucial to saving Black mothers and babies. Adrian, turn it over to you.
Sorry, I just read the message that Antori Roberts put in the chat. And it looks like someone who was part of the ConnectRx program. So thank you for putting that in the chat. And I also, if we could just take at least 5 seconds just to honor the babies that have been left behind. I know many folks on this summit today have lost babies, and so I don't want to move forward without at least taking a few seconds to give it a moment of silence for that. Thank you. Dr. Harris, as Director of Maternal and Child Health for the Black Women's Health Imperative, working at the national level, and as a mother and doula, how would you describe the current state of Black maternal and child health across the United States? And what do we need to be focused most on right now?
That is such a tough question. How would I describe the state of Black maternal health? Yeah, I feel like, of course, we're in a state of crisis, but we're also in a state of awareness, like deep awareness. What that has created is a storm where, for the first time, we're seeing a negative population growth, in the sense that Black women, young Black women, are deciding not to have children, or are scared to have children, or they're going into birth very fearful. And so I feel like, how do we balance the statistics in the state of emergency with critical information to also help mothers or birthing people walking into this space, the most joyful time of your life, feel uplifted and feel happy and feel joyful, and not like they're on edge, So when we're saying things like, you've got to be your own advocate, when we're using words like you've got to fight, and a lot of our language is we got to fight, we got to fix this, we got to fight, fight, fight. And then when we hear those words and you're pregnant, they don't go together. They don't go together, right? It keeps us in a sustained experience of fight or flight throughout your pregnancy. Both pregnant person, mom and partner, are on edge, the moment they find out they're pregnant. And so that's what I'm seeing in my world. And how I'm working to combat that, again, is going about it a little differently. Recognizing, first I recognize that I'm from Howard. First, I recognize that our HBCUs are, we're hearing about the statistics that, if you have a Black doctor and you're a Black birthing person, your baby is more likely to survive, right? That's also in addition to that Black doctor has to be culturally congruent and also practice and be trained appropriately. So it's not just the color also has to come with the training, the resources, et cetera. With our HBCUs, we are divested. We're not churning out Black doctors, Black researchers. We don't have we don't have midwifery schools. We don't have schools of maternal health or programs of maternal health, and we don't have schools of public health. So there's so much missing in terms of our ability to be able to fight this problem and you can see the systematic divestment right there, right? We can't even churn out scholars, midwives, who we know midwives all around the country, all around the world. It has been noted that midwives do save more lives, right? If you have a midwife is a missing link, and we can't train our own midwives, right? To work in tandem with Dr. Terry, right? And so I'm really looking at this issue as many faceted, focusing on HBCUs as a way to bring awareness and attention to this issue, as a way of how are we getting midwifery schools in HBCU? How are we getting schools of public health on HBCU campuses? But also, how are we training, again, our students to be more aware about doulas, midwives, training doulas on HBCU campuses. Also, bringing back that concept of joy and making sure that a part of your journey is just not being blind walking into birth, right? Like Dr. Terry is talking about preconception health, like how are we getting this information even in high school, middle school? We've had worse situations in terms of like the state of Black health and racism in this country with better birth outcomes than we have now. And I think part of that is that the birth process and reproductive health was kind of already infused in our communities. So how do we make it organic part of our everyday lives where your aunties and your moms are talking to you about this, where you're not finding out about pregnancy when you're pregnant. And that's how it normally works. You get pregnant, then you open the doors of pregnancy. How can you find out about this issue earlier? But also, how can young Black men in high school and college also know about this information earlier? So that's my work really right now at the Black Women's Health Imperative, also focusing on maternal mental health as well, which is one of the #1 causes of maternal deaths as well. So that's how I've chosen, or I would say the Black Women's Health Imperative agreed with me and my team have chosen. I don't do this work alone, absolutely not, to like, this was our pin or our cog in the wheel of the systematic injustices that we're seeing.
Oh, that's so powerful. And, leave it to the Black Women's Health Imperative to be 3 steps ahead as they've been, as you all have been, for over, what is it? What anniversary was
40 years, we're at 40. And we started on Spelman's campus. So for me, it just made sense to figure out, coming from predominantly white institutions. So starting at HBCUs, then going to predominantly white institutions, I didn't understand, why these schools have these resources and these schools don't. I didn't understand if you don't have a school of public health, you can't have a maternal health program. If you don't have a robust school of nursing, it's really hard and it's a big gamble money-wise for historically Black colleges and universities to start midwifery programs. However, we make up so little of the midwives in the United States. So yeah.
So many things you said. Midwives save lives. That's going to be a hashtag on a t-shirt that you or someone from this call is going to create. I think some of our midwives in the house are going to run away with that. It's true. You've raised maternal mental health, which will be stranded out and highlighted. It's in our conversation here, but Teresa Fortune, an advocate and filmmaker, will be with us later today on a birth worker panel to really emphasize that message. And hearing you talk about systemic structural issues of the choices we make on where we get our training and our preparation in a time where there is legislation to strip more funding from HBCUs, to dismantle them, when so many of us started our illustrious, and I'm talking about high quality education that prepared us for the world, at institutions that were not funded properly, but where scholarship was superior in so many ways. We're going to just say it, the education and the training that we receive at HBCUs is world class, and gives us the grounding to be able to then, as I did, like you all did, to apply for a Big 10 top research one institution to complete my education and position ourselves to reach further because of the limitations set on our institutions, that force us to make those choices. And of course, we become proud alum of these wonderful places, and it does open doors. But another pipeline issue to discuss and the network of challenges that we're working to address. Thank you, Dr. Harris, for so many rich nuggets of solutions and strategies with young Black women starting earlier. That's where our attention needs to go. Dr. Diamond, not only are you a medically trained scholar, academician, higher education leader in the health equity and the DEI space, another area that's under attack. DEI now is becoming a bad word in the United States, unfairly so. But you're also a former White House advisor on health and a native of Milwaukee, where we see some of the worst and most grave birth disparities in the nation consistently for the last decades that we've been measuring data. What can you tell us about the root causes of these disparities and how we can and must address them, uprooting them systemically, and through a social determinants of health lens? We know that you do this work at the School of Nursing here. What are the steps to take?
Whew. No, that's a great question. I'll start by saying the same root causes I saw in the fabric of the city I was born and raised, Milwaukee, Wisconsin, where I grew up on 48th and Locust. If you know, you know. Are the same root causes that I saw in Kenosha and Racine counties, where I oversaw an infant mortality initiative. They are the very same root causes that I saw in Washington, D.C. They are the same root causes that I saw in Atlanta, Georgia, where I was trained as a future public health practitioner at Morehouse School of Medicine. And yet, after actually today makes 8 months that I moved to Dane County, they are the same root causes that I see here in Dane County, Wisconsin, right? And did I mention that they are the same root causes that we've been talking about for years and years and more years and more years, and no one listens to us, or they listen too late, or they simply think it's not our right to make the choice to birth or to birth a healthy baby, right? I'll give you a better one. Or they deny us healthcare access. And let me all give you a quick, concrete example, really quickly. So this is baby Williams. She is now a she, we just found out. So baby Williams is due in September of this year. And after getting my dating ultrasound, I called a health system here in Dane County, I will not name them, to schedule my initial prenatal visit. And I did not know it was a crime to share that my plan is to have a home birth with a midwife, right? I didn't know it was a crime to disclose that. I am a first-time mother, expecting mother. So I didn't know it was a crime to share that. But I was told by the front desk registration person, I don't think we're going to be able to, I don't think that we want to schedule you since you won't give birth at our hospital. And I had to ask her to nicely repeat herself because I'm a nice person. I've been told I'm very sweet. And she said it again, and y'all about lost it. Okay. And I know that is not professional language, but I'm keeping it real. I about lost it. And I'm like, well, I have insurance. You know, we don't care how much it costs. Ma'am, are you sure? Because my husband and I, we pray for this baby. So are you sure you can't see me for a prenatal visit? This is my first one. And, you know, we just want to make sure that you're not telling us wrong information because we are making our own decision to go with this plan for birth. And that right there is the problem. That right there is a root cause. And the root causes of racial health and birth disparities are multifaceted and deeply entrenched in systemic racism, social economic inequities, and historical injustices. And that is a prime example. And there's no reason why myself, as a young, healthy Black woman who has her DRPH, who's been in this work, doing this work, knows about things that we already face, is being denied a prenatal visit to check on baby girl. At the time, I didn't know she was a girl, you know, because I want to make this different birthing decision. And so addressing these disparities, again, requires this comprehensive approach, you know, that really acknowledges the social determinants of health, including access to quality health care, how and when we want it, right? Economic stability, educational opportunities, all of these things that you all already know about. And I want to include people listening, right? Because listening is not a social determinant of health, but it's fundamental. So I hope that answered the question, but just to kind of give you some perspective on, you know, things that we're facing that are root causes that continue to be root causes in 2024. Like how do we get past this? And I'm still trying to figure out what I need to do about this situation because I feel like that was not okay. But yeah, I about lost it. But I think that we just have to continue standing up for one another, supporting one another in this space because this work is exhausting. It's hard, but we know it's so important as we are ultimately making decisions about people's lives, about healthy moms, about healthy babies, and just that right to even want to, you know, have a child. So thank you for that question.
Thank you so much, Dr. Diamond, and congratulations on baby Williams.
Thank you.
Adrian,
Yeah.
yep.
Yes, and Dr. Diamond, you already know your village in Madison is ready to wrap, you know, our arms around you and baby girl. So you call on folks for whatever you need.
You know, I will. Thank you.
There's
Yes.
already advocates in the chat who are telling me
Yes, like
contact
waiting
all us
to get
today
to it.
She has a whole lot of honorary aunties on this call.
Yes. Yes, for sure, for sure. To our incredible panelists, what is your beautiful vision for the future of maternal and child health and reproductive justice for Black women and birthing people and families in the U.S.? And I'll call on Dr. Harris.
Sure. Yeah, my vision is really all inclusive and expansive. So, beyond childbirth and pregnancy and postpartum, just beyond all of that, that we have the resources from education, financially, that we have the safety, that we have the communities, that, whatever we want to do and accomplish, we have. And having that allows us to have the pregnancy and birth outcomes that we need. Having the safety and community, having the financial resources, having the support where we can honestly have the sovereignty as people of color in this country, have the sovereignty, which means that if I'm in a community, whatever community I'm in, I can have my own schools and my own hospitals and my own resources to do what I want to do. And it seems like we can't even think that way because it's not even like, I don't know, something we've ever seen. Or like, I will say that what the issue with white supremacy is that it normalizes things that aren't normal. So it's not normal that if I want my child to have the best education, I have to put them in an all-white school or all-white environment. That's not normal. But it's also not normal for us to think that we can have our own hospitals and institutions and schools and grocery stores and our own communities to do the same thing, right? Because somehow that will be reverse racism or that will be causing more segregation. But the fact that we normalize white culture as the norm, we're somehow not allowed to have things that we know work for us. And so that's what I mean when I say sovereignty. It is the ability to really create and build our own so that we know from the cradle to the grave, I want to know that my daughter and my sons from the cradle to the grave have everything that they need to thrive. And to me, that encompasses what reproductive health and maternal health is, because it's not one point in your life. Everything you do from the time you are born, then when you have that baby, however that birth outcome was set up, everything you do from that time to the rest of your life is affected. So maternal health is just not preconception through postpartum. That's not it. Maternal health happens when you are born. Maternal health happens that Dr. Diamond and her baby, she is carrying her grandchildren right now. She is carrying her grandchildren. She is carrying all the eggs that her little baby girl will have for the rest of her life, right? So this is intergenerational, which means that we need all the resources that we can now in the ways that we know work for us to move this forward. So that's my dream.
Thank you. Dr. Kincaid.
I wanted to say, Diamond, thank you, Dr. Diamond, thank you so much for sharing that story. It's very, very real. And my dream for all of us is that we enter spaces not having to apologize for ourselves, not having to apologize for our choices, knowing that our voices will be heard. Just this week, I met a mom, and the first thing she said to me was, I promise you I wasn't being an angry Black woman. I was just asking. What other options are available for my child to be treated. And I felt how awful that she feels like she has to introduce herself this way to me when her kid is so sick. And so, like Dr. Harris said, it is bigger than our reproductive choices in this moment. Our babies come from birthing people, from mommies, they come from families, they come from communities. And we live in these communities. The social determinants of health are about where we work, live, worship, have our being, and they all impact our health. And so my beautiful dream, my hope is that everybody enters not just a birthing space, but a healthcare space where they feel seen, heard, validated, respected, and trusted. Because if we feel seen, heard, validated, and trusted, our families will experience the same. Our children will experience the same. I have 2 children, and I have an amazing husband from Inglewood who I don't think ever learned to down himself in any space. He lives his entire being, every aspect of every moment, and I envy that for him. But my beautiful, for me, I envy him. Often I'm like, you going in there like that? He's like, yeah, we rolling in here like this. We are going to be our full selves, because we started off saying that we need to rest, and when we don't rest, it's embedded in our DNA, and that legacy is passed on to our families. So my dream is that we are all empowered to be, that we feel seen, heard, and we don't feel like we have to apologize for advocating for the best, because that's what's normal. And like Dr. Harris said, we're not going to normalize what's not normal. And Dr. Diamond, I can't wait to meet your baby, our future niece.
And Dr. Diamond, to close us out.
Yes.
Yes.
Yeah, I don't know how to follow after these 2 dynamic women, but I will say that my beautiful vision is one of equity. It's one of dignity. It's one of empowerment. It's a future where, Black women have access to comprehensive, culturally competent care throughout their reproductive journey, whatever that looks like for them and whatever they are deciding for them. It's a future where Black birthing people are respected and supported and celebrated during pregnancy, childbirth, and beyond. It's this vision of we're not trending, right? But it's our legacy. We're not gonna play with that, right? Like hashtag not a trend, but our legacy. I like that. I just came up with that on my mind. But it's a future where, these systemic inequities that we talked about are dismantled, and policies really prioritize the well-being of Black families, of the mom, of the birthing person, of the dad, of the baby. It's a future where reproductive justice for us is not just a goal, but it's a reality for all of us. And I think that together we can create this future where every Black woman, every birthing person, every Black family can thrive and flourish. And I hope y'all didn't like, we need to use this hashtag, right? Like hashtag not a trend, but our legacy, right? Hashtag Black birth justice now. Hashtag Black maternal dreams fulfill, right? This is what I envision for a beautiful future in maternal and child health and reproductive justice. So thank you so much.
Thank you all so much. I like the hashtag you said. I don't know if you meant it to be one. It's our legacy. We're not gonna play with that. I like that one. All the better. And with that, we're not here to play today. We're not here to play anymore. Ain't no stopping us now, you all. We're on the move. And I hope you feel that energy and that momentum building after today's wonderful panel. Thank you so much, Dr. Major Kincaid, Dr. Kanika, Dr. Williams, for joining us today. We honor your work. We honor the legacy you're building, and we're in this together. Thank you for your beautiful time. We're with you in your continuous leadership. And with that, as we close this panel, we ask you to join us for a few special messages from the mothers we serve and our outstanding doula partners. Adrian and I thank you for joining us for this panel. Now tune in to see some of the impact of our work on the ground. Thank you, ladies.
Hi, I'm Lenisa O'Dwyer, and this is Alyssa. We'll call her the Connect RX baby. And I found out about Foundation for Black Women Wellness through a mutual friend. We had recently moved here to Madison, and I made an announcement on Facebook that we were moving, and a good friend of mine said, hey, you should get connected to Michaela. And when I connected with her and I told her, hey, I'm expecting, she pretty much shared about the Connect RX program. And that's how I learned. That was my first initial contact, knowing about the Connect RX program. My Well Black doula was Tracy Russell, and she was the right fit for me because with my family, she just wasn't only focused about me and baby. She was also focused her concern was including my husband, like, hey, he's a part of this process as well. And then she was just very willing to ask the hard questions when I had doctor visits, and that was really helpful. When I had Tracy as my doula, I think one of the things that I appreciated most was, like, one, she was Black and she was able to relate to my experience. She made me feel seen and empowered. I think that empowerment was key when I think of, like, my first pregnancy and my second pregnancy with both doulas felt like night and day. With my first pregnancy, I had a C-section, and I felt like I didn't even get that opportunity to experience the labor process because I was, like, fear-mongered into having a C-section. They were anticipating my first daughter to be about 11 pounds, which she wasn't. She was only 8 pounds, 13 ounces. But when I had my second pregnancy and I had Tracy as my doula, I think she always, from the jump, I felt empowered. She's like, you got this, mama. You know, every time I say that, I can hear her in my head. She's like, you got this, mama. So she definitely gave me a lot of tips to prepare mentally and physically for this pregnancy and delivery. And she also gave my husband tips along the way. I felt connected to Tracy as my doula. I think I also felt like she made me feel comfortable. She didn't make me feel like birth, was something that I should fear. And I did not feel that way with my previous doula. And I did not feel that way. It was definitely the connection. I think Tracy made me feel connected. She made me feel like, hey, this is something that women have been doing for thousands of years. And you're just another mama who's about to do the same process, and you got this. The Foundation for Black Women Wellness, from the jump, when I heard about it and I started to do my research, outside of having, getting the doula service through the Connect RX program, I think just being able to be a part of Project Well was really good. I was in there with like 7-8 months belly working out with Christine, so that was fun. And then seeing other women who were also intentional about being well. And then the community that I found, like one thing that Tracy made me feel and always tell me, she's like, hey, I'm your doula, but I'm also here for you for whatever else you need. And I'm also gonna shout you out, Michaela, just the community that you have been, connecting me, not only with Woodland and their services. So I've definitely found a community.
My name is Crystal Lee. This is baby Henriquez. I chose the doula program because of the support within it, because I didn't have a lot of support. My mom wasn't living in Madison and everybody was kind of busy, and it was COVID, so I could only have like one other person in the room. And just as far as what I was going through, it was nice to have that support, another woman who understood, so that was a plus for the program. But mostly for support reasons, just emotional support, and as far as birth, having the baby, because this is my second baby with the program. My doula is Felicia. She is my doula for my daughter too. My daughter is 3 years old. And Felicia was a great doula. She was super helpful, super supportive, understood my situation because I was really going through it when I was pregnant with Nevaeh. So Felicia was super supportive to me, super understanding of my situation. And she was there 100% for me with my first birth. So I just knew, for the second birth, it would be nice to have her for the guidance. And also just for the hospital reasons, because I don't want anyone telling me to do anything that I don't want to do. And Felicia is great for that. She will tell them, no, she doesn't want that. We're going to go with the birth plan. So I like that about Felicia. I like that she was right behind me in every decision that I made. A well Black woman to me would be me. I feel like a well Black woman would be someone like me, someone who struggles every day, but you wouldn't even know it because they don't go outside and act like it. Someone who maybe is having a hard time at home, but leaves it at home and comes outside, happy, head held high, still highly determined to get done what they need to get done. Maybe a few little breakdowns, a few cries, here and there, but a strong Black woman, one who strives for success, one who knows sometimes it's hard to be a successful Black woman, so they do everything they can to put themselves in that position, even if it means starting their own business or doing their own thing. I just feel like it was a good program for me. It was a fit for me because I was like depressed and sad and didn't want to get out of the house and didn't feel like I had any support. And then I came to the doula meeting and they were like, you know, we're all sisters, we're all family, and you know, it's just nice. It's nice to have a family outside of your family. I'm grateful for the program. I'm grateful for Felicia and the doula program. I'm grateful for the opportunities that you guys give us, you know, because it's hard to find opportunities like this. So I'm glad that I was picked to do this, and I'm forever grateful, and thank you.
Hi, my name is Tamisha Ben, and I am a proud Well Black doula with the Foundation of Black Women Wellness. I chose to become a doula because during my birth, in a room full of people, I never felt so alone in my life. And I felt like I didn't have nobody there to help me advocate for myself and help protect me. So now that I'm a doula, my girls know that they can always look up at me, and I give them the confidence to want to advocate for themselves, and they know that I'm there to protect them. So the time for Black women wellness is always now. Always now to protect Black women, always now to protect our Black kids and our Black babies and our Black family, and always there to care for them. And the time is always now. And that is why I'm a part of the Foundation for Black Women Wellness. What I love most about being a Well Black doula is that when you're helping a Black woman on her healing journey, you also helping her heal the generation before her and the generation after her. Now that is a Well Black doula. What I love most about being a doula is that I love that my girls can always feel safe around me and know that I'm creating a safe space for them and know that they can always talk to me about anything. As a Well Black doula, I love that my girls know that even after having their baby and postpartum care, we're a family now, and I'm still continue to be in their lives and their family lives as well. And they know that they can always call on me for any support and any help. Please support Well Black doulas and help transform Black maternal and child health in Wisconsin and beyond.
Hi, my name is Jasmine Jones, and I am a Well Black doula with the Foundation for Black Women's Wellness. I chose to become a doula. My generic answer will be to combat the high mortality rate with Black mothers and Black babies, as I have lived experience with infant loss. But becoming a doula 2.5 years ago, all kinds of things have changed on why I continue to be a Well Black doula. I am a part of the Well Black Doula Collective because when I became a birth doula in 2021, my goal was to partner with organizations that aligned with my mission with Amir's Angels Doula Services, which is ultimately to combat that high mortality rate. And so I looked into the community, and I went out to the community as a young, eager, unknowing new entrepreneur, and I met some incredible people like Michaela, Felicia, Brandis. I met some incredible people, and they are so supportive in everything we do. So I really enjoy being a part of the Well Black Doula Collective. What I love most about being a Well Black doula is every experience is different. It's a sacred moment for I call them my mama bears. And I love hearing, even after they've had multiple children, hearing that this was the best birth experience because they were informed, they were educated, and they were affirmed to trust their body and educated on what to expect. When the doctors and the nurses came in and said, well, this is what we can do, they already knew and they already understood because we could talk about it before the nurses come in. And so they are not feeling overwhelmed, because a lot of moms feel overwhelmed in that birthing process. And that birthing process is a sacred process, and we have to honor that process. So being even yesterday, one of a young lady that I was a case manager for before I became a doula, she found me because she knew I was a doula now, and it was and she said this was the best birthing experience, and this was number 7, and she said I'd still be in labor if I didn't know all those things. She said, those things really work. The gravity really works. You know, the comfort measures really work. I would still be in labor, and it was number 7. So understanding that there's always a learning process and allowing moms to, education is key. Education is so important when it comes to the birthing process, because if moms don't know, if the birthing person doesn't know, how do they make a decision? They're making a decision in a high anxiety time. So giving them that space and that process to think about it before they're even in that labor and delivery room changes the narrative, changes the whole thing of bringing a baby in the world. It's sacred, and we should honor that. And I always thank my mama bears for allowing me into that sacred space with them, because it's just so beautiful to see a baby come. You looking at a mama's stomach, and it's like a whole human was inside of you, and look at you now. And you did it. You did it either with pain management, or you did it natural. You did it, and that's important to me. To each birth is a learning lesson in some type of way, and applying that to the next mom and the next baby, and just making the Black maternal health world a better place is definitely always priority for me. Please help support Well Black Doulas and help transform Black maternal health with mothers and children in Wisconsin and beyond.
Good morning, everyone. And if you're on the East Coast, good afternoon as we cross over into that threshold. My name is Gabe Doyle, and I'm the Chief Health Initiatives Officer here at the Foundation for Black Women's Wellness. I'm proud to be here today to help lead the Foundation's work to achieve birth justice for Black mamas and babies. I'm also thrilled to be here with my co-moderator, Tara Wilhelmi, CEO and founder of EOTO, culturally rooted and member of the Black Maternal Child Health Alliance of Dane County. Tara, would you like to say a couple of brief words about your impactful work here in our community?
Good morning, everyone, and good afternoon to those joining us from the East Coast. I am just thrilled to be here. EDO really stands in the space of uplifting lived experience in all spaces, and so to hear everyone's stories, both the hard and touching stories, is so important to me. So I'm just honored to be in this space today.
Thank you, Tara. Thank you for joining us as well. So we're excited to welcome 3 outstanding leaders and change makers from across the United States to this morning's panel. We are the change, leading the way to reproductive justice for America. And as a result of trying to play a little bit of catch up, because we didn't want to cut short the powerful national opening panel, and we wanted to be ensured that we captured all of the important information, I'm going to point people to our chat and to our website for the full extended bios. But as I introduce each panelist, I'll just say really brief here. So I'm not trying to cheapen anybody's bios in any way, shape, form, or fashion, just directing people so that we can hear more of the wisdom that you all are bringing to the table. So today with us, Kendra Sutton-L, founder and executive director, Birth in Color from Richmond, Virginia. Kendra is the founder and executive director of Birth in Color, a native of rural Virginia. Kendra focuses on reproductive justice, sexual justice, birth justice, Black maternal health, structural racism, and organizes for incarcerated pregnant people and human rights violations. There is much more within her bio, so please go take a look in the chat, but welcome. Thank you for joining us. We also have Chantel Riley with us, co-founder of Doula Village Milwaukee in Milwaukee, Wisconsin. Chantel is born and raised in Milwaukee as a native of there. She is the owner of Dignity with Departure, Blue Lotus Life, and the founder of Redefining Life Services, Inc. Chantel is a registered nurse, an end-of-life doula, a certified grief counselor, a trauma-informed practitioner, certified thanatologist, which is the study of death, dying, and bereavement, a Reiki practitioner, and a registered yoga teacher. Thank you for joining us, Chantel. And last but not least, we have Juan Irby. Juan is the founder and owner of Dad to Doodla. I hope I said that right, Doodla, from Charlotte, North Carolina. Hailing from Charlotte, North Carolina, Juan is a passionate birth and postpartum doula, new parent educator, and owner and founder of Dad to Doodla, a company that provides education and support to new parents, particularly fathers who are often overlooked in the childbirth process. And again, I encourage everybody to take a look in the chat or go to our website to get these three amazing individuals full bios and really get to know their work and their history. So welcome today, and thank you for joining us. So let's just jump right in. We're going to start off with the questions. And so this first question is for everybody on the panel. So feel free for anybody. And if you all are shy, like the last panel, maybe I'll jump in and call on one of you all. Tell us a little bit about yourself, your current work in Black maternal child health and reproductive justice space.
So thank you so much for having us. Truly appreciate it. We love to talk about Black maternal health. As you stated, I'm Kenda Sutnell. A little bit of about me is I work on a lot of different initiatives when it comes to Black maternal health. So I was so excited to see that a father would be on the panel, a doula dad, because I have a passion for the fathers as well. And it wouldn't be a conversation without the fathers. We work on a lot of different policy initiatives as well, incorporating those into what seems to be maternal child health. But also making sure that we are teaching people about legislation and policy. That's going to be really, really instrumental point when talking about maternal mortality and how to change these outcomes, is that we also need our people to show up and really understand what that looks like. And then also making sure that our healthcare systems, like our taught racial bias training, that's developed by a person of color, specifically a Black person, because other ethnicities have never experienced bias in the way that we have. And so making sure that they really understand the harm that they actually do, because when you talk to them and different things that come up, they don't really know. And then, of course, we have a doula collective and making sure that all people can actually get a doula, and making sure that the doulas are well trained.
Thank you so much. Chantel, Juan? I can drop it down to just one, or let's go with you, Juan. You look like you might be ready.
Yeah, so again, thank you guys so much for this amazing opportunity. My name is Juan Irby. I'm the owner and founder of Dad to Doodla. I am currently in Alabama at the moment, but I do go between Alabama and Charlotte, North Carolina. And so I have been doing this work for about 3 years now, and my passion is fatherhood. And the reason why I do this work is because I want to make sure that dads are involved and that they are seen and heard throughout the whole entire process. And I just want to just make sure that they are seen and heard, because one, they need to know that they do play a major part in this whole Black maternal and child health and reproductive system, because while hearing their voice, you can definitely hear, okay, I am a man and I want to protect my spouse who is having our baby. And so just being in that room and being in that space definitely helps all of us out.
You know, I think both of you brought up some really great points about thinking about how experiences are turned into curriculums or evidence-based practices. And if you're absent of the voice of the people who are being harmed, you're going to be absent of real experiences. And then for too long, generationally, we've known that dads are getting marginalized, isolated, away from experiences. And when we think about the protective factors that are innate to a father's role, or at least the way that society is constructed, the way that family dynamics are often played out, you know, it's really erasing the role of the father within that space of that birthing room or perinatal journey. So certainly appreciate that. Chantel, I think maybe you were frozen for a quick second, but maybe not. But we would welcome your thoughts about how you see yourself within the current space of Black maternal child health and reproductive justice. I'm not sure if we're having any technical difficulties right now, but Chantel, please jump in at any moment if we can hear you. And if you can't hear me, I apologize. You might be still on mute. So while you're figuring out the audio issues, just feel free to jump in at any time. But Tara, do you want to jump in? There we go.
Hear me?
It's a little bit choppy, but we can give it a shot.
Yes, my name is Chantel. I am, as you mentioned in the bio, I am a registered nurse. I am an end-of-life doula. And what actually brought me to this reproductive justice space is that I actually started being a facilitator for the Healing Waters program through African American Breastfeeding Network in Milwaukee. And I'm going on year 5 facilitating that program. And that is a program that is actually providing grief and group support for individuals and families. On that work, I have actually participated in our FEMA review team here in the city of Milwaukee and been doing some projects with them as far as like updating their maternal interview process. And also, I have been in the space of supporting birth workers for being able to either do yoga through retreats. And I, along with my partner in the Doula Village MKE, we have developed a program that supports the birth workers in the city of Milwaukee for the work that they do, because we understand that who doula is the doula with all the work that they do for our community and helping improve those birth outcomes.
Thank you so much. I appreciate hearing a little bit more about your work, your efforts, the holistic approach that you take to multiple programs supporting pregnant people, and then even equally inspiring, really investing in the people providing the care, right? Making sure that they're physically, spiritually, and emotionally well so that they can be at their best to support the clients across the continuum. So thank you so much. Tara, I'm gonna pass it over to you for the next question.
Thank you, Gabe. And while we've got the technology cooperating, Chantel, I have another question directly for you. What inspired you to establish Doula Village MKE and to pursue the vision of creating an empowered and supportive village of birth workers of color? Can you describe the specific challenges faced by doulas of color in providing support to mothers and birthing people in Milwaukee, a city with one of the highest Black infant mortality rates in the state?
Yes. So it actually started because I met the co-founder. We were actually at a doula retreat. She was doing massages, I was doing yoga, and we had a moment of actually just kind of having a conversation about how being in this space and working with birthing doulas in the space of how much work they actually did to improve those birth outcomes. I think people tend to have this superficial thought of what a doula is and just thinking that it's just a person who supports somebody during their birth. And it's just like, it's so far from it. It is like, it's so many different layers that a birthing doula and postpartum doula actually provides to a community for support. And they're not just providing support for a birthing person, they're also providing support for everybody that's inside that nucleus for that person. So anybody that's connected to that person, they're supporting them as well. And what we have learned, and before I want to even put that out there, her name is Mia Morris. So Mia Morris is the co-founder of Doula Village MKE. And I'm just grateful and blessed to have a partner like her. We managed to connect because we realized that she is a birth worker. Actually, through Blossoming Motherhood is her organization, but it was more of the seeing the needs for the birthing doulas and hearing about the work. It was, I do grief support for individuals who've experienced pregnancy and infant loss, and I would work in collaboration with birthing doulas because some of them would end up being pregnant after they experienced the loss. And we're working in collaboration, and it's just like, to have a conversation and say, hey, she needs to go to the food pantry. I'm going to take her to the food pantry, and then it's like, okay, when she gets her stamps, I'll take her to the grocery store. And so it's like, it's a lot of not just, oh, we're here to see about how the pregnancy is going and everything. Like, okay, do we need food?
Do we need emotional support? Do we need mental support? Do we need, transportation? Do we need education? Do we need to advocate for you? So it's a lot of different components. Do we need to help you with housing? Do we need to support you with transitioning because you found out that you are actually in a domestic violence relationship and you need safety? And how do we facilitate that for you? And protecting that parent is also protecting that pregnancy. And so, what does that person that is coordinating and doing all these things, because this is one person, that birthing person is one person and they're trying to coordinate. So, when you look at a doula, then also add the level of case management. Also, you add the level of emotional support. There's grief support. There is helping them just be present for someone. Some of our clients, you are probably the most stable relationship that they have, and the most trustworthy relationship that they have. So when it comes down to being able to share their vulnerabilities and what they need, they start with you. So in the turn, birthing doulas as a whole, they get it when it comes down to holistically taking care of a person and knowing what everything that is needed is all connected to them having a good birth outcome. So they are in it to win it. They are not just like, okay, no, I'm just here for the birth and I'm just going to support you on that birth part and everything else. Let me see if I can help you find someone with that. It's just like, nope, we got to get it. And knowing that they have that type of mentality in the way they have that emphasis on making sure that they surround the whole person and their whole experience, that it requires a lot from them. So in turn, we were doing retreats, we're offering our services and things to be able to support them in that one space during that one period of time. But it's just like, this is every day. This is like life for them. This is not just, the yearly retreat or anything like that. This is their everyday life. And how can we support the doulas? Because so who's doulaing the doula in the process of the doulaing work that they're doing for families? So me and Mia, we started to meet and have conversations about what that would look like. And we first started thinking about when they're at deliveries, how are they getting, the nourishment and support that they need when they want to be present at the bedside. So we created something as a doula survival bag. So the survival bag has nourishments and items that will allow them to continue to be at the bedside while they're supporting their birthing person. Then we expanded and saying, you know what, they need a recovery period the same way their birthing families need a recovery period, so they can start reconnecting with their families. And so we started doing post-birth meals. So we would deliver the meals to our doulas and say, thank you, because we're appreciative of you having an impact on creating a good birth outcome by being present for that person. So when we're looking at all of these different things, and I think I kind of just wrapped it all up together, it's just that the challenges that they're experiencing is they're meeting not just the physical needs, but the socioeconomic needs, the mental needs. They're meeting a lot of those needs that is not easy for them to have access to and navigate in the process of them also trying to be healthy and pregnant at the same time. And so the doulas, they do so much. They encompass a lot for our families, and just the challenges, they take on the challenges that our community experiences and helping support them trying to navigate that so they can have the best birth outcome possible.
That's really impactful.
So much. I was just going to say thank you so much, Chantel, and pass it over to Gabe.
I love that in the opening session, there was a comment around, providing more opportunities around social connections, especially for Black providers to get connected into these networks, and that a whole business. So not just going from I want to reach out and discuss this, but turning that into, action steps at supporting both birth workers and the patients more effectively and with real empathy is incredible to hear. It also speaks to the truth of listening to Black women, right? It's said in the first panel, there's an example in the second panel, and I'm sure we'll continue to hear more examples throughout today. Kenda, your organization, Birth and Color, is based in the greater Richmond, Virginia metropolitan area, which just happens to be our founder and CEO's home city. And if you work at the foundation like myself, we all kind of claim a little bit of the greater Richmond area, or at least we're told we need to. But you have built Birth in Color to become one of the leading voices in Black birth equity in Virginia and have influenced national policy, including helping to establish Black Maternal Health Week. What drove you to create this movement, and how is your organization's work changing the landscape of Black maternal child health in Virginia?
So one of the things was people kept saying that they didn't know where they could find doulas who look like them. And so originally it was like, okay, let's create a central location where they can just find us instead of having to weed out where, okay, there's no Black doulas in the area. And so we just created Birth in Color. And then as I started to look at the statistics and all of the things, it was like, okay, why is no one talking about the maternal mortality rate? This is alarming. People should be alarmed. And how are we changing that narrative? And so that's when we started to say, okay, well, we'll raise the awareness ourselves. And so we started hosting community conversations. We started making sure, like, I started teaching myself law and policy. Didn't have a clue on what that would look like, but I learned it. And so that's really what how we drove Birth in Color to be one of the leading organizations. And I was always authentically myself. I never like switched up. It was Black women, people of color. I don't care. We're at the table. And if you don't want us at the table, we'll create our own. And so that's really what the landscape was. I started looking at different doula training. So I went to my first birth at 6 years old. So I've always been into like different things, but I said I wasn't going to do birth work just because it took so much of my time as a child. But you can't run away from what you're destined to be. And so I started looking at different doula trainings, and I was like, this is not like what's in me. Like, this is not a real doula training. And so we developed our own, and we started telling people like from the community, like, why don't you be a doula? You can help out your community members. I mean, because when you think about it, we've always had that village model. It's just that through the generations, we kind of got away from that to where, when somebody has a baby now, people aren't showing up with gifts and meals and all of those things. So it was like, okay, well, we could be that village of support for them. We can make sure that partner is well educated. We can make sure that partner knows like how to balance and what is breastfeeding and lactation really going to look like from the partner's point of view. And then also, what is it going to look like from the mom's point of view who is breastfeeding? Because people think that these things are cute, it's trendy, it's the topic of the day, but these things are really stressful. When you first start out breastfeeding and you don't know and you don't have a clue and you don't have that person supporting you and cheering you on, you're going to say, okay, I can no longer do this. You're going to give up. And so how do we make sure that our people from our community have that support that they need, whether it's birth, pregnancy, before pregnancy, whether it's maternal mental health, like what does it look like to show up for our community? And that's really the framework of Birth in Color. And every year we add something totally different to Birth in Color just because we find a void and we're like, okay, well, we're going to fill the void because no one else is protecting us. So if we can't protect ourselves, who's going to do it for us? And that's really the driving force behind Birth in Color is like, well, what Black women do, we're going to take care of our own regardless. And so that's when we did the Medicaid reimbursement for doula coverage in Virginia, because it's like, well, we do this work anyway, so why not get paid to do the work? Why not listen to what we want versus them creating a policy that it's not designed for us? And that's really how we design Birth in Color and how we just keep it going by making sure that we're ahead of policy changes. We talking directly to healthcare providers and making sure that they're actually listening to the needs and wants of our community. We do put the community first. So everything that we do, we are in communication with the community.
Either you are related to Lisa or I fully understand the Richmond experience, because one of the things we are deeply proud at the foundation is if there is a gap or a lack of understanding on an issue, we're going to go fill that gap, and we're not going to wait for others to, kind of carry the water or carry the torch. And so listening to you speak in many ways was listening to a fellow Virginian, Lisa, sharing that same kind of charge to action. So deeply appreciate hearing that. The other thing that I want to point out is so many people on this call have had to teach themselves a skill set, a knowledge in order to move the work forward. So when you said you had to teach yourself law, you had to teach yourself policy, right? We understand that the social influences on maternal and child health don't happen within the clinic walls. They oftentimes happen at the policy level or the decision makers level, the elected officials. And so we have to hit it from multiple angles. And so just really appreciated and was reflecting on some of those comments. So Tara, off to you.
Yes, I have a question for all of our panelists, so please chime in with your answers. How do you collaborate with healthcare providers, policymakers, and community organizations to advocate for policies and interventions that address the root causes of disparities in Black maternal and child health?
I'll start. Thank you for this question. So how do I collaborate? First things first, for me, is to meet them where they are. And also ask our policymakers to actually spend a day in life in my shoes. So, hey, I want you to come with me on a fatherhood journey for a dad who doesn't know exactly what to do, or who has had, or who hasn't had a dad growing up in his life. So this is what this looks like from our community. And so by making sure that this person who is in charge of this policy comes out and see exactly what our community is going through, and a day in life in my shoes, and also the day in the life of the people that they are serving their shoes, just to make sure that they see what's going on. And so by providing a fatherhood class for dads to help out with mom and baby, is something that we do in our community. So the class that we do is called Fatherhood Fundamentals. So starting with the basics, how to one, take care of yourself. You know, dads go through all of these emotions, and they're going to go through a roller coaster of emotions, from excitement because you just found out that you're pregnant, and now they're going to start to worry because, okay, what do I need to do? How do I make sure that my partner, my spouse, and my baby are okay? Now they're going to go through this thing called anxiety. Okay, I I'm okay, but I'm not okay. And also they're going to, that fear is going to set in. Okay, what if I do lose my partner? How am I going to handle this? And with one of the policies that I'm working on with one of the hospitals is, what do you do, or what do you give a father who just lost his partner on the table, and now they're walking out with a brand new baby, a car seat, and nothing else? What do you do with that person, and how do you help this person besides, okay, here's a small pamphlet or whatever? But what resources are in your area that will allow and help this person go through this? And so just by collaborating with different doula agencies and different people, and also bringing together a fatherhood support group, saying, hey, how can we gather around this man and help him out during his process, because this is new to him. Some of us may have went through this process already, and let's see how we can form this bond, this fatherhood, this masculinity around him, to make sure that, hey, we are still here for you, and it's going to take some time to heal and go through this journey. And so we want to be here for you. We want to support you. We want to make sure that you eat. We want to make sure that you are well nourished throughout this whole entire process, because no one talk to the hospitals about these things. And so also trying to meet these brand new doctors where they are. Like, go into these brand new spaces and say, hey, as a representative in the community, you have to get rid of your biases. Like, you have to listen not just to this woman, you have to listen to this man too. If this person is saying, hey, I am hurting, something is wrong with me, you as a physician, doctor, whoever, should immediately stop what you're doing and tend to this person, because I am tired of our women, my queens, my Black queens, being in this era, and we shouldn't have to talk about this all the time. But I will definitely talk about it until I'm blue in the face, to make sure that our women are seen, that our men are heard during this Black Maternal Health Week conference and all over the world.
Ooh, appreciate those comments on that. Kenda, Chantel, anything that you would like to add into this section?
Sure. So that was great points of view, Juan. I really appreciate you sharing that space. I'm not sure if you've heard of Omar or Charles Johnson, but please send the email to them, because they're working on the same thing, and it will be helpful, like, for y'all to work on that together. I'm a big fan of like networking and working all together. So I'll even give you his email address and contact information so you can do that. I did create a dad's postpartum box for dads. So, but I was super excited. People were like, why are you so excited about this dad's box? And I said, because they actually get it, they receive it. I created a dad self-care day because Black men don't take care of themselves. They do not even go get a massage, a chiropractor, anything. And so when they all came, it was their first time ever getting a massage, a facial, all of those things. So it's really, really important. So I'm so glad to hear a father uplifting that. One of the things that I do, every area that we are in Virginia, so we are in specifically 7 regions. And so I require those hospitals, if they want to say like they work with Birth in Color, they have to have monthly meetings with me to discuss what are the patients really seeing, because they'll say that they're a birthing friendly hospital and all these different designations. But when you talk to the clients, their things, their voices are totally different. They're like, yes, I had a vaginal birth, but the outcome was horrible. So when you think about different things like that, it's like, so y'all aren't a great hospital. So stop saying that until everything is addressed from what the patient's experience is. And so that's always really, really important to me. And so if you want to, because they love to name drop and say, well, we work with them. And so now I'm like, well, if you want to say that you work with us, then you have to meet with me monthly so that we could discuss what changes are you actually implementing? What is your policy? Can you show me the doula policy? Are doulas allowed in the C-section room? Because they should be. And so that's where we changed the game when it comes to what doula care really looks like in the hospitals, because we want to make sure that no matter what type of birth or outcome this is, that doula is still with that family, because that's all they know. And they're going to keep the family calm, but also explain to them what's truly going on. So that's one of my passion projects too, is making sure that those healthcare providers are like really, I don't care if it was something that they didn't want to hear, I'm going to say it to them, because too many people will pacify them and say, oh, you tried. And we're not at this point, we're not pacifying anyone anymore. And even when it comes to the medical students, this is the future, right? So who's educating them? So we go in and I teach them different trainings and what they need to know. And the number one thing that medical students are saying is like, we don't actually get to talk to community members. So we don't know how to navigate that conversation. We only know how to talk to a mannequin. And that's alarming in itself, because that's why there's bias. That's why it's different things, because they're not getting these real life examples. And one of the things that we also do for our doulas, we have doula outings every quarter, as a way just to show up and share space and like talk about what everybody is going through, and just uplift and build and connect with each other. Each of the hospitals that we are specifically in also have like a doula respite room. So even during a long birth, the doula can actually go in and just rest. There's snacks, there's drinks, and different things, so that they can just go in and center themselves, just as the providers do. And so that was one of the things that we did, help initiate change, because we always want to make sure, like, the world is depending on doulas right now. I think a little too much, but so how do we make sure that doulas don't get burnt out, that doulas truly know what they're getting themselves into, and that we're centering those conversations? And how do we say that a community-based doula is different from a regular birth doula? Like, let's explicitly say that. Like, I'm sure people are like, but can't other ethnicities and races be community-based doulas? Technically they can, but when you go into those hospital spaces and they're recognizing that there's a difference, we have to make sure that we're saying that, because when certain outcomes happen in certain areas, they're looking at reports and like, well, the doulas isn't that great, our outcomes aren't happening, but what type of doula is that? Did the doula really take a doula training? Is it a community-based doula training? And so all of these things factor. How did that doula make that partner feel? Because that's what those are the conversations that need to be had also when we're talking about health providers, legislation, and all the different things. Because I truly think a lot of stuff needs to be changed when it comes to the fathers and their rights, and like all of the things when it comes to legislation, just from me reading certain things.
Well, I really appreciate that. In the spirit of time, and I want to make sure that we get as many questions as possible, I'm going to move forward to our next question. So sorry, Santel, but we will definitely lift up your voice in some of these next questions. But really appreciate the commentary around fatherhood support, especially during the perinatal process. As a father of two beautiful young girls myself, I know when that first one came, I was lost. I did not know what to do. The nurse handed me a baby and I was like, here you go, mother-in-law and mom, here's your baby. Like, I'm gonna go take a nap. I had no clue what to do. And those kind of curriculums would have been exponentially beneficial. So Juan, in the spirit of asking you a specific question, this next one is for you. And the powerfulness of the Black Maternal and Child Health Summit is that we get experts from around the room. So on a side note, to all the health system partners that are in the room today, this isn't free wisdom that you're achieving, because everybody has spent their own sweat equity and financial resources into getting this expertise, but there is some shared wisdom that is coming your way that you can apply or at least explore in real time. So please start scribbling notes if you haven't already. But people were very interested in Juan and being a doula. People wanted to really understand that a little bit more. So Juan, this one is for you. You are among a growing legion of Black men who are entering the Black birth justice movement in powerful ways to support the movement Black women have built. Why is and just on that note alone, being the sole Black male at the Foundation for Black Women's Wellness, I can appreciate understanding the nuances between doing really incredible, or at least what you believe is impactful work, but also sitting amongst giant Black women who have carried the water in this for generations. So why is reproductive justice and specific issue of Black maternal and child health important to you? And then I would also ask you, what inspired you to become a doula, breaking traditional gender norms in this field? And how do you define being the change as a Black male doula?
Yeah, so first off, thank you to the women that built this amazing thing called doulas. And also thank you guys for allowing me into this sacred space. And while this space is sacred, I do want to say that thank you, but we also note that the dad helped make the baby too. And so I don't want them to be left out of the equation for this whole entire thing. But why is the reproductive justice, and why is it important to me? It's important to me because one, I have a Black wife and I now have a Black daughter. And I don't want anyone telling them how to use their bodies because it's their bodies. And they should have a choice on what they want to do with their bodies. And I want to make sure that if and when my daughter does decide to have children, that she understands that she does have birthing rights. She does have the right to fire the doctors, the nurses, wherever she decides to give birth. But also getting into this work, I started with the birth of our son, and I ended up getting postpartum depression. And a lot of people don't know that men can get postpartum depression. And in the area that I was in at the time, there was no support. But I ended up getting therapy and counseling and talking to that person. And COVID had kind of like just hit, which also kind of made me in that depressive state as well. And so getting a brand new job and not having that time to take off from work to actually be that bonding time with my brand new son, with my brand new baby. And so that kind of also sent me into that depressive state. And with that job, they were like, just come in, close the door, and do what you got to do. I didn't work that way. And so I ended up looking for another job, ended up getting another job that allowed me to work remotely. And so now I'm spending time with my son, my wife, and our brand new baby. I'm seeing all of these first. I'm able to have breakfast with my family. I'm able to have lunch. I'm able to have dinner, and I'm also able to be in that moment with my family. And so we ended up moving to North Carolina, and then we had a little small kid together. And someone brought up postpartum doulas. I said, okay, I know what it is, but I did some more research. So I looked it up, signed up for the classes, I went through the training. I was like, you know what? I have to learn more. And so we were pregnant with our daughter. I was like, you know what? I'm going to be my wife's doula. And so I became a birth doula as well. So I was my wife's birth and postpartum doula in this process. And so the knowing what I know now versus then, the two pregnancies that we had were like night and day. And now that I can encourage other men to, hey, this is your role in this birthing process. This is what you can do to help out your partner. And if you also feel uncomfortable, you have a right to speak on it to your partner, to your doctor, whomever. And so that's how I kind of got into this doula workspace. And also being in the change is having conversations like this, bringing, allowing me a seat at the table to have these conversations with other birth workers, with the doctors, with the policymakers, and just being in this moment to say, hey, I'm here to make a change. I'm here to step on toes. I'm here to make people uncomfortable if I have to, but I want you to know that I'm here to protect not just my Black queens, but the whole entire family. And I want to make sure that you are not stepping on their ovaries. I don't want you stepping on them. I don't want you stepping on their voices. I want them to be able to uplift their voice. I want them to be heard. And I always preach, I want them to be seen. I want them to stand up and be heard. If there's a problem, if there's an issue, please, 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 mom, dad, grandma, grandpa, who's ever in that birthing space, raise your voice and let these people know, because this has to change.
Thank you, Juan. I appreciate you so much. I know the chat's been blowing up while you're talking. I can't keep up with the numbers. And I know that if I just encourage other folks on this table as we're getting to the final 10 minutes of this panel, if you're hearing things that are inspiring you or drawing up more questions, reach out to these experts. I'm sure their schedules are busy, but potentially they might reach back out to you down the road a little bit, and you can expand your network and follow up, because we're just scratching the surface on all three of these wonderful individuals' stories, journeys, and professional experiences and personal experiences. I got the chills when you said, I'm going to be my wife's doula. Like, I'm just trying to sit with that. I don't have any really powerful words to add on to it, but I appreciated that sentiment. Tara, I'm going to transition it to you, but I will say to all panelists, we'd love to get 2 more questions in. We got only a few minutes left. So if we just want to maybe say a sentence or 2, maybe 3 on each of these answers, feel free. But Tara, off to you.
Okay, thank you. And this question is again directed to all of our panelists. What is your beautiful vision of the future of maternal and child health and reproductive justice for Black women, birthing people, and our families in your city and across the United States?
I will go. So for me, the vision is one that we have an expansive and an inclusive list of services for our families, more directed and guided by us, that look like us, because we understand the needs of us, and having it in such a space where it's not where we have to feel like we're being judged or criticized for the things that we do naturally for ourselves, and we know what's best for ourselves. Like, one of the things is just like how we talk about safe sleeping, and how, I am a product of co-sleeping. I've co-slept with all of my children, and the nurturing and bonding of that experience is what it's more centered around. And I think when we talk about safe baby sleeping and things like that, and it's how we have to look at the individuals and kind of like taking consideration of cultural differences of why we do things versus you have a Black and white perspective. I understand that there is the relationship of evidence-based, but also how do we incorporate things more on a level of taking the interest in the idea of, someone mentioned before, meeting people where they are, and meeting people where they are and how we provide support and services to individuals, and just allowing us to be the directors of what we actually need to be able to have better outcomes, because we've seen years have gone by and people have been orchestrating and trying to determine what has been the best response to our helping improve outcomes, but yet our outcomes have not really improved. So sometimes you kind of got to go back to the source and listen to us about actually what we need for ourselves in order for us to thrive in our communities.
Thank you. Kenda?
I would say people needs to follow the holistic model of care, making sure that we're looking at the RJ framework that was developed by the foremothers. Because when you look at that framework, you'll see how everything intersects with each other. And when we start to look at it from that point of view, we get to add different layers to what's going to protect and what's going to help our community, and not exploiting them.
Kenda, you weren't playing around with that quick, concise answer, and it was right on point. So thank you. All right, Juan, take us home on this answer.
All right. Well, I'm going to say cultural empowerment, policy change, like Kenda said, the holistic approach to health, community-based support as well, and also equitable access to quality healthcare. Just to sum it up.
Man, I must have scared all of y'all into these quick answers. You know what I mean? So that's amazing though, and I appreciate that. We've talked a lot about maternal and child health, reproductive justice, workforces, investing in the workforce, investing in Black mothers and birthing people, being a doula to your wife, supporting your children's future, which really takes me back to even thinking about the conversation earlier where we said, you know, Black women are carrying their grandchildren, which is a powerful statement in itself. This work is heavy, no doubt about it. We wish it was all puppies, rainbows, and balloons. And we wish it was all the joyous celebrations that many of us get to participate. But this work is tough as well. As we wrap up this powerful panel discussion, and we think about our theme, one word that's really sticking out to me is joy. And we need to have more joy in the perinatal experience. We all work in hearing the negative stories that come along with our clients, our friends, our neighbors, our family members. But when we think about joy, how do you specifically cultivate joy, hope, optimism, and well-being in your work, whether it is the people that you work alongside with or it is the people in your community that you work for? How do you bring joy to this space, and how do we continue to sustain joy across collective multi-sector partnerships that are the attendees at the Black Maternal and Child Health Summit? And this is for anybody.
Sure. So one of the things that I do specifically is we don't really talk about the statistics and the data to the community. We do raise awareness to the issues on like different platforms and podcasts, but we really talk about what does it look like to go back to joy and justice within the pregnancy, within birth, all of those type of things. So we try to come at it as if you're really educated and knowledgeable and you're empowered and you use your voice to advocate for yourself in different instances, even if you don't have a doula, that you can find the joy in being pregnant. You can find the joy in what is your outcome going to be. You can find the joy in helping to create your birth plan. And that's where we want people to start to look at. Like, let's go back to how, you know, everyone was happy when they used to be expecting, and actually not being afraid to get pregnant, because that's what's happening now as Black women are afraid to procreate. And we want to change that narrative.
I'm not going to let you off the hook just yet, because I just want to acknowledge the smile that came across your face when you were responding to how do we bring joy into the space. And while that was giving me goosebumps and a great amount of joy, I think it really speaks to the overall question, which is we're all itching to have more joy in these spaces. And I appreciate that very specific way of when engaging the community, you know, it's not the doom and gloom perspective, because language does matter, right? And what you share to somebody, whether they want to accept it or not, is received. And that energy transfer is received. And so how we frame this work up has impacts on who we are talking to. So just really appreciate that, Kenda. Juan or Chantel, how do you bring joy into this space, and how do we sustain this joy into the future?
I will second about what Kendra was actually saying about like not always focusing on the statistics, that we are, well, the Doula Village MKE is our way of restoring joy into the work that is being done by actually providing support to our community birth workers that are in Milwaukee and helping change those outcomes. We are also, and I'm going to speak prematurely, but I'm super duper excited about it because we are carrying the torch for someone who decided that it is also important to be able to celebrate the first birthdays. We're always talking about the loss that we are experiencing, how children are not being able to like make their first birthday, but how about we take a little spin to that and celebrate the ones who have? So we are actually in the process through the Village MKE, we're actually working on coordinating our first birthday community celebration for those who have actually made their first birthday. So to be able to highlight something that's going right in our community and not just always the focus and talking or pointing out about what's going wrong, and understanding that we have the power to do that. We also have the power to highlight what's going right. And right now, community birth workers are what's going right in our community, and to be able to highlight them and support them with the work that they do through Doula Village MKE, and just universally, like, we're hearing like birth workers are where it's at. Birth workers are helping fill the gap. So it's just like, to lift them up, and not just during special days, but finding days outside of that to have spaces to just lift them up and just know that they add value to the people and the work that they're doing. And we get to celebrate them in all ways, shapes, or forms.
Chantel, before we move over to Juan, I just want to say I spent 10 years in the Milwaukee area, primarily on the north side, doing community health work. And the amount of presentations that I would have to put together, and when you go to Google search north side of Milwaukee or some pockets of south side, it's just 100% negative imagery for Black families and communities. And so hearing your efforts and your work to create those community celebrations, to reclaim the narrative of the communities in which you serve has got a lasting and near and dear spot to my heart. So please keep up your efforts in lifting up Milwaukee, because Milwaukee is one of the greatest cities in the world. People just mislabel it all the time. Juan, take us home here. How do you bring, as the doula coming into this space, as a fierce warrior for Black maternal and child health efforts and reproductive justice, and equally important, carving out a space for Black men and fathers to have an equitable space in the perinatal journey? How do you bring joy to this space, and how are you going to sustain it moving forward?
Yeah, so to say everything that everybody else has said, but like continue to building that trust and relationship with each of your clients, and also the community as well. And also by celebrating those milestones, by being one in that birthing space. That's a huge milestone right there. But also congratulations, like you're pregnant, like you are pregnant, like you are doing the dang thing, like you are repopulating our earth. You are here to go through this journey called motherhood and fatherhood, and just affirming these parents that they are doing a good job. Yes, parenthood is hard, but you are going to make it. You are going to be a great parent, and you don't have to parent how you were parented. And so, again, like celebrating these milestones, and with the dad to doula, we actually send out birthday cards, not just to the babies, but also to the parents as well. So we get that information and say, hey, here is a special gift for you on your birthday. Treat yourself. So whether it's a $50 gift card to somewhere, or something that's in their area, and just say, hey, we have not forgotten about you. Even though your baby may be 2 or 3, we as a collective have not forgotten about you. And just creating that positive atmosphere from the beginning, they're definitely going to say, hey, I had Juan as my doula, and he was great. He helped me in so many ways. And one thing that stuck with me when I did my first family, she said, the reason why I hired you is because I want to show my husband and my son that men can do this work too. And so when she hired me, she was like, this is the reason why. And I want to make sure that the love and the passion that I have for you in this space is shared with my husband, with my son, and also with the whole entire world. So just continuing like to celebrate these milestones, building this trust relationship, and just continue to foster that bond between all of our families and also all of the entire community.
Kenda, Chantel, Juan, my co-host Tara, thank you. This has been an honor and a privilege for me to be able to facilitate this impactful, wonderful wisdom exchange that we call the panel. Thank you for your time and your presence with us today. We honor you, your leadership towards building our collective power to secure reproductive justice. Thank you. And now for a few special messages from our public officials and our doula partners.
Hello, Senator Tammy Baldwin here. It's a pleasure to join all the healthcare advocates, community leaders, and Black mothers for this year's Black Maternal Child Health Summit. Today, we gather virtually to highlight our shared goal of addressing and eliminating the alarming birth disparities and inequities impacting Black mothers, babies, and families. In Wisconsin and across the country, maternal and infant mortality rates are tragically high, and we are experiencing a maternal health crisis. Sadly, this crisis is disproportionately impacting Black communities, which have long suffered from a lack of healthcare resources and access to quality, affordable healthcare. About 10% of all births in Wisconsin are born to Black women, yet Black women make up more than 20% of all pregnancy-related deaths. Make no mistake, this is preventable. In fact, a recent study in Wisconsin found that more than 90% of these tragedies were preventable. All expecting moms should have access to high-quality care during their pregnancy and be able to set up their newborn for a healthy life. We can and must do more to address inequities in our healthcare system and save lives. In Congress, I'm proud to be fighting to pass the Black Maternal Health Momnibus to save lives and address every driver of maternal mortality, morbidity, and disparities in the United States. In this package is my Perinatal Workforce Act, legislation to improve access to maternity care and diversify our maternal health workforce to ensure moms of all backgrounds can get the care they deserve. This bill would be a huge step forward in addressing our nation's maternal and infant mortality crisis. But we still have work to do. With women's reproductive health care under attack, its impact has been disproportionately placed on Black women. These abortion bans exacerbate the reproductive health problems that many Black women face, and we must keep fighting back. Know this, I will not give up until every woman in every zip code has the right to control her body and access abortion care. I appreciate the Foundation for Black Women's Wellness for your work to improve health outcomes for all mothers and babies, regardless of income, race, or zip code. I'll keep working in Congress to close maternal health disparities that put families of color at greater risk of adverse health outcomes. I'm confident that if we continue working together, we can build a more just and equitable healthcare system for all. Thank you.
Welcome everyone to the 4th Annual Wisconsin Black Maternal Child Health Summit. I'm honored to be a part of this virtual conference, and I want to thank all of you for the work you do in addressing and eliminating the disparities and inequities that impact Black mothers and babies. This legislative session, I have introduced several pieces of legislation that align with the goals of this summit. The first, Senate Bill 341, mandates health insurance policies to cover the essential health benefit of maternity and newborn care. By ensuring comprehensive coverage, we aim to reduce the financial barriers that many Black mothers and families face when accessing necessary prenatal and postnatal care. Senate Bill 1013 limits the use of physical restraints on people who are in labor and postpartum people in custody. The bill recognizes that dignity and prioritizes the safety of pregnant and postpartum individuals, ensuring that they receive the care and respect they deserve for such a critical time. Senate Bill 409, which creates paid family and medical leave. This program signifies a step towards supporting working parents, allowing them to take the time that they need to care for their newborns without the stress of financial insecurity. Senate and Assembly Republicans chose to adjourn the legislative session without taking up these critical issues. While I am committed to introducing legislation next session to address issues that will enhance Black wellness and prosperity, I can't do that without advocates like you. I want to commend you for taking part in this summit and encourage you to continue your advocacy and civic engagement. Thank you for your continued support. Together, we can build our collective power and make a lasting impact on the health and well-being of Black mothers and their families.
Hey everyone, I'm Dane County Executive Joe Parisi. I want to thank the Foundation for Black Women's Wellness and the Black Maternal and Child Health Alliance of Dane County for inviting me to be part of this summit. Events like this are important because they give us an opportunity to center ourselves in what we know. More than 1 in 8 Black babies in Dane County are born with low birth weight, which is associated with infant death. We know that the mortality rate for Black babies in Dane County has remained persistently high and is more than double the countywide rate and more than triple the mortality rate for white babies. Through this data, we see disparities loud and clear, and we know they are unacceptable. But identifying the problem is just one step. To achieve real and lasting change, it takes real action and lasting partnerships like those being showcased at this conference today. This year's theme of building our collective power to secure reproductive justice signifies our collective focus to protect, secure, and empower the reproductive health and freedom of Black women, birthing people, and our families. Making Dane County more equitable, diverse, and fair has been one of my top priorities as county executive, and I'm excited to see advocates in Wisconsin and across the country taking part in today's summit. The work you are doing is important and it's urgent, and I will continue to support your efforts to improve the well-being of Black mothers, babies, and families throughout our community. Thank you again. I hope you have a wonderful and productive conference, and take care.
Hi, I'm Mayor Satya. It's a pleasure to greet you, even if it is via video. Thank you to Lisa Payton Care and the entire team at the Foundation for Black Women's Wellness for everything that you do. In the spirit of the day, I hope that you are all taking good care of your health, both physical and mental. You deserve good health. Here at the City of Madison, we continue the important work of addressing the underlying issues that impact the health of our community. We're working on housing because our community deserves healthy, affordable housing choices. We're working on transportation because our community deserves affordable, accessible transportation options. We're working on economic empowerment for communities of color because financial stability is central to well-being, particularly central for Black women to be able to thrive. We're working on the climate because our community deserves a resilient and healthy future. We're treating violence as the public health issue that it is because everyone in our community deserves to feel safe in their homes and neighborhoods. And we're partnering with the community to address the disparities in health outcomes that so deeply impact Black women because we deserve a future that celebrates healthy, powerful, and happy Black women. Thank you again to the Foundation for Black Women's Wellness for inviting me to speak with you. The City of Madison supports your efforts, and I take hope from our partnership and collaboration. Thank you for all that you do, and have a great conference.
I'm a well Black doula. Of course my clients change their appointments on me.
I'm a well Black doula. Of course nothing is TMI.
I'm a well Black doula. Of course I'm gonna encapsulate those placentas and core keepsakes. There ain't no such thing as business hours.
I'm a well Black doula. Of course my baby's coming to the doula meetings.
I'm a well Black doula. Of course I'm gonna have healthy snacks for you.
I'm a well Black doula. Of course I wash dishes, change diapers, and fold clothes.
I'm a well Black doula. Of course I'm a spiritual gangster in the hospital. What you mean they ain't listen to you? I'm on my way.
I'm a well Black doula. Of course I'm gonna advocate for doulas to be well paid.
Good afternoon and welcome back, everyone. Don't you just love our well Black doulas? Let's clap it up for them in the chat. Let's show them some love. Let's honor them in this space today because, as many have said, they are the difference. They are the thing that is working, and we are committed to ensure that they grow and proliferate across our state and communities nationwide as a critical part of the solution to advancing Black maternal and child health. Welcome back. This is Lisa Payton again, founder, CEO, and president of the Foundation for Black Women's Wellness. For those who may have just joined us, for the moment we've been waiting for. Today, I have the honor of welcoming for our lunchtime keynote address, one of our nation's fiercest leaders and advocates for reproductive justice and Black birth equity, Dr. Karen Scott. Dr. Karen Scott is a chief Black feminist, physician scientist. Look at how beautiful you look showing up on the camera with me. Hey there, Dr. Scott. And I'm going to do justice to this awesome bio. Founding CEO and owner of Birthing Cultural Rigor, LLC. Based in Nashville, Tennessee, Dr. Scott is a national and international speaker about the ways in which obstetric racism violates the humanity and the lives of Black women, girls, and gender-expansive people throughout health services design, evaluation, training, in the afterlife of slavery, right? So we're taking it all the way back to the North American experience of slavery and moving to today so we understand root cause and what it is that our ancestors and us today have been undoing. I cannot wait to hear. Dr. Scott developed the first and only validated patient-reported experience measure of obstetric racism, the PRIM-OB scale suite, as prevention and mitigation against obstetric racism. And you all will likely understand the magnitude of that when Dr. Scott shares more. And it was Dr. Tiffany Green, Dr. Scott, who told us about that instrument that you created. She was telling us about this 3 and 4 years ago, that we needed to understand what you had created and how useful, valuable, and essential it is in measuring patient care. Currently, Dr. Scott is the proud developer of the first and only Black community-led quality and safety program to address obstetric racism during childbirth, hospitalization, and postpartum, called the CATCH Pilot, or Community-Led Accountability and Transformation in Care Experiences and Hospital Culture. And I hope that our health system, clinical, hospital healthcare partners who are on the call today and among our audience will be very tuned in to your message, as well as the community of birth justice advocates, Dr. Scott, who are awaiting the word from you. Welcome, and the stage is yours.
Thank you, Lisa. Thank you, Foundation for Black Women's Wellness. Thank you, everybody who has joined today. I'm gonna try to get my slides going. So I'm gonna fill this kind of virtual space with a lot of information in the next kind of 30 minutes and then leave room for some questions. So we're just going to dive right in. So thank you all so very much. So I've been tasked to talk about building our collective power to secure reproductive justice, why we must and how we can. And because of my background, we're going to actually talk about how we can, how there is a movement in the quality and patient space that's operationalizing reproductive justice, Black feminism, research justice. So first and foremost, we need to celebrate that we are 30 years into formally calling reproductive justice and honor our 12 mothers. Thank you, Black Mamas Matter, for this image that she created and posted. And in the words of Sister Song, we reclaim the demands of reproductive justice that our Black foremothers named nearly 30 years ago. The human right to own our own bodies and to control our future, the human right to have children, the human right to not have children, and the human right to parent the existing children we have in safe and sustainable communities. So we're going to ground all of this in RJ. A little bit more about myself. I'm a Southern born and raised Black woman in East Nashville, is where I grew up before gentrification. I'm the daughter of Edith W. Floyd and the late John Henry Scott. I am very appreciative of the gift of a liberal arts education from the 5th grade all the way to the completion of medical school. I am a lifelong learner, and I do believe this is the way, if you know where that comes from. I'm a proud Black feminist, reproductive justice avenger, Wakanda healer, Yoda practitioner, Care Bear hugger, all those things. I do need to say that I'm a dissident and recovering OBGYN, and how I originally started off wanting to be a health systems disruptor, transformer, and architect, which is what I am now. I actually didn't start off wanting to practice medicine. And I'm celebrating 22 years in this thing we call community-based OBGYN. And my purpose is to advance cultural rigor through the operationalization of Black feminism, reproductive justice, research justice, and participatory quality improvement and implementation science, practice, research, and interprofessional education and training. So I became a physician so the world would listen to a Black girl born at Hubbard Hospital, which, if you know, Nashville was a Black hospital before it became the general hospital it is today, whose mother, sisters, and myself navigated life in East Nashville, CWA apartments, which are like one step above the projects on South Fifth Street in the late 1970s and 1980s. I wanted to transform models of care delivered to women and girls, particularly Black women and girls who reminded me of my family and my community. I earned my MD not so I could be at the bedside, but to acquire the authority and autonomy to affect change. Little did I know that physicians actually don't change the care delivery models. We don't. We follow what's already in place. And so at 20 is when I made this shift. I'm 48 now. So 28 years ago, I made this shift from pursuing my PhD in molecular biology to pursuing my MD because I was inspired by actually Billie Avery. I got introduced to her work when I was 20 in college. Her work in Georgia and in Florida inspired me to want to change healthcare delivery models in alignment with that vision, that practice that she had, and all the work that she did at that time and even now. So a little bit of history in 2 slides, 5 centuries, in case you did not know. It's important what our foremothers did, and everyone who's doing what we're doing right now is because if you go all the way back before we, how we got here, there was a legacy of legalized sexual and reproductive oppression. And so in 2 slides, I'm just going to sum up what's been going on. And at the bottom of the slide, you'll see the names of Black women scholars and others whose work also I embed in everything that I do. So you think about 1662, right? We are legalizing chattel slavery. It's in the South. And if you look at what we do today, right? The race of the baby follows the race of the mother. That's what we do in birth certificates, and that's how public health folks, right, identify racial categorizations and demographics of who's being born in the state according to race. Well, that actually follows a pattern of, right, that if a baby born in freedom, we are not born slaves. When a Black baby was born, it was the adoption, the inheritance of in slavery, of bondage of her mother, right? That made that baby now an enslaved baby. So there are patterns that we do in contemporary times that go all the way back to chattel slavery. Also, by the 18th century, white physicians in slave societies acquired professional success and credibility by pathologizing, medicalizing, and commodifying birth and the reproducing body, specifically Black births and the Black reproducing body, in their professional writing and presentations. In this slide, I'm only going to focus at the why, but in 3 centuries, 19th, 20th, 21st century, this is a slide that allows us to continue to look at the progression, the expansion, the sustainability and scale of this legacy of legalized sexual and reproductive oppression, where people were motivated by the why, how, who, and goals, right? The mission, methods, the stakeholders, and goals. And it's very important to look at the who, because on every line on the who, which is right here in that 3rd row, you see OBGYNs. You see OBGYNs, you see family planning and reproductive health providers in partnership with slave and plantation owners. And then we start adding on law enforcement, the government, then hospitals, right? That's when hospitals and healthcare systems no longer were really present for our well-being, but acting on behalf of the well-being of the state, right? As agents of the state. And why? Because they wanted to first increase productive and reproductive labor in the 19th century. In the 20th century, when we started to outgrow in terms of numbers, the browning of the US, then we had to figure out how do we eliminate this socioeconomic burden of the browning of the US. We started having more forced and coerced contraception, sterilizations, controlled births, forced destabilizations of kinship ties between mother and child or parent and child, birthing people, mothers and their partners and their grandmothers and their families, entire destabilizations and divestments of communities, all because we needed to eliminate that browning effect and ultimately to get to where we are, where we have the financing of
Lord, to work it out.
the professionalization, the commodification, the racialization and regulation of birth work, and birth workers. And we've extended, right, the forced and coerced procedures. We have forced interventions, forced inductions, forced cesarean births, more postpartum sterilizations, LARCs. And again, the players, hospitals, health systems, all the folks, because what we are promoting is the separate but equal outcomes and care. And those things can exist, right, because of reproductive and perinatal apartheid, which I coined as an adaptation of Harriet Washington's medical apartheid. When we look at the meaning, the manifestations, and the mechanisms of actions to why these things can exist, why they can be done as a solution, is because we're again trying to control, if not kill, as Dorothy Roberts says, the reproducing Black body. And on this slide, we see different examples of policies and procedures at the state, at the federal, possibly at the county, at the hospital, institutional level, that are doing things to continue to destabilize, degrade, dehumanize, divest from Black life, from Black liberty, from Black joy and happiness. Going back to this slide representing all the wonderful things all of you are doing. And if you're not on the slide, it doesn't mean you are not of value. We don't see you. This is all the space that I have. But grounding all of you all in, right, what our Black foremothers were doing, are doing, and will be continuing to doing, because we're always at odds with getting systems and structures to recognize our innate worth, our humanity. So we say thank you. We honor the birth workers. We honor people at the policymakers, the legislators. But in terms of the rights part, that's important, but we also honor those on the ground, right? Those who are directly impacted, who are navigating the greatest burden as either the caregiver, or also when you are navigating being the patient and the caregiver and the client. Who are navigating logistical support on the ground, just trying to get people food, trying to get people transportation, right? All the different structural determinants of health. RJ allows us to move in that way. It is both a vision and a movement. It's a praxis. It's a framework. It allows us to continue, right, to activate and amplify our human right of bodily autonomy, right, to choose to have children, to not to have children, but most even important is to continue to parent the children that we have, whether that's done, right, through science, through biology, or through surrogacy, adoption, right, our chosen families. And so with the things that have been done, when I say this, we absolutely need to continue to expand and increase the interest, investments, in infrastructure and community-based options so that we can be cared for in community, by community, where we can have birth at home, birth in community centers. But I also want to make sure we don't leave the 98 behind. And that's where I'll focus for the remainder of my talk. And when I say don't leave the 98 behind, I'm talking about that 98% of folks who are still birthing in the hospital. The most prolific demographic group that is resisting, right, that's demonstrating a resilience and refusal against the hospitalization, right, in childbirth are Black women. And we say kudos to us for knowing that we are safer. And I'm saying that as a dissident and recovering OBGYN, when we are not in the hospital setting. And that's 2%. So although there's been this exponential growth, it's 2%. So while we are increasing, again, infrastructure, interest, investments in doulas, in midwifery care, in telehealth, in apps, in birthing centers, in birthing centers, yes, we cannot forget the 98%. 84% of pregnancies are preventable. Pregnancy-related deaths are preventable. 88% of the births are attended by physicians, which means only 12% are attended by midwives. Back in the day, it was the reverse. So as we're moving, right, to correct course, right, to correct that trajectory of prioritizing midwifery first and then everybody else second, in terms of, I'm an interventionist, I'm a surgeon. Yes, I trained in community. I'm appreciative that my chair and my residency program director were MD collaborators of the largest midwifery group in Chicago. I see things a little differently than other OBGYNs. So yes, we need to restore Black midwifery. We need to compensate and activate other Black birth workers, lactation consultants, mental health folks, so that we can have a reverse of that 88%. We also know that 53% of pregnancy-related deaths are happening after they leave the hospital, and the postpartum period up to a year. So let's not forget the 98. Let's make sure that while we're building up things on the outside, that we continue to think about the inside. And we think about the inside, I am motivated and moved by the Sex Positivity and Black Women Birthing Justice, the book that they wrote. Shout out to Bonaparte and Chinyere Para. I wasn't trained to see birth as sacred. I was trained to medicalize, pathologize, to manage and monitor birth so I could get other things done as an OBGYN. And so to come into spaces where birth is sacred, it shifts how we think about birth. So sacred birth is a radical attitude towards human birth, specifically Blackness, Black bodies, and Black births that regards all birth activities as fundamentally normal, healthy, spiritual, familial, magical, transformative, erotic, communal, emancipatory. And the reason why I say emancipatory is because we did birth in bondage. So now to be able to birth as free people, it is an emancipatory experience, and we need to curate the experiences, the people, the options for that to happen. We need to activate, not empower people. We have our innate worth, we have our innate power. We need to activate and amplify the power within us to do this, to be this. To feel this. Sacred birth encourages diverse and inclusive birth pleasure, practices, care, spaces, options, partners, communities, and experiences. And the sacred birth movement advocates for safer, respectful, dignified, high-quality participatory birth care, conditions, experiences, outcomes, and an improved workforce diversification, development, sustainability, and restoration of Black midwifery and Black doula support models as part of its campaign. So what does a revolution and a movement look like in quality and patient safety? Well, here it is. I am, again, grounded in RJ, in research justice and Black feminism. So when we look at the ways in which we've been evaluating quality and safety, on the slide here are the outcomes, right? The target goals is what everybody's aiming for: a full-term pregnancy, the absence of medical comorbidities, optimal prenatal care utilization, a vaginal birth, a normal weight infant. You get the gist? These are the things that we say make a birth safe. And then we call that birth or that hospital high-performing, high-quality, and safe. But when I interviewed a Black mother in 2019 about this very experience, right, she had a small tear in the vaginal vulvar area that needed a simple repair, no complication, no extension. She shared about her experience, not those outcomes, her experience. Though he put me back together, I still don't feel whole. So is this a safe or unsafe Black birth? It's in a hospital setting. Here are all of our positive outcomes. This is the 98. Don't forget them, because this is not a safe birth. You have degraded, devalued, diminished, denied this Black woman her autonomy, her agency. You've made her to feel that she can't birth in the way that she desires. You've eroded her self-efficacy and her own body's power. And the reason why we do this, I won't say the reason why, well, yeah, there's a reason why. The reason how we can do this, right, is by evaluating a hospital's performance on an outcome that's really about our body. That's how they can get away with it. So though he put me back together, I still don't feel whole. Those outcomes I listed are not hospital performance indicators. They are the manifestation of our bodies, our acts of resilience, resistance, refusal across generations. The body is showing you all how we made it against all odds. There is nothing about those outcomes that have to do with the hospital's actual performance. And I'm saying that. The reality is, again, the outcome measures the performance of the reproducing Black body. The recommendation on the right in this table is that if you want to be innovators and disruptors, if you want to operationalize RJ in quality and safety, if you want to reimburse in a level that optimizes RJ, right? If we want to put hospitals on a list of excellence, right, that reinforces and reproduces RJ, then we need to choose measures that look at the experience and not just the outcome, because you can have a positive outcome and a horrific experience. And here's a story that allows you to feel that?
The biggest issue I had with my labor and delivery experience is the fact that I developed a birthing plan in writing prior to delivery that was in my chart regarding pain control, yet it was not honored. I expressed my need and want for an epidural to anyone who would listen. They cared for me during my time at the hospital, yet somehow I was forced to deliver naturally without any pain medication. This was not because I had a quick labor either. I got to the hospital at 7 p.m. They started my induction at about 10 p.m., and I did not deliver until 6:06 a.m. So they had ample amount of time to fulfill my need for an epidural. There was a point where my husband was asleep and I could not yell loud enough to wake him due to the amount of pain I was in, but I could reach the nurse's button, but nobody would respond. I felt like I was in pure hell, and it was the worst, most painful, most traumatic experience I had to endure when it comes to labor and delivery, and this is my fourth child.
So a moment for that. In this story, this person did not go to the OR, did not have a blood transfusion. They had a vaginal birth, probably had pretty good APGARs for the baby, right? This experience would not be captured by the claims data the insurance companies look at, right? When they look at the numbers assigned to the diagnosis and the procedure, they're going to see, oh, this is a high-performing hospital. This was a safe birth, right? But safety cannot be confined, can't be conflated to positive outcomes or the absence of a physical injury, or even reducing the rate of adverse birth outcomes. So the first day of Black Maternal Health Week, U.S. News and World Report released this article. It lists 26 hospitals that they say have excellent Black patient outcomes. And what am I sharing with you today, right? That the outcome can't be the goal, because you can have positive outcomes and a horrific experience. And so this list of 26 hospitals was based on their cesarean birth rates and their rate of neonatal complications. How do we know that the Black women and birthing people from those 26 hospitals actually felt whole after giving birth? Well, we wouldn't know, because we keep prioritizing outcomes over experiences, which goes to the right of the slide. We must call out the lie in QI, and RJ gives us permission and power, activates our power to do so. The absence of perinatal pathology is not the presence of perinatal equity. And I'm going to say it again. The absence of perinatal pathology is not, is not the presence of perinatal equity. The lie is saying that it is. So when we strive to reduce the cesarean birth rate, we strive to reduce these adverse outcomes, we're saying that the absence of the adversity is the presence of equity. That is absolutely not true. We wrote an article about that. Emotional safety is patient safety. And in this article that was published a year ago during the Black Maternal Health, around that time period in April, we used the exemplar of obstetric racism. And in that exemplar, we were saying that in the quality and patient safety paradigm, we value and prioritize being safe as defined by systems and structures and quality and patient safety professionals at the erasure and exclusion of feeling safe defined by patient experiences and community wisdom. And so what happens when we prioritize being safe over feeling safe? Well, 4 things happen. Number 1, we dismiss patient feelings and testimonies as real outcomes. 2, we diminish the value of patient testimonies and positioning patient testimonies as subjective truths that then lack objectivity and credibility. So it's basically my word against your word. And I'm saying mine as a patient, not mine as an OBGYN, but it becomes a them versus us. We're in the health record. Who actually gets to write the narrative in the health record? Patients and communities don't. So even using hospital discharge data, birth certificate data, discharge data, right, that informs public health allocation, reallocation of funds, we are doing that based on a lie. We are using data to determine who gets what off of information that excludes our patient's experience. Patients don't get to go into the chart to rewrite the narrative. And it also sounds like the felon record, right? The health record follows patients around so that the health system introduces themselves to the record, not the person. So the third thing is we displace the onus of responsibility, recognition, reporting, repair, and reconciliation from the system to the patient. to the patient provider dyad, to the health system, to the health, team. The whole system gets to remove themselves because it's the patient provider relationship, or the team's fault, not the system's fault. And ultimately, we deny the possibility, the imagination, right? The innovation, the disruption, the transformation of patient safety beyond the absence of physical injury or reduction in the rate of adverse outcomes. We end up downgrading, degrading patient safety meanings, measures, and monitoring strategies. So this is just another quote where I say from the Washington Post, just because you don't see the pathology that you define doesn't mean someone's not hurting or being harmed, because the system got to define the harm. How can you come to save us when you are the architect and benefactor of our harm? Safety can't be defined by those who are harming us. So hospitals in the US do not routinely keep our community safe. This is a model of how we use Black women's theories, right, to contextualize this manufactured Black maternal health crisis. We use Sojourner syndrome, which is what I love about the late Leith Mullins. It not only looked at intersectionality, racism, sexism, classism, and how that, right, impacts how our bodies show up in these different systems and how we're navigating housing, food, safety, police brutality, gentrification, like all of those things. It also speaks to our community acts of resilience and resistance, which is why I love to use Sojourner syndrome, because it speaks to oppression, resilience, and resistance. We talked about reproductive and perinatal apartheid, and then obstetric racism, which Dr. Donna Davis defined. When we contextualize this manufactured Black maternal health crisis through Black women-defined theories and operationalize Black feminism, reproductive justice, and research justice, we are on this arc, right, that takes us from pathology, right, really to our humanity on the right, where we have Black women and birthing people, over 1,100 Black patient community content experts helping us to redefine what quality means. Quality meant safety, accountability, autonomy, communication, information, anti-racism, anti-misogynoir, empathy, humanity, all those things, which are actually not a part of the core 6 domains of quality as defined by the National Academy of Medicine. And because of time, I'm not going to give the full definition of obstetric racism, but it describes practices, policies, procedures that place or subjugate Black folks, Black birthing people, right, in ways that track along histories of anti-Black racism and eugenics. And it's organized across 6 dimensions that you see here on the slide. Being neglectful, dismissful, disrespectful, critical lapses in diagnosis, intentionally causing pain. That one is very important because it's not only about intentionally causing pain. 2 things go with that. Dr. Davis says also it's about the lack of empathy for our suffering and the lack of motivation to end Black suffering. That's very important. It's a medical abuse. It's also coercion. So folks would think, not on this, in this virtual space, but other folks would think obstetric racism or obstetric violence, right, are terms that are too violent to use to describe how systems and structures are treating us. Well, this Black mother in 2019 shared with me her story, her experience about birthing in a hospital. You push out the baby and you go back on the field and you keep picking the cotton. She didn't know that's exactly how Dr. Donna Davis described obstetrics, contemporary, not back in the day with Miriam Sims. I'm talking about today in 2024. For the sake of time, I won't go through this narrative, but this is 2020. This is a Black woman pediatrician who's saying that she knows she was protected in New York in 2019 from harm because she tapped into the Black women providers around her. That is a level of privilege that she had, that she hopes that no other Black person has to rely on, right? Because that becomes, which I wasn't going to talk about, but we have to make sure we don't perpetuate birth elitism. There's a certain group of Black folks who can birth at home, who can birth in hospital, who birth in community because they are a Black birth worker, because they know a Black birth worker, because they have money and affluence, or they are in a relationship with people with money and affluence. Birthing at home and in community should not be an elitist act or privilege even amongst ourselves as Black people. And that is what this Black pediatrician was saying. So we translate Dr. Donine Davis's theory into practice using the scale, using patient-driven community quality domains. This is just an example of us having 806 Black mothers who completed the scale with all their data across 348 hospitals across 34 states and DC. And that 1,100 really represents also the other 300 folks who have been with me since 2019, including the patient, community, and content experts. So when we think about equity, right, if the inequity gap is 3 to 4, and I never lead with that disparity because I think it's disparity data porn, and we can talk about that at another time. I always lead with other things. But if we want to focus on that 3 to 4 that's always talked about, then the people doing the work, there should be a 3 to 4 gap between the perpetrator of harm and the people who are navigating the harm. So what I mean by, we only had 6 white women involved in the study. So for every 1 white person, there was 150 Black women at the level of a patient community content expert. That equity gap was 150 to 1. That's what I'm talking about in terms of reparations and having community lead and do the work. This is just a slide of the scale itself. What I'm also, RJ would say, is that we should make obstetric racism a never event, something that should absolutely never happen. And we've done things like that with wrong site injury, with retained laparotomy sponges. And on the right, we'll see all these different events that are listed as never events, but obstetric racism and obstetric violence aren't there. Well, guess why not? Yesterday, on the last day of Black Maternal Health Week, Awareness Week, my people, the OBGYNs, the Gray Journal, decided that they would release an article saying obstetric violence is a misnomer, saying that it is violence, but it's unintentional, so therefore it's not violent. And this journal is, right, its aim is to publish research, reviews, opinions, and clips, right? All of that will have an impact on the understanding of health and disease that has the potential to change the practice of women's healthcare. This came out from the journal, AJOG, yesterday. So yes, people were blowing my phone up and everything, but I also want to follow up by saying, this is 2024. On this slide, thank you to Dr. Keisha Good, Black midwifery enthusiast, scholar, sociologist. In her dissertation, she writes about quotes from white men OBGYNs in the 1911 American Journal of Obstetrics. And in that, the words in red are the ways that they describe midwives, immigrant and Black midwives. See that word: dirty, ignorant, totally unfit, untrained, incompetent. And we're going to go back to 2024, and they're still behaving in this way. So it's very crucial that we don't just talk about Miriam Sims. We can talk about these people on Dr. Shevnerek, McLeod, all of them. And I shouldn't even give them power by naming them, but they're on the slide. We don't have to think about Sims. We can think about these people right here and the people on the advisory board for this journal, so that I will still be able to leave you all some time to ask questions. It's crucial, right? RJ says that we have to revolutionize, reform, really dismantle a lot, including the quality and patient safety system. In these next slides, on the right, you'll see statements that we ask Black mothers. And then on the left, you'll see how their experience or their agreement with that statement related to their experience. So just wanting to have more information and support about lactation and breastfeeding or chest feeding that was specific to your culture and your identity. Black mothers, if you agreed or strongly agreed with that statement, you were 2 to 2.5 times more likely, using this scale that I designed with 1,100 folks, to experience anti-Black racism, misogynoir, disrupted kinship, dehumanization. If you just wanted to seek out a Black physician, midwife, doula, lactation educator, nurse, all the people on that slide, all the people with us today on this call, if you just wanted just one of us there with you, so you could redo your birth, any of the 806 Black mothers and birthing people who agreed or strongly agreed with the statement were 3 times more likely to experience anti-Black racism, misogynoir, disrupted kinship, dehumanization. Now, this thing back to the outcome. When we make outcomes the metric of safety, the target goal for how hospitals should perform, we then say all we think about, all we are concerned with is your survival. So when any of the 806 Black mothers and birthing people agreed or strongly agreed with the statement The hospital made me feel that because my baby and I survived birth, my experiences in labor, birth, and postpartum did not matter. That meant you only cared about our survival. And if any Black woman or birthing person feels like that, they are 6 to 8 more times likely to experience anti-Black racism, disrupted kinship, and dehumanization. Now, if the hospital were to behave like a doula or a Black midwife, where they feel that the hospital staff was available and paid attention to me when I needed help, if any Black mother or birthing person agreed with this statement, they were less likely to experience harm according to these 3 metrics. 87% fewer acts of anti-racism misogynoir, 90% fewer acts of disrupted kinship, almost nearly 100% fewer acts of dehumanization if you just paid attention to us and gave us what we needed and you were available. This is an example of how the scale can be used to compare hospital performance. And all you need to know from this busy slide, to the left, less, to the right, more. In the middle was our data from the 806 people. That was our mean, our average. So when we look to the left, these are hospitals who are actually outperforming the hospitals on the right in terms of mitigating obstetric racism around kinship, around one of the stories that I was going to share. And all the way to the far left are safety net hospitals. And the far left one is a safety net hospital where a midwife is a leader, is a director of obstetrics on the floor. Let me just leave it at that. Here's a story, again, what I would call a hospital stop and frisk. I won't go into that, but what this scale can do is that even if we don't have the scores from someone taking our survey, right, translating their story into a score, we can also look at their story and analyze it and map onto their story the different domains from our scale that are being violated or affirmed. And in this study, we actually evaluated the 806 Black mothers and birthing people who birthed with somebody in community, meaning the person present with them was not affiliated or aligned with the hospital. And what we saw is that a significant decrease, right, in reported experiences of obstetric racism across all categories of kinship, humanity, and racism. And that held true independent of people being married or in a relationship. So the stigma, the shame that hospitals and society imposes on single mothers or mothers who are parenting solo, independent of their relationship, it wasn't about marriage or partnership. It was about an advocate at your side throughout the whole course of labor, birth, and postpartum who was there to protect you. And I'll just end with this. Other things that we're doing that are operationalizing RJ is that we are connecting communities with our allies like Elephant Circle and helping people to translate their story into a formal complaint to the Office of Civil Rights, because obstetric racism is a quality, a safety, and human rights violation. And these states, these structures and systems within the state get federal money. So one way to refuse to resist community acts of resilience is to file these complaints. There's legislation that we can help write with you all that will help require your state departments of health to mandate obstetric racism via performance indicator. There's also legislation we can help you design in terms of mandating levels of maternity care. I don't think many of you all know that the way we care for pregnant people is based on neonatal levels of care. So we are prioritizing the entity that's growing inside of us over the being that's growing the entity. Just let that sit there, because that's actually a violation of RJ. It's the person growing, right? If they choose to maintain the pregnancy, it is their autonomy, right? Not the being inside of them, that we're supposed to be protecting their right to be pregnant, not pregnant, or to parent the current children in safe and healthy environments. So an emancipated birth, right? Because we are no longer enslaved people, right? An emancipated birth is a sacred birth. It's trauma-informed, it's pleasure-focused, it's power-activating, it's spiritual, inclusive, and participatory. It's liberatory. And the way that we can get to that is if we revolutionize quality and safety and grounding it in RJ. Thank you.
Oh my goodness. Can we do a silent clap in the chat? Put some hands up. Shout out Dr. Scott. I am sitting in my seat, Dr. Scott, just trying to synthesize everything that you have shared with us in a very brief period of time. And truthfully, I wanted this to go on and on. I also realized that you are a medical doctor and that I should have gone to medical school to interpret some of your charts. But I am very, very, very grateful and excited to have been exposed to this today. And I can see and feel the wheels turning in our audience as you make the connection between RJ, clinical practice, the medical industry. And on screen with me right now is Gabe Doyle, our Chief Health Initiatives Officer. And I wanted to bring Gabe on for our brief Q&A. I know we only have about 5 solid minutes for it. Gabe works, with me and beyond me with many of our clinical partners. He helps lead our major partnership work that is bringing systems and community-based workforce together. We co-design that work together with our health council partners, our doulas, the Alliance. And there is this challenging dynamic, of partnering with systems, while also holding systems accountable, hospitals and clinics where great care happens. And we have some of the best care providers in Dane County, in Wisconsin, highly ranked consistently year after year. But we also know from serving Black women and birthing people and patients that atrocities happen in hospitals and clinics, and that accountabilities are there on medical racism. And I love your term, reproductive and perinatal apartheid, that has not disappeared. And so finding that critical balance between partnering and driving new solutions while also holding accountable in a state and an environment where we do have to be advocates. And we do have to break down what quality means and who defines quality, who gets to say what quality is. The patient gets to say. And then the role of how we simultaneously, I love how you pulled out the simultaneous building of community-based care through our doulas, midwives, birth workers. While we also have to keep that other foot.
The 98.
The 98%. And this is an argument that we've had with folks who are like, you're spending too much time with the systems, you're doing too much, you need to just be building community-based care. Everybody's not going to have access to a doula or a midwife. Today, most of our clients are going to go into a hospital. So do we neglect that environment when the majority of, we cannot, it's imperative. And so, Gabe, I don't know if you generated a question since you're so steeped in this work every day, but while I continue to massage, throw one out there for us.
Yeah, Dr. Scott, I mean, just thank you. I tried to scribble a bunch of notes down to try and come up with some level of a question to be able to ask you, and then you would answer a piece of it with your next slide. And then I was like, okay, scratch that one. Let me move over to this one. But Lisa really teed it up, and I think it's something that our collective is really sitting with, but I would imagine collectives across the United States are sitting with this as well. A lot of what you shared today in the Black community is well known. Certainly Black women and birthing people show up to the hospitals fully understanding their bodies, fully understanding what their desires are to have a birth and a labor experience. And, since we started our own care coordination around Saving Our Babies and Connect RX, our wonderful champion, Dr. Tiffany Green, has always spoke about psychological safety and the experience from the Black woman's experience and feeling safe, not just patient safety or patient experiences metrics. So that is my long-winded intro to say, besides the thank you, as people continue to work with health systems, and I personally am on the hook in many times of reporting out gestational age, birth weight, avoidance of medical intervention, and latching, right? And these are very medical outcomes that go nice and neat into a hospital and health systems package.
Yes.
And yet we know measuring how the Black woman and birthing person felt during their experience is probably a better indicator at understanding, have we created that systems change that Lisa spoke about, and have we created a truly safe environment for Black women to show up holistically as themselves with their desires being adhered to? how do we, we, continue to help health systems understand that the focus on outcomes of yesterday aren't going to move the needle in reproductive justice and Black maternal child health of today, because that's where we really do see a challenge, despite commitment, despite shared resources, despite evaluation. So if you could speak on that a little bit, I think that would be very interesting.
Yeah. So I'm trying to, because of time. So I think, right, like when I think, because I'm also looking at that question, like how do birth workers activate, not them activate their voice, how to facilitate the system to also hear and respond to the voices of birth workers and also to the patient. I think the question to ask in these rooms when, as soon as you hear statistics go up, you could ask, depending on your perspective, what's the story behind the statistic? That's one way. If you are a more sciencey, quality person, researcher person, what's the experience behind that outcome? And they're going to be like, what? You just repeat it. What's the story behind the statistic from the patient and community's perspective? I see that you have the outcomes that you've recorded over time, but what did it feel like for the patient, the community, the birth worker to be in the presence of that team that led to that outcome? And then you just keep waiting. You'd be like, okay, great. What's the experience? And you can even say, I see that the standard of care was met, but sometimes the standard of care feels unsafe.
Just
So
because
yeah,
I have, oh, sorry.
right. No, just but I mean, like, so it's like it's a script. And what I do as a trainer, because I also do training, and I just did this I'm really proud of myself from yesterday. Or what day was it? This is Thursday, Tuesday. I actually did a training where I provided language from a published research from Black women, and this was around medical misogyny and HIV. But I put the language on there, and they had to respond whether that language misogyny or not, and I already trained them on that. And then the researchers talk about risk-based approach versus reason-based approach in HIV, which could also just be applied in obstetrics, right? And so the reason-based approach asks, like, honors our humanity and doesn't judge us for our decisions. Like one question was, pregnancy increases the risk of HIV. Well, let me rephrase it. You can pass HIV on from mother to baby if you are pregnant, but it was not said that way. It was like pregnancy, you are pregnant, you are likely to pass HIV to your baby. Now, that is accurate, right? That's an accurate truth. Yes, there can be a maternal child transmission, but is that the first thing you should say when a Black woman shows up in care? So it was interesting. So once we did that, then the next question was, imagine how a Black woman feels in response to that provider language. And all the Black women were like, dismissed, degraded. I don't even feel like I could be a mother. So you can see how people responded to say, well, that was an evidence-based response. I'm like, you're correct. But even through evidence, right? Even through scientific rigor, accuracy, you're still degrading, right? Dehumanizing Black women, which is why I say you can be equitable and still be racist. You can meet me where I am and optimize my conditions to give birth and still treat me in a way that's anti-Black, misogynistic, or so I think that someone says about the intersections, it is. I think what I bring to it is that I'm driving the part around, yes, this is scientifically accurate. Yes, this is a standard of care. And yes, simultaneously, you are degrading Black women. Yeah.
Dr. Scott,
I know we can keep going, but thank you. I
know.
appreciate you
Listen,
all.
I've already decided that we need to bring you back because there's, there's not enough time. There's 5 long questions in the chat. We will not get to them. I am asking, can we follow up with you with a couple of them?
I want you to follow up with me. I would love to come back, even just do a fireside chat, because I like the writing may get hard because I'm writing my book right now. But if you can do something, bring people back where we just Q&A, I would love to do that. But I appreciate you all. Thank you for this opportunity. Thank you, thank you, thank you.
Thank you for joining us. Thank you for the amazing work you do. It precedes you. Thank you for what you've illuminated for our health system partners. There were physicians in the room. Some have talked in the chat. There are still some here. There are decision makers in that arena who this talk was especially important for, and we hope they are taking notes. And the question was asked, can we get your tools out to people? Let us know how we can follow up.
Yes.
so much.
We can email each other. Have a wonderful rest of your summit. I really appreciate you all. Thank you for the digital flowers. It makes me feel good to know I'm on the just track, right? So thank you all so much. Take care.
Thank you. And now you all, it's time for a brief wellness break featuring Christine Russell, our wonderful Director of Health and Wellness Programs here at the Foundation, and a short video clip that will set us up for our next panel. So we will see you back here, but tune in to this wellness break, and we hope you're having a great time at this year's 4th Annual Black Maternal and Health Summit.
Thank you, Lisa, and greetings, everyone. Thank you so much for investing these next 10 minutes into yourself as we align, we link breath with movement, we honor our bodies, and re-energize ourselves for the afternoon. So go ahead and clear a space around you, kick off your shoes, and let's go ahead and dive in. Sitting up nice and tall, feet together, shoulder blades are back, reaching the fingertips down towards the earth. We tuck the tailbone under to engage those core muscles. Let's take a few deep breaths. Inhale. And exhale. Inhale. And exhale. One more time. Inhale. And exhale. Beautiful job. Inhale, arms come up towards the sky. Exhale to heart center. Inhale, open the arms up to cactus. Releasing together, arching the upper back. Inhale, arms come up towards the sky. Exhale to heart center. Open up, cactus arms, opening the heart. Good. Reaching forward together, arching through the upper back. Inhale, arms come up. Exhale, heart center. Open, cactus arms, open the heart, and reach around together. Last one here. Inhale up. Exhale, hands to heart center. Open, cactus arms, opening the heart. Reach around together. Beautiful job. Releasing those arms down. We're going to take 1 foot forward and 1 foot back. Now, looking back, I want that back foot to be in about 45 degrees. Right foot, the heel should be right in line with the arch of that back foot, okay? Hands come to the hips as we rotate the hips over that front leg. Coming down, bending the knee. We're preparing for warrior 1 here, but let's look over, make sure we can see those toes over the knees. If not, I want you to move that knee back, okay? We're sinking straight down to the ground. Hips are rotated forward, arms come up. Plug those fingertips into the ceiling. See if we can come down a little bit further. We are in warrior 1. Let's go ahead, open up those hips, reaching the fingertips out to the side, plugging those fingertips into the walls on either side as we gaze over that middle finger. See if you can come down just a smidge more, but make sure you can still see those toes. Good, let's go ahead, bringing the elbow down to the knee. Top arm comes up over the ear. We are in side angle. Good job. Let's go ahead, inhale, switching to the other side. So rotating the feet. So now our toes are pointing forward here. Back toes are at a 45-degree angle, making sure that the heel of the front foot is right in line with the arch of the back foot. Coming down, opening up, we're going to plug those arms into the ceiling for warrior 1. You're going to feel that beautiful stretch on the side of the hip there, the front of the hip. Looking down, making sure we can see our toes. If so, let's go ahead, opening up into warrior 2. Reaching those fingers strong, gazing over the middle finger. See if we can come down just a smidge more. Elbow comes down to the knee, top arm comes up over the ears. Great elongation of the side of the waistline here. Breathe. Let's go ahead, flip to the other side, rotating those feet, moving into a float here. So inhale, lifting up. Exhale, we're gonna come down. Inhale, lifting up. Warrior two. Side angle. Let's switch to the other side, rotating, pivoting on those feet, easy peasy. Arms come up. Exhale it down. Inhale, lift it up. Exhale, warrior two. Side angle. Let's do it one more time. Let's go ahead, flipping to the other side. Warrior one. Exhale, bring it down. Inhale, lift it up. Open, warrior two. Side angle. Beautiful job. One more time on the other side, just pivoting on those feet. Warrior one. Bring it down on the exhale. Inhale up, we come into warrior two. Side angle. Beautiful job. Go ahead, coming to center. Feet are forward, hands are on your hips. We're gonna exhale, forward fold. Beautiful job. Take a nice inhale, reaching up, arms reach up towards the sky. This is our last song, everyone, so let's give it our all. Fingertips are reaching out, toes are pointed out, 45 degrees. Inhale here, exhale, pull it down. Inhale up, exhale down. Good. Flowing with the music, flowing with the breath. Good job. Good, we're gonna reach in here. Now exhale, forward fold, and open. Good, exhale. Inhale. Exhale. Inhale. Beautiful, last one here. And open. Now I want you to go ahead and reaching those hands to either side, bending the knees, and up. Exhale, inhale. Exhale, inhale. Good. Last one here. On each side. Good. We're almost done with this lower body. Let's go ahead. Hands come behind the head. Inhale here. Exhale. Elbow comes into the side and up. Good. Side to side. Moving with the breath. How are those glutes feeling? Keep it going. Excellent. Let's go ahead. Bring those feet together. Shake it out a little bit. That was hard work. Y'all did a great job. Good. Releasing those, that shoulder back, hands to the hips. We're working on some balancing postures here. So, crossing the ankle over the knee. How are we feeling here? Do we need support? Do we need a chair? Do we need to sit down and do this? Modify as necessary. Good. Hands to heart center. Squat it down. Flexing the feet. Looking at a point about 3 feet in front of you to focus. Good. Releasing to the other side. Finding your stability here. Other foot crosses over. Flexing the feet. Hands come to heart center. Find your point of focus and bring it down. Excellent. Good. Going ahead, coming back to our standing posture. Taking a breath. Honoring ourselves for taking this moment to align with not only ourselves, but with everyone in this virtual community.
We're going to have our tech team turn it over now to our next facilitators, Michaela Berry-Smith and Tamara Thompson. members of the Black Maternal and Child Health Alliance, and of course, Michaela, our manager of maternal and community health initiatives, who will also introduce Tamara. Good afternoon, ladies. Welcome.
Good
Welcome.
afternoon. I'm so appreciative of everyone that has been with us throughout the day, and welcome to those who have joined us. We are in for a wonderful panel. This has just been a wonderful day of celebrating the work that we are doing and the work that we're moving. Our panel is called Midwives and Birth Justice Advocates, Raising Our Voices and Making the Difference from the Front Lines. I'm thrilled to be here with my own doula trainer, friend and co-moderator, Tamara Thompson. She is a Black femme activist, a lactation counselor, a doula, a childbirth educator, and a student midwife. She's also the founding member of the Wisconsin Doulas of Color Collective. She is the co-founder of Harambe Village, and a community-based doula organization that is here in Dane County, and also Maroon Calabash that's doing amazing things in Milwaukee and the surrounding area, which is also a Black woman-led reproductive justice organization. Thank you for being with me here today, Tamara.
Thank you.
On our panel, we have the illustrious Rasha Tahani, lawyer queen, CEO and owner of Gather Ground Midwifery and certified midwife. We have Tony Taylor, co-owner of Chicago Birthworks Collective, and Teresa Fortune, who is a made a documentary that we unfortunately were having some technical difficulties with, but hopefully we'll be able to get a view of that later on. An activist and founder of Communing with Community and Maternal Health Advocate. Thank you for being here with us. I do also encourage those that are in to please look at their bios. They are much more than what I was able to lift up. And I would like for you to learn more about that. And now I turn it over to you, Tamara, for the first question.
Peace, everyone. I'm so glad to be here today celebrating from the headquarters of the Wisconsin Doulas of Color Collective in Milwaukee. So the first thing I just want to do is break the ice a little bit. And if I could ask each of our fabulous panelists to tell us a little bit about themselves, what brought you into the current work of maternal and child health and reproductive justice space. Can we start with Rasha?
Sorry, I had to unmute myself. Greetings, my name is Rasha Tahani, Lawler Queen, and I am honored to be here. I am a fourth generation midwife. I grew up hearing my grandmother and my aunt talking about midwifery, talking about babies. One of my first memories of midwifery or of birth was my grandmother telling the story of putting a baby on the oven door to keep them warm in the NICU. So that's where I come from, and I've been honored to do this work for over 20 years now, and I'm sitting in the birth cottage now in between appointments, and it's just been a pleasure to be invited to be a part of this space.
So glad that you're able to join us today. I'm so glad to hear from you. I'm looking forward to much more. Tell us a little bit more about yourself, if you could please, about reproductive justice and about what brought you to maternal and child health. Would you please go, Tony?
After I turn myself off of mute. What brought me to this? I'm a mother of four, and for me, I've always been interested in doula work and just supporting women around any hospitalizations. But I think it all kind of came to an head when my daughter had her baby, and I was supporting her through birth. And at her second child, we both decided to start Chicago Birthworks Collective to make sure that, future generations in our own bloodline and ladies, that we come in contact with would and could have support, that was curated especially for them.
Mm-hmm. Thank you so much. Oh, I'm sorry. I didn't mean to cut you off. Was there more?
No. I was like, did that answer the question?
Indeed it did. And then one more panelist, would you please unmute yourself? I don't want to mispronounce your name. I know there are two different ways to say it. Can you help me?
Yeah, of course, I got you. My name is Teresa Fortune. I am a maternal mental health advocate, multidisciplinary artist, but today's focal point is highlighting the work that I am doing by sharing my personal story through postpartum depression. So, in short, I've single-handedly documented my own mental health journey, and the core of that was never being diagnosed with postpartum depression, and having to really pull myself out of the pits by myself. And so I share my story to not just inspire us as people, but to also hold healthcare providers accountable, and to have them rework the idea of what they consider care to be. So my personal story is a universal experience, and I'm really, really grateful to be in the space with you all today.
Well, thank you all for sharing. I mean, it's so beautiful, the diversity in birth working, especially in the Black community. You know, we don't have just one box that we all fit in. We're able to unify and bring our individual experiences. It's important to center all of our experiences and especially women like yourselves working in the trenches and on the front lines who are closest to the issues impacting Black mothers and birthing people daily. As you think about our theme today, building our collective power to secure reproductive justice, how does this speak to you as an individual and to your work and the urgency of what you see women doing in the work? Teresa, would you like to go first since you went last the last time?
I would actually love to pass it over.
Sure.
I'm here as a speaker, but I'm also here as someone who is really excited to learn.
I love that.
Yeah, so I would love to listen in and to kind of fill the space for just a moment. Thank you for your flexibility.
Yeah. And I also give space for processing. I am a processor, so I understand as well.
Thank you.
I'll go. Can you ask the question one more time, though?
Yes. So thinking about today's theme, building our collective power to secure reproductive justice, how does this theme speak to your work and the urgency of what you are doing in the work as a Black woman?
I would say that we are definitely here at Chicago Birthworks Collective, we are definitely focused now more than ever with all of the policy changes, with growing the collective so that we have more access to better care, to more to educated doulas, to empathetic doulas, to and the connections that we make, not just in doulas, but with hospitals and midwives and OBs and nurses, in terms of like our brand being respected when we go into hospitals and being, welcomed, and, them saying like, oh, you guys are on our website. We're making sure that our clients know about you and that you're available, and then having our studio here in Hyde Park, I spend a lot of time coming up with classes so that moms have a place to go and dads have a place to go to talk about things that are going on, like postpartum. We have a lot of postpartum groups. We have lactation classes, just making sure that needs are being met across the board, that, every time, once we start seeing sequences and things and, and as it relates to needs, making sure that there's a response or a solution for that, even if it's just a few people, because eventually they'll all come. They'll all, you know what I mean? We started off with just me and my daughter, and right now we probably have like 40 doulas, so I'm just excited. I'm excited to be in this space. I'm excited to be doing this work and to, be in a position to affect the statistics and not always just talking about the statistics and being a part of the ever-changing solution to, you know, all of the statistics. Like, it literally turns my stomach to just talk about the issues as opposed to just talking about, we all know what the issues are, but what are we all doing collectively as Black women? You know, I come from a family full of women, you know, and we are our sister's keeper, you know? So we have to put a little skin in the game so that someone else can be saved and someone else can have something that we didn't have. And, you know, not every situation is going to be perfect, but if I can sacrifice a little bit of myself so that yours is a little bit better than it could have been, I'm willing to do it.
Yes. I love that, Tony. Thank you.
So I'll go.
Yes.
Well, for me, I will give context. I'll provide context. I am an outsider where I'm at. I am from California, born and raised, and all of my lineage of midwifery lives there. They were Black folks that migrated from the South. They migrated from Oklahoma, the Bayou, and from Texas. And so we now have several generations that have come up out of LA. So moving to Richmond, Virginia, in support of the lack of Black midwives here, I was very clear that it needed to be, I needed to come with solutions. I needed to come with very clear, like, what my role was here in this new place, in this new space as an outsider, because we don't talk about that sometimes. In Black communities, yes, Black folks is Black folks, but we're different based upon where we're at. And so when I got here, there was one Black home birth midwife, and she's not even around all the time. And so I already knew, yes, I wanted to open a space for people to have babies. Yes, I wanted to be here and offer my services to the community. But in direct response to the question you're asking with regards to collective power, I knew that what this place needed, what this space needed, was for the Black students that were trying to become midwives, that had been gate kept from moving on, from becoming credentialed midwives, that my responsibility, my role was to use that collective power of, okay, well, we're going to get the Central Virginia Black folks together as midwives, and I'm just going to help make that happen so that this place has midwives that are from here, that has midwives that represent and reflect the community. And I'm just here to help. I am in the truest sense form of midwifing, in that I'm helping them get to where they need to be so that they can continue to serve this community. Because I am an outsider. And so being clear about our roles and our responsibilities in this work. Yes, we need midwives. Yes, we need birth workers. Yes, we need folks to help with the perinatal issues, the postpartum issues. We all have our roles and our responsibilities, but it's, where do we shine? Where can we create the most impact, the most positive change, like Miss Tony was saying? And so for me, it was creating this space, Gather Grounded Midwifery, but then creating an apprenticeship program that provides money for learning midwives, Black student midwives, because the biggest barrier for Black student midwives is, how am I going to pay my bills while I'm in apprenticeship, while I'm studying to become a midwife? So we took care of that. They getting a nice fat check every month. They get a month off of rest, because what do we have? We got a whole bunch of Black midwives running around tired, burnt out, trying to serve everybody, trying to serve as many people as they can, and not pouring into themselves and not taking care of themselves. And so then where do they have the capacity to teach and continue this learning and this educating in the community? And so in regards to the collective power, it's empowering or supporting and uplifting the power of those that are already here doing the work, and just helping them get to the finish line, helping them to then support their community, and just being around to support them in what they're going to accomplish, which is, this place will go from one Black midwife, out of hospital midwife, to 4 in a very short period of time, without having to deal with the barriers that come with it. They're getting the education from other Black midwives in this community. We have hospital-based Black midwives that have experience in home birth. And so these learning Black midwives, they're getting education from not only just me, because we can't learn everything from one person. They're getting it from 2 Black nurse midwives who've done home births, twins at home, breech at home. So these are also fearless midwives. So they're not teaching fear. So we are hopefully creating a foundation for specifically Central Richmond to now flourish and thrive with the number of Black midwives that we have.
There's a reason I wanted to go after y'all. You know, thank you so much for warming up the space. I'll be very, very honest with you. You know, this is a big week for all of us, and I've been having a lot of meaningful conversations. And my job as a woman coming into the space with the lived experience, documenting my own journey, my job is to listen and to do more market rate research and find the value in other platforms so that I can amplify resources that I personally want to endorse and share with other mothers. So as a woman who has documented my own journey, I am really inspired by Henrietta Lacks, to be quite honest with you. As a storyteller, my job is to, I want to say, restore the soul of healthcare. But I think what's in question is, you know, does healthcare have a soul to begin with? As fundamentally speaking, I believe that healthcare was built on and around racism and metrics that were not designed to support bodies that look like ours. So I'm not here to perpetuate fear, although my film directly represents suicidal ideation and the things that I personally suffered with. But on the contrary, I'm here to inject more hope. And I'm also here to tell people that I refuse to wait on the policies to change. I refuse to wait for our healthcare providers to rework the idea of care. And I'm here to remind everyone that healthcare is a supplement. The core of everything that I need, I was born with. I'm a Black woman. I am the original producer of all things that was, is, and could ever be. And when I say I mean we. So I listen because I'm in a really unique position to broker relationships and to amplify the resources that healthcare needs, not just mothers. I work very closely with Kaiser Permanente. That's one of my biggest screening partners right now. We had a big event yesterday. And the question in the room was, what can we do? Well, what you can do is reach into the community and grab the resources that are already available, fund our community partners, and broker opportunities around cultural humility, cultural sensitivity, so we have a better idea of what cultural competency even means. And so my work is important, again, because I'm here to hold our healthcare providers accountable. And if I put my story in front of you, and I'm the first person in our country to provide a case study for 10 years, if I'm showing you what it looks like, you have no excuse to say that you don't understand. And so I'm a part of the accountability team, and I'm really excited to amplify all of the resources that you wonderful women have created so that we have a more sustainable journey within motherhood. So thank you.
Amazing. Thank you all so much for those powerful responses. I'm still marinating in some of it because the next question that I was going to ask has already been answered by all three of you. The next question I wanted to pose to the panel was, what were the unmet needs that you were witnessing, both personally and in your community, that led you to initiate the work that you're doing? And you already answered that. But one of the things that kind of organically also came up in that last bit there was the term out of hospital birth. So I'm wondering, how is it that hospital birth has only been the normal for 100 years? And here we are using language that says out of hospital birth, as if that's the strange thing, as if that's the anomaly. And I'm wondering if you can talk a little bit about how did we get here in comparison to where we were 100 years ago, roughly, and how we got to be where we are today, and what is the psychological framework or the mental understanding of what is normal on how folks get born in our community. Can any of you just take a poke at that for me?
I think I'll go with this one. That's a really deep and wide question. Well, I think if we go back, you know, the eldest profession to mankind is midwifery. Somebody delivered the first baby. And when our hands and our hearts are involved, our intuition leads the way. And so before the textbooks came out, before all of this curriculum came out, which is really driven by capitalism, in my opinion, Black women, we got into the original origin and what it means to birth a baby into the village. And so we're in America. And so I'm pretty sure we are all well aware that capitalism is the driving force behind everything. So when you're focused on money, and we look at the data that talks about women and the C-section rates and how they're pushing this on our bodies, and how much are they getting paid per C-section? You know what I mean? So I believe that capitalism has destroyed the idea of care. I believe that most Black women feel more comfortable birthing their babies at home. But again, because we are in America and we think about our doulas and midwives, the business model behind the hard work is not always sustainable for them to show up and to deliver wholesome care. So now we are expecting impartial hands to deliver wholesome care, not only through the healthcare lens, but also the heart workers that are just trying to, do you have enough food? Did you have enough gas to get to this appointment with me today? Are you giving me your last to do the work that you really want to do? And so in my opinion, capitalism has destroyed so many things that it has stripped this experience of humanity. And it has stripped opportunities for us to operate in our fullness as human beings. So I want to get back to the basics. You know, if I were to have another baby, which I might, I'm a little interested. I don't have as much fear as I did originally, because I now know that there's a midwife, there's a doula. And when I was pregnant, I thought all of that was for fancy white people, to be quite honest with you. I don't have enough money for this service. I barely have enough money for food. So now I'm forced to rely on my OB, who I know is probably going to fail me, because there's never enough time for them to care for me as a patient, let alone my baby or the father. Let's not forget the fathers, you know. So the metrics are disrespectful. Capitalism is destroying the idea of care. And our birth workers do not have enough support to do their jobs in a way that is meaningful for them and the mother and the family in their entirety.
I
Thank you
agree.
for that. Go ahead.
I agree with you about capitalism being a driving force in that. But Tamara, when you asked the question, what popped up into my head was fear. And if you can create a fear in something that is normal, that is constant, something that has been done for ever, right? And now you dismantle that, you're also talking about like the destruction of the Black family. So if you deconstruct and you tear apart the Black family, you can pull them in different directions. So you're pulling them toward greed and access, thinking that this access to this hospital is better than this before. Kind of like the thing of like soul food, right? Oh, I don't eat that. That's for, you know, my daughter used to say, that's slave food. I'm like, okay, all right, you don't gotta eat it. You don't gotta eat it. But it's our history. And when we move away from our history for whatever reason, we're moving, it's not always a good thing in terms of the movement that we're having. but it takes us away from the center and the focus of what was working. You can't destroy a ship and then say, oh, I built you a better ship. There was nothing wrong with the ship that we were floating on. This was working fine. It is working fine. And now trying to re-educate and reassimilate everyone's mind into something that was already normal, it's a little bit of a challenge in the midst of still dealing with all these other systemic racism inside the hospital, the stuff between each other and the classism and all those different things, but one of the things I tell my clients is the hospital wasn't there when you made the baby. You didn't need anybody. Nobody was there. They didn't get you a snack after. They didn't grab you a towel. Nobody got you water. But now all of a sudden, when it's time for this baby to come out, they've made you believe that you need all of these people with all of their stuff, with all these lights and cameras and that, and they're putting you, don't touch this, don't touch that. Wait a second. How am I contaminating myself? How does my partner have to wait outside and he can't do this, he can't do that, or they can't do this, or they can't do that? Like, that disrupts the whole bonding process of everything, and it continues after that. They just got to the point of seeing that you shouldn't separate a baby from the mom after delivery. That thing of taking them to the nursery. Oh, we're trying to help you. You weren't there when my legs were up in the air and I made this baby. Now all of a sudden I need your help to the math is not mathing for me. So I'm sorry if that was vulgar, but I mean,
yeah. I like the notion of Salt and Pepper's song in the 90s. Let's talk about sex. Go ahead. It's okay. Is there anything more you would like to add to that? And I'm afraid of mispronouncing your name. I think I got it wrong the first time. Can you help me, please?
Sure, of course. It's Rasha.
Rasha, thank you. What would you add to that discussion about how we got here to out-of-hospital birth, knowing that in other countries, people start with a midwife and they have to have certain amounts of risk before they get to an obstetrician. And here we are in the United States with a person who is uncomplicated, singleton, no risk, and they are starting out with an obstetrician. How did we get here?
So, it's already been said. My co-panelists, they made it clear, they made it plain, and I will just put my little super blackety black 2 cents on there with theirs, and that is the foundation that was laid for us in this country was from a place of stolen information, stolen legacies, stolen history, stolen means of healthcare and safekeeping. All those things were literally beaten and raped out of us. So when you are told that this is what you deserve, this is good enough for your whole entire life and for all the generations before you, and you see white people having a very different lived experience, and then you're invited to be a part of that experience, then unfortunately for many of us, it's, oh, okay, well, it's poor people to breastfeed. It's poor people to put your baby on your chest. I'm not doing that. Oh, only poor people have their babies at home. I'm going to the hospital. I want a suite. I want a room. So it's the mentality of it. And then if you have never had to pay for your health care because you've always received it either through your job or through the government, the thought of, I'm going to pay money to receive care, but I don't even really truly understand what care is, it doesn't make sense. And it's only after families have the privilege, because it's a privilege to come up with the money to pay for support in your birth, to pay for an out-of-hospital birth, to pay to birth with midwives, to pay to birth with Black midwives, if there are some in your area. This is a privilege. And you don't understand the healing that comes through that until you experience it, because you think that the healthcare you're receiving is care and you getting treated like trash, but you've never experienced anything else. So you're like, well, why am I going to get a midwife? Like, why would it be so much better? Why would I pay money? Because what I'm getting is, I mean, I guess it's okay, until they get the care. And then they're like, oh, like, you know my cat and my dog's name? You know my grandmama's name? Like, you know, I share with people all the time, I say, the time that you spend just interviewing a midwife is usually 30 minutes to an hour. You won't get that from your OBGYN. That's including postpartum. You're not going to get an hour of their time. You're going to get a whole bunch of 3-minute, 5-minute, 10-minute snippets, and that's it. And so it's the educating of our community. It's the making sure that our community has access to the information, even if they can't make the choice, that they have access to it. Black midwives, you know, it's hard to become a midwife in this country. Folks make it real difficult. White women made it very difficult for us to reclaim what is ours, which is taking care of our community and our pregnancies and birthing. They've made it very difficult. And so, of course, then we have a community that doesn't understand it. The majority of the Black community, the Black birthing community, doesn't understand why they have to pay so much for a midwife. And so it's all of these things. It's a lot of unlearning. It's a lot of educating. And it's a lot of, you know, I say getting to our communities before they're even thinking about having babies. I love talking to the babies at school about reproductive health and giving them the options of midwives and birth workers and all the different ways that they can take care of themselves, that they don't need to hire anyone. That if they want to just take care of themselves, they can just take care of themselves. Like, that the intuition that Black people have is not that the intuition that Black people have is good enough. You know, that it doesn't have to be evidence-based, that it doesn't have to be well studied. If somebody is sitting in front of me and says, oh, my periods are only 26 days and I don't think I'm going to make it to 40 weeks. And it's like, no, you're probably not. You have short cycles. You probably going to have a short gestation period, but a doctor's not going to do that with you. And a family wouldn't even know to think about that. So it's educating our youth, educating folks before they even get to this place, so that it's not so far away from them, that it's not so like just out of the reality of possibility, but it's also, you know, for the white people that are willing to, making them pay. Being like, so you care about these statistics? Because they haven't changed in the 20 years I've been doing this. They've only gotten worse. So if you care, then put your money where your mouth is. Pay for people's midwives, pay for people's birth workers, pay for people's childbirth education. But I will always remind folks is that a doctor is never going to tell you about a midwife. A doctor is never going to tell you all the things that are going well with your pregnancy, because they're skilled and trained to tell you all the things that are wrong and prepare you for the surgery that they know how to do oh so well. So it's really, for me, it's about the education, and it's about the creating access to information for our community so that they at least have the information to make the best possible decision for themselves.
One thing to add to that was so good and educational and nutritious. I'm in California, and I do a lot of work with my local county, Alameda County. I do a decent amount of work with Kaiser Permanente too. And I feel optimistic because where I live, Kaiser has created an initiative where they are actually reimbursing mothers and all birthing people that are on Medicaid, Medi-Cal, so that they have access to doulas and also midwives. So I think that, again, going back into making sure that we create a holistic experience by brokering community relationships, so that when mothers and birthing people come into this space, there is psychological safety. Because oftentimes as a mother, I was totally exhausted. I was disrespectfully exhausted. And oftentimes I didn't have enough money to even go to my doctor's appointments. I didn't have enough gas, or I'm in my fatigue because I didn't have enough food. So I love everything that you're saying, because when a mother is operating in her fatigue, rightfully so, it's a big deal to create a human being. um, Having a doula and or a midwife, it's almost like walking into the space with an abolitionist, someone who is prepared and educated to speak on my behalf, and to also break down some of that terminology so that I can actually digest it, take it home and unpack it. And also having someone that can not just educate me, but my partner. They're two people that made this baby possible. And so oftentimes, if we don't have access to the doula or the midwife, if the OB would take the time to acknowledge my partner and to educate them, and then there's two people that can go into the system more prepared for all outcomes. So I just want to say thank you, Tony, everyone on the call right now, for all of the work that you do, because you are so valuable and so necessary. And had I had access to one of y'all, I wouldn't have never had to deal with postpartum depression. I would have had someone to unpack the conversation as to why my breast milk dried up because of all of the outside things that were going on in my life that my body internalized and shut my milk off. I had never heard of a lactation consultant. So without a doula or midwife, I don't believe that the birthing process and its fullness will be experienced, because we need help and we need you there. So thank you. Thank you for all that you do.
One of the things I wanted to add is I think that Black women need to reimagine their value in this world. And we're more than our nails. We're more than our bags. We're more than these, all the stuffs and things, you know? And I like nice things, don't get me wrong, you know? But when it comes down to making a person and caring for a person that took me a year to make, I'm just not gonna let, you know, anybody help me with this, or anybody, you know, say, yeah, I think you should do this. But why? You know, just the, even if you do go to the hospital, we're not even, we need to be educated on how to go to the hospital. You don't just take the first thing that they tell you. Just because they offered you a medication, how long has it been on the market? Is it still in the testing phase? You know, what are the side effects as it relates to you as a Black woman and your Black child? You know, what are the long lasting side effects of this stuff? You know, and I don't think if we really understood who we are, and that a lot of things are derived from us, you would move with a little more, I don't know what you want to call it. You would just move differently in this world, you know? And so when you say about the money aspect of it, I just think that our values are off, because we can find money to do the things that we want to do, you know? And then when it comes down to something like this, you want to go back and forth with me. I don't want to do that. I don't want to do that. If you don't think you're worth it, then believe me, I can't spend my time trying to, you know what I'm saying? Go to the hospital, you know, call me if you need me. I'll still pick up my phone, but that's too much work to do, you know? And I grew up in Cali. There's a psychiatric museum in Hollywood. And it talks about the history of like eugenics and psychiatry. We were crazy just for being Black. We were deemed unfit for just being, so like, come on, you know? And then this same medical system, now you're going to trust them with somebody that they didn't even think you should have made in the first place. I don't get it. I don't understand. I don't understand. So we definitely, as Black women, we definitely have to hold ourselves accountable to ourselves better and see our own value and hold other people to that value. You know, that we are deserving of everything that's available, not just because, you know, Susie had it or this person had it or that person had it. If it's available, we should have access to it. That's just it. And I
Right.
should have the ability to say I want it or I don't want it.
And I think that's the main problem, is that we don't have the ability to say that we want it. You
Mhm.
know, I'm speaking from a lived experience. Had I
Yeah.
had the money to afford food, I mean, we have to weigh out the priorities here. We have to weigh it out, and we have to look at the landscape of the birthing people that are coming into, and just existing as a Black person in America is already expensive,
Yes.
mentally, emotionally, financially, spiritually. It's a
Same.
very big expense to exist on this continent. And so when we don't have the finances or the wherewithal to negotiate prices with doulas and midwives, because that's a business entity, that
Yeah.
totally takes me out of the heart space of birthing a baby. And I don't have the energy or the stamina to negotiate prices, which is why our healthcare providers needs to make the business model for birth workers more sustainable, so that the mom and the birth worker are not having to do this to reevaluate a value when we don't even have the education to understand why it's a necessity to have you in this process. So I think that if we could rework the business model and demand healthcare providers, all healthcare providers, even outside of California, to say, in order for this data to improve, we need you to broker and finance proper relationships between the birth worker and the mother, so that we can have a healthy baby. And I think that a part of capitalism, again, is the divide and conquer in this conversation. If I make it more difficult for you to access the birth worker that you need, that is a higher probability that you're going to show up without them, which means that we've got free reign to do what we want to do. We can press the C-section on you. We can do whatever we want to do. We can say, you have to take this medication. I know you don't know what this medication is for. You can barely pronounce it. You know, so again, I just want to reiterate, a part of the capitalistic mental state of existing is to put and implement the divide and conquer, and to make it impossible to have the resources that we absolutely just deserve. We deserve a doula. We deserve a midwife. You know, out here in California, I think UCSF is, I don't know if they've already done it, but they want to eliminate the midwifery program altogether, which is ludicrous to me. Because here we are asking and really begging for this resource to be available to us, because we don't trust the healthcare system right now. And now we're eliminating it out of some of the most prestigious institutions to give us more birth workers. So it's a very, very it's a very layered conversation. I'm really fascinated with the business model behind all of it and how it's affecting all of us individually. So love the conversation.
I appreciate you for bringing that up. Black people are not in a position in the United States to govern the institutions that govern our lives. So thank you for bringing up the economics. Thank you for bringing up essentially at the root of a health disparity is a power disparity. So I appreciate
So
you so
true.
much. Mickey.
This conversation has been so authentic, and free and flowing without having to be your typical panel. And I love that, because that's really what shows how we're sisters in this work, and we understand each other, but we're also able to lift up things to learn. Teresa, Tony, you really lifted up the transition into this and talking about eugenics and psychiatry. And Teresa, I really want to, due to time, we have the opportunity to show part of your beautiful film, From the Ashes. And we're going to end this panel being able to view 5 minutes of, and I really encourage anyone who's able to see this to be able to get access. But Teresa, please share with us what you hope for us to take away from this viewing.
Absolutely. So this is the kind of later part of the film. The top part, the beginning, is really focused on all of the disparities that I had to experience as a mother, documenting the mental health journey for 10 years. Up to date, my medical charts still don't indicate that I suffered with postpartum depression. And so I did the hard, heavy lifting work as a Black woman because I know that I'm built for my baby and I know that I'm built for this journey. And so I want to end this beautiful segment with really just highlighting the joy of motherhood. It was a lot of work to find my joy, but it was so worth it. And so I hope that you can walk away from this conversation feeling more inspired in your advocacy, in your personal life. And if you are a parent, in parenthood, and know that everything that you are experiencing, whether it be easy or hard, you are absolutely built for it and you are not alone. And I encourage you to lean into the resources, to lean further into the community and know that we got you and we are doing the work and you are so deserving of all that we do. So thank you.
Love it. Thank you. And with that, please enjoy.
To be a mother is such a heavy and incredible opportunity. There are many privileges built within the relationship. On the contrary, if you forget the essence of who you are before you became a mother or a partner or any of the titles that you are wearing, you have to remember who you are. And in doing that, my ask of you is to give yourself permission to feel the emotional spectrum. So I'm asking you to press forward. I'm not asking you to fight. When you fight, you may lose focus of your why. When you press forward, you may find the flow that you truly deserve. You remember the joy that you felt as a child when you were playing and you had the most audacious dreams that we frame as imagination. Those things can become your reality and you can manifest the life that you deserve. But I also want to make sure you understand it is work. It is a lot of work and it is worth it. Your play, get back into the richness of your life. Get back into the laughter. Surround yourself around energy-rich individuals and environments. You have permission to feel. You have permission to be sad, and you have permission to be happy, and everything in between is just the process. Failure is also incredibly important in this process. You have permission to fail because you have permission to start over again. Your environments are incredibly important. Sisterhood, for me, was my saving grace. So I've had access to support, and my goal here is to make sure that you have access to it as well. It may come in the form of therapy, which I highly recommend, but for the majority, I want you to know that you can curate your environment, and when you do that with intention, that too will become your saving grace. So go home, go inside of your body, go inside of your heart, and address the internal fight. The fight is never on the outside. The fight is on the inside. It's the late night conversations between the mind, the body, and the spirit. And when your spirit is just deathly uncomfortable, it continues to shrink down and it's knocking on the walls of your body. And in my opinion, that is what depression is. It is your body communicating with your spirit, and there's something that is missing. So go home and have that conversation with the mind, the body, and the spirit. And always remember, you are not the mind, you are not the body, you are not the thought, you are not the emotion. You are whole. And the goal is to find the harmony in this experience and to get on one accord with all of the moving parts of who you are. Hold on. You are not alone. You are loved. You are worthy. And every breath that you take is a measure of success. I'm a Black woman in America. Superheroes ain't got nothing on me.
Beautiful. Beautiful. Thank you, Teresa. Thank you, Tony. Thank you, Rasha, for giving us your time and your presence today. We honor you and the leadership you offer in building our collective power to secure birthing justice. Next up, we will transition to our final panel for the day. I'm pleased to introduce Mama Carla Gaines, Community Liaison, Senior Advocate for Black Women's for Quartz Health, founding board member of the Foundation for Black Women's Wellness and Black Maternal and Child Health Alliance member, along with Zakiya Sorensen, dear friend, outreach manager, UW Collaborative for Reproductive Equity, Department of Obstetrics and Gynecology at the University of Wisconsin, School of Medicine and Public Health, as well as a Black Maternal and Child Health Alliance member. They will guide us through our final panels of the day. Thank you, ladies.
Thank you, Michaela. And welcome everyone to our afternoon panel. I'm just trying to just continue to breathe through that throughout this entire day. I'm just trying to breathe and take it all in. Our last panel for today is Changing Systems to Support Reproductive Justice, a very awesome transition of what we just heard and experienced. As you can tell, I am so excited to co-moderate today's panel with Zakiya Sorensen, my fellow BMCH Alliance colleague and one of our community's change makers and critical voices in the birth justice movement. We are proud to introduce three of Wisconsin's most committed leaders and advocates for reproductive justice and Black maternal and child health, who also happen to be our colleagues in the movement. Zakiya, please do us the honor of introducing our esteemed panel.
Thank you so much, Carla. I appreciate that. It's such a pleasure to be here today. I also am just taking in all of the amazing and beautiful things that we've been hearing and listening to today. With us this afternoon, we have Dr. Jasmine Zapata, who is Wisconsin's Chief Medical Officer and State Epidemiologist for Maternal and Child Health and Chronic Diseases at the Wisconsin Department of Health Services. She is also an award-winning author, public health strategist, and researcher. Dr. Zapata is a double board certified in the fields of pediatrics and preventative medicine and works as a UW newborn nursery hospitalist. She also serves as an assistant professor at the University of Wisconsin School of Medicine and Public Health and UW Health. And next we have Dr. Jill Denson. She is the director of the University of Wisconsin-Madison Prevention Research Center, where she engages researchers, community members, and translational partners in expanding community-based prevention research and health promotion to improve the health of women, infants, and families. She is passionate about maternal and child health, sexual and reproductive health, and health equity, with a focus on examining how social and structural drivers affect health outcomes. And last but not least is Courtney Hayward. She's the Director of Government Relations with Planned Parenthood Advocates of Wisconsin and serves as the registered lobbyist using her knowledge of policy issues and the inner workings of government to influence legislation at state and local levels. She also uses her role at Planned Parenthood Advocates to share her knowledge of Wisconsin politics with Black-led organizations in order to bring more individuals and groups from the community into the advocacy and policy space. Thank you all so much for being here with us today. We so appreciate your time and expertise. I'm going to get right into it because I know we need to make sure we can get in as many questions as possible. And so just talking and looking at your bios, we have such a diverse panel today. Can you please share with us a little bit about your work and role in Black maternal and child health and reproductive justice spaces? And we'll start with you, Dr. Zapata.
All right. So excited to be here for this closing panel. I would describe myself as a pioneer, a change agent, coming into spaces to just shake things up so that we can have equity in our birth outcomes, so that Black birthing people don't have to be afraid to go in the hospitals, so that we can have funding and education and policies that serve our needs. That's what I do. And I have a lot of different avenues in which I do that. People say, oh, you have so many different roles. No, it's all one role so that we can have positive birth outcomes. And I just do that in a variety of different ways. So I serve as the first Black chief medical officer at the Wisconsin Department of Health Services. And just so excited to be there. In that role, I'm the state epidemiologist for maternal and child health and chronic diseases. So I'm able to work on a statewide level, but also interact with federal agencies to talk about ways we can have equitable birth outcomes in Wisconsin. And then also, as far as boots on the ground, I work as a newborn nursery doctor. I get to run to deliveries. So when babies come out and they're not breathing or they're having difficulty in the C-section or something like that, I get a page, I run to those deliveries and I help resuscitate those babies, round on newborn babies. I get the honor and privilege to get to work with new moms and parents on how to take care of their babies. And I just absolutely love what I do. So I do other things as well, but those are the main two things related to this. And I am just so excited to have this conversation.
Well, those two things are a lot by themselves. Thank you, Dr. Zapata. Dr. Denson, can you tell us a little bit about yourself and your role in Black maternal child health and reproductive justice spaces?
Whenever I'm in the space with Dr. Zapata, she always she brings up the energy, right? Like when you're exhausted, she just brings you up. I would say that I have always been interested I'm a Black feminist, so always been very interested in women's issues and children's issues. And so when I started my career off as a social worker in Milwaukee a couple of decades ago, that was just my natural attraction. So when you work with, women and their families, you end up in the maternal space, maternal health space. And I was just really floored by the experiences of pregnant and postpartum women and the erasure of Black men that accompanied them when I did home visits or saw them in the clinic, but they were pretty much erased from the system. And just how our family system, it was so easy for our family systems to be totally broken up. Like one mistake, one misunderstanding, and somebody could lose their child, or they could be incarcerated, or the dad could be completely, out of the child's life. And this was all very, very shocking to me. And I worked in, many different areas. But what really changed my focus is when I learned about reproductive justice. Never heard about it in Milwaukee and through school, through work, never heard about it. Went to a national conference and there was a panel on reproductive justice. And I was all in. I was like, you're speaking my language. I've never heard of this. And it just really helped the way that I thought. It shaped my work with people and it shaped how I want to go on and further my education.
That is beautiful. I hear you on the not learning about reproductive justice until later on in your career, and the same thing happened to me as a nurse. So I hear you on that. What about you, Courtney? What has brought you into this space in reproductive justice and Black maternal child health spaces?
Awesome. Hi. Thank y'all for having me today, first of all. But I've been in my role at Planned Parenthood for the past 4 years. My background is in grants and fundraising. So I started off working with a lot of nonprofit organizations and making sure that they had access to resources to do their programming. And one of the things that I learned through my work in nonprofit is that a lot of nonprofits treat like symptoms of the problems, but didn't really get to the root of the problem. And there was like a reckoning at some point in my career where I realized that I wanted to like eliminate some of the problems in the Black community, specifically those that affect Black women. And so I made the transition into policy work. And so that's when I started working at Planned Parenthood. Now, I work at a white organization. We are a white-led organization. A lot of our leaders are white. However, being a Black person coming into this space, I wanted to ensure that the priorities of my community still remain at the forefront, right? Because I'm still a Black woman, and I still care about the things that affect my Black community. And so when I came into this space, I made it clear to my supervisors that like, yes, I will, champion abortion rights because I do believe that that is also an important aspect of being free as a Black woman in this country. But there are other issues that affect my community that I also want to advocate for. And so part of my work is legislation and policy, but also candidates. So when we are not, in the regular legislative session, I work on campaign work and doing candidate recruitment. It's also important for me to see more Black people in the Capitol, in these offices, because they are going to be the ones that champion our issues. They're going to be the one moving the policy initiatives forward. And so doing both sides of making sure that the elected officials who are Black or white are held accountable when they are elected is one thing, but it's also making sure that we have representation at the table. And then also making sure that like our voices are heard. I know I work for a white-led organization, and oftentimes when I go to these white elected officials, they're like, yep, you are here to represent Planned Parenthood. So sometimes my voice is not always heard, which is fine because that allows me to connect with well, not real, but Black women who are in the work, in the movement, who are doing the actual work on the grounds, and being able to bring them into the spaces so that their voices are heard in spaces that were otherwise not necessarily heard. So using the power of this white-led organization to uplift and magnify the voices of Black women.
I want to thank you all for sharing with us what kind of changed your mood, the piece of your movement, and the why. And so this next question is the theme of our this year's summit is building our collective power to secure reproductive justice. One of the basic tenets of RJ movement, has established by Black women in 1994, is the right to have a child and to parent our children in safe and healthy environments. Speak to how this basic right for Black women to safely carry and birth a child has been threatened in the United States, and what we must do at that systems and policy level to secure this tenet. And that question B is, how are the systems or organizations you represent working to address this basic right for Black women and birthing people? And this is a question for all three of you all. So who would like to get started first? Okay, I'll choose. Go ahead, Dr. Jill.
Thank you, Carla. I think Dr. Karen Scott did an excellent job of giving us a historical framework. And whenever I talk to people, I think that that historical framework is very important. We don't get to 2024 without getting to like 1619. So, our history is very important, how we came here. So when you can't enslave a person and treat them like a human being, right? You can't justify that to yourself that these are human beings in order to enslave them for generations and to profit from them and to destroy their families and their bodies. You just can't do that. And so the legacy of, and I hate, especially when Black people talk about, oh, slavery was a long time ago. We're still feeling those ramifications. And, post-slavery, there was Jim Crow and everything else that came behind that. And it's just, it's unfortunate that in 2024, we're still convincing people to treat us in a human justice framework as human beings. So that right there is the problem. So, it never ended. It just looks a little different. That's it. For part two of that question, I think what Courtney said, one thing that Courtney said, like many of us, especially if you are in Wisconsin, most of these organizations, these systems are very white led, right? We live in the United States. We in particular in Wisconsin, live in an area that there's less political power for people of color, specifically Black people. So I think that we need Black people in all levels. So from grassroots, all the way up and working in the governor's office, right? We need to work in all different systems, and we need to bring our intersectional identities with us. And we need to have that framework that we need to shift culture, that we need to dismantle systems. And in order to do that, we need our white allies. We need people who are not within our systems to support us. And we need to be strategic about that. And these systems, as Dr. Scott said, and everybody else afterwards, these systems were not made for Black people, right? They were not made to protect, support, to love on Black people. They weren't in the past. They won't be in the future. They're not now. So we need to recognize that. And know that when shift happens, it's exhausting. You have to bring your full self. You cannot allow yourself to be whitewashed. You have to do beat at it from your little niche. I'm doing it, Courtney doing it, Dr. Spot is doing it. We're all doing it. And we are the people within the systems. But the systems are not embracing us either. They don't want to listen to us either. They want any power, education, positionality we have, they want to diminish that. But we can't allow that. And so again, we need that support from our whole community. And you have to keep going one day after the other to change the systems that are not wanting us to change and will not benefit from changing. So we'll benefit, but they won't benefit. It'll take some of the privilege from them, and that's not something that they want to give up. So I think just being cognizant of that.
Thank you, Dr. Jill. Courtney, you want to chime in?
Yes, ma'am. So for me, I work in politics, right? Like that is my world day in and day out. And so my perspective is getting more involved in politics. And it's not just at the ballot box, for the president in November, every 4 years. It's so many decisions that are made, even at the local level, that we are not like getting involved in. Like we don't vote a lot in our like local elections, and that's where a lot of the decisions that affect our everyday lives are happening. And so for Planned Parenthood, a big part of what we do in my department is educating our supporters and the public about the issues and those decisions that are being made on the policy level that affect our everyday lives. Because a lot of times people are like, well, we didn't know that the county government controlled the health department and they allocate the resources to the different nonprofit organizations that do the work. And oftentimes, you know, we elect the county exec, but nobody's like really paying attention to the actual role of the county executive and the budgetary things that he's allowed to do. And so for us at Planned Parenthood, we do educate people, even in like races that we don't even get involved in. A lot of our resources are put behind educating the public on the issues that are happening at the local level and at the state level. Because a lot of times, like, laws will get signed into law and people are not paying attention to them until they affect us, and we start feeling the real effects of them. And so having organizations like Planned Parenthood that has a reach and educating people that, like, hey, do y'all know that these people are trying to take more rights away from you? You need to be contacting your legislators and telling them, like, no, don't do that. Because at the end of the day, the legislators they work for you and they're supposed to listen to you. And so from my perspective, like, the way to like dismantle all of these systems is not just voting, but also like really paying attention to what's happening in these different levels of government and knowing that you as an individual can make an impact. Lisa Payton Care is a prime example of somebody who is making an impact. And I'll give you an example. Postpartum expansion is probably one legislative session away from getting passed. Why? Because I work with the contract lobbyists to get Lisa Payton Care in front of some Republicans, and Lisa decided to tell them the stories. And she said that this affects Black women, and not just Black women, but women all across the state. And now we have bipartisan support. 2/3 of Wisconsin state legislature is now supporting an initiative that was otherwise only looked at as a Democrat issue, because we got her in front of some legislators and she made an impact. She got these people to listen to her. And so that's what I mean. Like, getting involved in politics doesn't necessarily mean just like running for office, but really paying attention to what's happening at these different levels of government, and speaking up and speaking out and helping to educate the people around you about what's happening.
Awesome. Thank you. Thank you, Courtney, Dr. Jill. Dr. Jasmine, your comments.
Everything they said.
I know, right? But I know you have a comment. I know you have a comment.
Man, I'll just be honest with, when the question was asked, how have you seen reproductive justice not happen in the threats to Black birthing people? The first images that pop in my mind, I'm just instantly taken back to hospital rooms. I'll never forget, and this wasn't even me being a doctor, it was me going to my own birthing hospital as a friend and a colleague of someone who went into, a Black woman who went into labor at 22 weeks, and they couldn't stop the labor, and that baby was born and only survived an hour or two. And just seeing that devastation, being a part of that, those are the things. And I have so many other stories, but we're celebrating here. I don't want to bring up some of those negative memories, but that's real and that's raw. When I think of how is our system failing, why does that experience have to happen to Black women and birthing people at such higher rates? It's not fair. It's devastating. We've had people talk in here about their own losses, and it's just not fair. So that's really what I see stories. I'm in patient rooms. I'm seeing parents have to lose children. I'm seeing just devastation, and it's not fair. So that is what it looks like to me, outside of all the different policy and things like that. That's what it looks like. I'm thinking of the actual stories and actual people's faces. It's more than just statistics. There's real lives impacted. And what needs to change? We need to recognize that we need to all put together our collective power to make a change. We need to realize that, despite all of the implicit bias trainings that we want to implement into systems and in legislation and hospitals, the reality is that there's some people who's never going to change. That implicit bias is always going to be there. I know that's hard to sometimes say, but it's real. So we need to figure out, despite your implicit bias, how can we get people in positions of power where, despite any racism you have, implicit bias you might have, we're going to be able to still save our own people. So that includes increasing diversity in the healthcare workspaces, in the legislative spaces, people with decision-making power, and a lot more. But I'll stop there, but it's gonna take a lot. Everything they said, but that one too. Sometimes people with implicit bias, nothing's gonna change them. We have to figure out ways to navigate around that.
All of that so true. Thank you all for those really robust answers. The next question that we have, I think Jill, you were talking a little bit about it, intersectionality. And so this next question is addressing intersectionality, and this is a lens that is integral to reproductive justice. And as Dr. Kimberly Crenshaw, who turned the coin term, states, intersectionality is a lens through which you can see where power comes and collides and where it interlocks and intersects. And we know it examines relationships between coexisting identities and systems of oppression, and that each of us have pieces of our identity that leave us exposed or vulnerable to oppressive systems. So reproductive justice addresses the full spectrum of reproductive freedom and care, including the right to bodily autonomy, the right to have a child, the right to not have a child, and the right to parent a child in safe and healthy environments. Can y'all briefly break down the intersection of reproductive justice and Black maternal and child health disparities? And Courtney, I'll start with you.
Yeah. So again, my workplace at Planned Parenthood, everybody kind of knows us as like the abortion clinic, but like the work that we do is so much more than that, because we understand that the patients that we serve have these complex identities, right? So we don't just see, you know, a certain type of individual that walks through our doors. We see Black, white, brown, purple, orange, rich, poor people, people with insurance, people who don't have insurance, from different social demographics. And so as a result of that, the policy initiatives that we often get involved with, we have people asking us questions about like, why are y'all touching that? Like, why do y'all care about voter access protections? Or why do y'all care about access to even birth control? Sometimes people even ask us about. And it's because like, we're not just that abortion clinic where we want people to make the decision about when they become parents. It's not just about like whether or not to have a baby or not. It's the birth control will prevent you from having a baby until you're ready. And caring about those things and advocating for those things is how we show people that we care about the whole person. We also get involved in like environmental justice. We briefly touched or kind of touch on like criminal justice issues, especially as it relates to the Black and brown community in Wisconsin, because these are parts of the identities of the patients that we serve. And so we just believe that to be a happy and healthy individual and thriving individual in a state like Wisconsin, you need to be free from all systems of oppression and not just like, you know, certain ones or certain specific ones. We don't necessarily lead the charge on all of these initiatives, but we do support the organizations by using the power that we have to give them access to more power to move their initiatives forward.
Sorry about that. Thank you. Can we, Dr. Zapata, can we hear from you?
Yes, I agree with all that. And another thing that comes to mind when we talk about the intersection of reproductive justice and Black birthing outcomes, I had the honor of getting to meet Miss Loretta Ross, and she mentioned something that was just so profound to me as it relates to this area. She mentioned, and I see this come to play all the time, and this is another area of advocacy or an area that we need policies changed on. And she said that if we want to see a change in outcomes for Black birthing people, we need to turn a lens to the inhumane treatment of medical providers. Okay? So if you think about it, if you were treated in an inhumane way, if you are under stress, if you are working 80+ hour work weeks, if you're working 24-hour plus shifts, this is what the healthcare system, what we're doing right now. And then you are stressed out, you're burned out, you're feeling undervalued. And then you have to come in under intense pressure and stress and walk into a room. You're going to be rushed. You're going to be irritated. You're going to make mistakes. You're going to let your implicit bias come. And that is an area that I don't hear us talking about enough to link the two. And I've been through medical training, and it is a lot. And there's a lot that we don't talk about, because in the medical profession, we like to kind of, almost like I feel like police officers do, protect each other. But I'm here to shake stuff up, just talk about it. There's a lot of things that we need to reform within the healthcare system, the way that medical residents are treated, the hours that people are working is there's a lot of medical errors that go on. So anyway, one area of advocacy and how I see that intersectionality, like in the reproductive justice movement, we have to look at what inhumane things are going on in the way that our professionals in the hospitals that you're interacting with, what is their story? What's going on behind the scenes? So there's a lot of reform and policy things that can go on there, but I think it's important to link those two things together. It's more than just the implicit bias training. Let's have a conversation about why some of these inequities are happening in the training behind the scenes.
So true. I really appreciate you bringing that to the forefront, Dr. Zapata. It's one of the things I remember, like being a nurse on the floor and the saying that nurses eat their young, right? And it's like we have to think about the culture that we create in the medical care system as well, and how that impacts our patient care and what it does to us on top of that. I appreciate that. Dr. Denson, what about you?
I think that we have to, amongst ourselves and, in the community, realize that Black people are not a monolithic group. We're just as complex and nuanced, from diverse backgrounds as any other group. But I think that one thing that we have in common is that, like no other group, Black people are most affected by multiple intersecting oppressive identities. And I think how that intersects with health disparities is, for most groups, or all groups probably except Black people, income and education are not protective factors for us. And how that shows up in health disparities is you can have, a well-educated, well-resourced Black woman, and she's more likely to have a poor birth outcome than a white woman who didn't finish high school. Or since mankind, people have been sleeping with their babies, right? That is like a universal thing. People do that in every country you can think of. No matter what your background, what your race, is super common. But why are Black babies dying more in co-sleep situations? Why is it that racial disparity there? And I think we spent a lot of time talking about, oh, we need a pack and play, we need a crib. But my question will always be, why is it Black babies who are dying in this situation when we know every night across the world this is a common practice? So I think for me, that is how it intersects with at least racial health disparities, and questions we need to keep asking ourselves and not stop until we can get those answers.
Thank you, Dr. Jill. I want to thank my partner or leader at the DHS. I team up with her on our maternal mortality review team, Dr. Zapata, the one shaking up the white coats. I'm gonna start calling you shaking up the white coats. As a medical doctor, pediatrician, state health officer, mother, and advocate, you have a unique perspective on the broad terrain of policy and practice, right? How must clinicians, policymakers, advocates, and researchers expand their understanding of what this is about, Black maternal child health, the landscape, and all of the factors shaping Black birth outcomes to be more effective in driving impactful solutions that eliminate racial birth disparities for good? How do we do that?
You said keep the answer concise. You can't ask me that big question, say, how do we do that, and keep my answer short. But there's so much.
We're on a tight time schedule.
I know. I'm just giving you a hard time. One area to broaden it, or what one area that we need to continue to focus on for all those groups that you mentioned is remembering that this is a life course and a generational issue. So a lot of our efforts, our funding, our policy, the money, the conversation surrounds after a person knows that they're pregnant, like pregnancy, delivery, postpartum, okay? And in many situations, I mentioned this at the press conference a few days ago, it's wonderful that we're focusing on there. We have to keep our efforts there, keep all the dollars and the funding. We need to focus beyond that. All that same effort needs to start going toward prevention. We need to be talking with our 9, 10, 11-year-olds about their bodies, navigating the healthcare system, reproductive choices, how to heal after trauma. We have adverse childhood experiences. We know that when children under 18 face adverse childhood experiences, such as seeing a parent leave the home, witnessing abuse in the home, witnessing any types of trauma, that makes them at higher rates for mental health disorders, substance use, overdose, adverse birth outcomes 10, 15, 20 years later in life. I just want you to think about some of our babies right now, some of the young girls and boys, some of our young babies, the trauma they've collectively witnessed, even living through COVID. That's going to be the statistics we're talking about in 15, 20 years. We need to be talking about how can they cope? How can they heal from that trauma? But why were they in many of the positions that they were? You talk about that intergenerational impact. A lot of our focus is like on the right now. And there's I don't want to say no, but there is not enough sustained focused effort on, okay, how do we focus on prevention? What are we going to be doing right now for these 3, 4, 5-year-olds right now who the things that are happening in their lives right now, that's what's going to be driving our birth outcome statistics. We can't wait until they're pregnant and the baby's coming out premature and give them a doula, and that's going to solve everything. I love doulas. Doula's going to help the immediate crisis, but we're missing it. So that's one area, just looking at the broad generational and life course perspective. That's one thing from an advocacy policy perspective. I think that would make a big difference and we could focus even more on.
Thank you.
Thank you, Dr. Zapata. I love the life course model or way or framework of looking at that and so effective. My next question is for Dr. Jill Denson. So you've worked across public health and academia, where I've gotten to work with you and still get to work with you. So yay for me. And you've worked in state leadership and policy and as a partner and representative for organizations like Black Mamas Matter Alliance, a leader in national birth justice advocacy, and the founders of Black Maternal Health Week. What is the single most important action or solution you see happening from your vantage point that yields the most promise to ending the Black maternal health crisis?
Well, as you know, there is not one single answer to that, but I would say there has been no significant movement without centering and activating the people. And I think we've seen that, like being a part of Black Mamas Matter Alliance, working with people from across the country, I see how in such a little time, like maternal mortality is like, everybody knows about it. And I would say like 10 years ago, we didn't think it was a problem here. We didn't know it was a problem here in the United States. And it's these grassroots folks, activists in their own communities, research activists, physician activists, is these people who have insisted that there be change that's happened, all around the country. And I'm super, super, super proud of Wisconsin that we have like mobilized people from grassroots up, and we are working and we are insisting on change through the ballot box, through our neighborhoods, through insisting on change in within the systems that we work with and that we have to go to for our healthcare. And I really think it's activating the people because we have the power.
Awesome. Thank you, Dr. Denson. Activating the people. I love that. And in activation, Courtney, this is, I think, is going to be our last question, trying to keep us on time. We know you in the community as a policymaker. We know you going down to the state capitol. The community knows that about you. So I'm just going to kind of squeeze this question in. As your government relations director at Planned Parenthood, share with us the priorities in the space of Black maternal and child health, but also can you quickly also share how Planned Parenthood is mobilizing to protect and restore reproductive freedom in the current hostile political climate in Wisconsin and a growing number of states in the aftermath of the overturn of Roe versus Wade?
Okay. So as a director of government relations, my job is to set our policy agenda for the next legislative session. And right now I have two buckets. One is protecting and expanding access to abortion in Wisconsin. Y'all, we are one bad election away from ending up like Texas or my home state of Florida, where abortion access will be stripped completely away or making it impossible for people to access that care in Wisconsin. And so I work on, making sure people who we are supporting in elections are going to champion expanding and protecting abortion access in Wisconsin. But then the other bucket that I'm working on is creating our health equity policy agenda. It is, again, as a Black woman, it is super important for me to not only advocate for this one issue, but also the big issue that affects my community. Things that I am putting into that agenda includes things like making sure that postpartum expansion get passed next legislative session, hopefully within the first 90 days. The sex ed policy that I think that Dr. Zapata alluded to, Wisconsin is one of the worst states for sex ed policy in the country. Our sex ed policy mirrors Mississippi, which means that it doesn't have to be medically accurate. They have to, promote abstinence first and a whole lot of archaic concepts that just don't resonate with kids. And we agree at Planned Parenthood that kids need the right information so that they can make the right decisions. And so a big part of my advocacy will be to not only set this agenda, but making sure that we support candidates and people who are going to advance this agenda once the election is over. And then I will be working with those candidates and those elected officials next January to make sure that some of these policies are not just talked about during an election because it sounds good, but also are getting signed into law by the governor. And so a big part of our organization's focus going forward is not only setting this policy agenda, but also educating the public on what this policy agenda is so that they are aware and they could join in with us in this fight so that these policy pieces that will transform the community, the Black community especially, will actually take into effect so we can see the systemic changes that we need to have happen in this state.
Thank you, Courtney. Thank you so much. As a resident, no, not a resident quite, but as someone that is now living in Texas, as a board member of the Foundation of Black Women's Wellness, being in the fight in Wisconsin and at the fight in Texas, I'm looking forward to the fight of continuing our innovation and our push for reproductive justice for our people. So I just, on behalf of Zakia and we just want to thank Dr. Zapata, Dr. Denson, and you, Courtney, for joining us today, for sharing your wisdom, your knowledge, and for firing us up to stay the course, to keep going, to keep doing the thing. As Lisa just, she just keeps pushing. We got to do it. And who cannot stand behind Lisa Payton Care? So now back to Lisa Gay Michaela from the Foundation of Black Women's Wellness team to wrap up this powerful, incredible, amazing, everything day. I turn it back over to them.
Oh my goodness. You know what, you guys lit up the energy in the room. I know every time that Mama Carla, Zakia, Dr. Zapata, Dr. Denson, and Courtney step onto the stage, we are going to take it higher, just as all of our panelists and keynote speakers have done today. You all were especially needed at the end of this day, and everybody was glowing. And this panel was so personal because each one of us have worked together personally on many, many aspects of this reproductive justice journey. And I know your work as you know mine and so many women on this call, and I just bow and give honor to each one of you for all your contributions, past, present, and of course, future, because we continue to do the work, and it's an honor to do it together with all of you. Thank you to this panel. Let's clap them up in the chat. Let's see that love. Let's see that celebration. And for our previous chat, our previous panel, oh my goodness, the birth worker panel with midwives and doulas, so powerful. I don't want to name the panels because I'll forget. It's been a long day, but just to say Teresa, Rasha, whose name
Tony.
I'm forgetting?
Tony.
Tony, oh my goodness. I could have listened to you all day, and what beautiful moderation and facilitation by Michaela and Tamara. We've been blessed today. And I hope you're feeling the power. I hope you're feeling the power of what we deliver in this space each year and what you bring into this space. But
Yes.
all of you bring into this space in your own efforts and your contributions, you're sharing your ideas about how we connect when we leave this place, all the information that's fired off in the chat, and the way we are here to collectively create solutions. I hear solutions in the chat. I hear support in the chat. I hear celebration in the chat. I see empathy in the chat, all the things that make a healthy, strong community. And that is what we're building here in Wisconsin to advance the work of reproductive justice and birth equity. And to close out our day, thank you again, Mama Carla, Zakia, our other distinguished panelists for wrapping us up, taking us here. And now we're going to move on with two of the amazing, amazing leaders here at the Foundation for Black Women's Wellness. You've seen them today. Many of you know them. If you don't, Google them. Learn more about Gabe Doyle, our Chief Health Initiatives Officer, and Michaela Berry-Smith, our Senior Manager for Maternal and Community Health Initiatives. Both in their own right brought work and leadership to their role that precedes their time at the foundation, and we have just grown with their presence in this space of reproductive justice, maternal and child health, birth equity, policy advocacy. We do it all here at the foundation. We do it with partners, as you've heard. We don't go alone. We reach out, we do it together. That's the solution for how we transform Wisconsin and all the communities that are represented in this forum today. Together, together, together. Black women and men, Black families, communities, Black folks, allies, whoever you are. You heard us say it today. Everybody has a stake in this work. Everybody has a role. And I love seeing the presence of folks from a broad spectrum of our community today, offering solutions, making themselves known, sharing about the work, processing how you're grappling with these issues and your systems. That is the best way to delve into this work. Let's stay connected. So grateful for you to be here. Gabe and Michaela, in our last few minutes, what time is it? 2:51. We got 9 minutes to process together all the richness that has transpired in this space today. And we want you all to put in the chat what rises to the top for you, what messages from all of our speakers from this morning, from our opening national panel, fabulous national panel.
Yes.
Perspective, solutions being offered. For our keynote, Dr. Scott, incredible insight into systems and reproductive justice and the intersection and tools we need to use to really assess quality that are centered on patients and people and not systems and data, or the data needs to reflect what people are experiencing. So many pieces. And of course, we've talked about our afternoon panels. And of course, I'm missing one from this morning. But all of that, what rises to the top for you in the chat. Let us hear what impacted you the most. What are you taking away with you today? And Gabe, I'm going to ask you and Michaela, what stood out for you throughout this day?
I mean, what didn't stand out to us throughout the day, right? Like, I mean, this summit, you know, again, is a national space for Black women and leaders in Black maternal health and reproductive justice to come together and really be in community. I think, you know, we started off today hearing the concept of reproductive justice is like a 4x100 relay. You need your team. You need to do your part when the baton is passed to you. And you absolutely need to prioritize your own self-care and rest when it's time for you to pass the baton on to somebody else. And I think that message really carried through today. This work is collective. If we didn't have these disparities across multiple generations, this problem would have been solved a long time ago. This is going to take collective work and thinking about the way that we measure the success of this work and prioritize Black women and as the leaders of this work for us to finally shift the tides that have been crushing us over generations. And so that was the first thing that really stood out. And I'm trying to be mindful to not be long-winded, but I got a whole sheet in front of me. But I will pass it to you, Michaela, to maybe share one of your thoughts. But
yeah, I mean, there's just so much that was lifted up today. And what I really want to highlight with our 4th annual summit is the joy that was consistent throughout the day. It was so celebratory to talk about the solutions and the things that are changing and shifting. I definitely feel a shift. We know that these issues and problems are not just 20 years old. This is 450 years old. It's historical. And so to talk about the joy and to put the trust back into the Black community, back into ourselves and say, we are enough. We know what we need. But the biggest thing that stood out to me was that the standard of care might be met, but the standard of care can still be harmful. That was huge because we at the foundation take pride in the standard of practice in our care coordination with our community health workers and our doulas. And so that really was a wonderful challenge to think about, to ensure that the community that we're serving doesn't feel harmed, but that the solutions that we're bringing feels like a warm hug.
And to that point, Michaela, really thinking about the way that we measure that, right? We've been talking about certain measurements, but we really need to think about the psychological safety and how does the patient feel during their time across the perinatal landscape. And, you know, one quote that really speaks to everything we've talked about is, you know, capitalism is killing care, right? I've worked in hospitals and health systems. I've seen the transformation from medical providers at the leadership top to people with MBAs and hospital administration degrees being at the top. And so now you can see the focus being about the bottom line versus the care that is being provided. And so that was another thing that really stood out to me today, which is, you know, we've all known that these systems at times, not every individual, but the systems are sick. And we need to heal systems in order for everyone, especially Black women, to feel like their experience, their history matters when showing up. And something else that I think Dr. Jasmine Zapata really hit home at the end of this, which is, and then of course I just immediately forgot it, but it was such a great point that Dr. Jasmine Zapata had just brought up. So I apologize for that, but it just immediately escaped me. So I'll let that one go. But historically, Black colleges have a great opportunity to be a critical and vital partner in this. We invest in all of those. I think, Lisa, you said top tier or Big Ten colleges. You know, we pour into their endowments. We need to pour into historically Black colleges. My brother is an alumni of Morehouse University or Morehouse College. And, you know, when you go down onto one of those campuses and truly get to experience the joy and the academic excellence that is coming out of historically Black colleges. We need to stop going to the universities that we typically go to, and we need to go to the ones that really are investing in the future of our workforce. And so if we're going to diversify the workforce, let's go find where Black individuals are getting their education and go figure out those partnerships and pathways to diversify the medical arenas in which we play in.
Nothing without us. Nothing without us.
Nothing without us, nothing about us without us. That's our mantra. And with that being said, you know, this time is not on our side today. We're 3 minutes down from close, and we are committed to ending on time and being prompt people. So let's throw up our slide really quick to see just a compilation of what you dropped in the word cloud this morning. Thanks to our tech team who's done an amazing job today for capturing this. These are the words that you shared with us, just a few: thoughtful, unified, powerful, solutions. Yes, energy-rich environment. We were born with it. This has been a shift. Thankful, standing in sister solidarity. We feel represented, worthy, purposeful, monumental moment. I believe that. We believe we're at a monumental moment of shift and awareness and activation driven by Black women, y'all. Come on, let's give it up for Black women who have broke the door down, and Black men who are coming through with us, like the dad doula and Gabe on our very own team, and all the activation opportunity we have. Profound, critical, allies, solutions oriented. It's our time. It's our time. Thank you all for sharing these thoughts. In our last minute, we want to scroll through a few calls to action for you and remind you that tomorrow you will receive an evaluation by email in the morning. And we really need you to answer, to reply, to give us your feedback about today, our summit, what it inspired of you, what stood out to you, and how we can continuously improve this experience as one of the leading spaces and authorities on the topic of Black maternal and child health. These slides are really small for me, team. You know, I'm 52 and these eyes are getting older, but, and then they went away. So let's put them back up and remind folks, there you go. There are many ways to take action. Know your representative. And we're dropping these things in the chat. They've probably been put there this afternoon. Register to vote and remind your family and friends. Votes count. And this is an election year. All of these issues we've talked about are policy that affect your life, your children's lives, your future grandchildren and great-grandchildren. Don't stay at home. Don't sit it out. Please vote and save the date, of course, for Black Women's Wellness Day coming up on Saturday, September 28th. If you think this summit is amazing, think about this summit on steroids and be in the space for Black Women's Wellness Day. Next slide. We also encourage you to commit to talking to 5 friends and colleagues about what you've learned today. There's so much to take away. We know you have notes. We will send the recording out soon to the full registration list so you can go back and retrack all of the great information. Share your feedback on our evaluation in the morning. And of course, if you feel so moved, please understand that to be in this work, to do this work, to maintain an organization that we've built over the last 12 years, to be in the right place at the right time, to do the right work requires your support. So please donate to the Foundation for Black Women's Wellness. It powers this work forward and allows us to have forums like these that we charge $0 for our community to attend. With that being said, oh my goodness, I don't even want to leave the space. But we'll say to you, thank you for joining us today. Thank you for all of the organizations represented here. Thank you to our doulas, our midwives, our birth workers, our lactation specialists, our community health workers, our leaders, change makers, social entrepreneurs. Let us stay encouraged in this work, you all. Let us take the spirit of high energy, positivity, and solutions as we do this work that is sometimes grueling, but sometimes beautiful and oh so necessary. We are the change we seek. We must build our collective power. We started here today and we will continue. We're winning. We're winning. and there ain't stopping us now. We will see you back here next year, and thank you for being with us today. Blessings.
No stopping us now.